All good. Just confirm me about the audio and video if everything is fine, right? Just let me know if everything is all good, and then we can start the session, right? All good. All right, I'm checking from my end. The audio video is fine. All right, I'm checking from my end. Okay, everything is good. All right, everybody. Thank you so much for tuning into this session. And myself, Dr. Moheed Bhati. And this day is very special for me because I just want to thank my family and my friends, right? They have been supporting all through this journey. Yes, and today this day has come, and I'm very delighted to be sharing my knowledge, right, about dermatology through this session. And I really want to thank Med Academy for giving me this opportunity to just come here and have a wonderful evening with you guys. It's going to be really amazing. Yes, so I hope everybody is doing great. Everybody is fine. And yes, I can see your comments as well. It's going to be a very interactive session. Yes, I have planned a lot of things for you. I've been working for this evening a lot. All right, so fine. Uh, Let me just give you a brief overview about how I have planned this session, right? So we all know, right, that PYT are very important. Yes, so what I've done is, yes, uh, over here, yes, you see, these are all the pyts, right? All the pyt topics which are there, right? Straight from 2017 to 2024, right? Everything I have noted it down. Okay, everything I noted it down, everything is here. Okay, all right, ठीक है, हर चीज मैंने जो है यहाँ पे लिखी हुई है, हर चीज यहाँ पर है. Okay, तो बट दिक्कत ये हो जाती है ना, तो what's the problem is actually, that when we have this sort of list, we are fine, like, okay, fine, we will do that. Okay, one thing that we have in our mind, right? Okay, fine, we'll do the PYQs and we are all good. Yes, but the thing is, the examiner, this is where the catch is. Yes, this is where the catch is. That what is the catch? We just do the PYQs and the PYTs, we just have this pseudo feeling, pseudo confidence, right? That okay, fine, we'll be just doing the PYQs and we're good. But the thing is, we have not covered the whole topic. Yes, and this is where subject like dermatology and all small subjects come into play, right? Definitely, we will have 5 questions. Yes, 5 questions we'll have, and I really want to make sure. I really want to make sure, like, you guys get this 5 marks. Okay, so for that, what I've done is, the best way to revise is to, like, compress all the knowledge, right? When I was recording my main videos regarding derma, right, so there was my whole PDF was about 270 pages. Okay, so somehow I had to compress all this info, right? So over here, what I've done is I came up with this idea that is mind maps. Yes, mind maps. Okay, so over here you see, if you just go on with this, yes, right here. Okay, if you read any topic like this, yes, so you see, it is so easy to revise. Yes, because everything is at one page. Yes, and this I have done with all dermatology. Okay, and even in this, right, if you see, I go on with psoriasis. Yes, the very very star topic of derma, right? And even in this, what I've done is I have, covered all these main important words. Yes, so you don't have to remember everything. Definitely, we don't have to remember everything. For example, this one. Okay, over here you see there is a triad we see. Yes, so this I have covered up with the tape. Okay, so this you need to remember. All right, fine. So when just like, in my last 10 days of my revision, when I want to revise psoriasis, this is what I'm gonna do. I'll just be focusing on these labeled things. Okay, so what I've done is I made your and my life easy, and it is easy. Now we can really revise all the topics very easily. Okay, fine. That is all about the overview about how are we gonna go with this, right? And fine, we can just start up with the session. And just a few things. Yes, that we'll be taking a break right at 8 o'clock, and I'm planning to cover the whole dermatology in under 4 hours. Yes, so I hope we are able to do that. For that, my speed is going to be a lot. ठीक है, बहुत fast fast बोलूंगा मैं. All right. Yes, uh, the video is lagging. Okay, let me just see. It's fine. All right, fine. It's fine. It's fine. Okay. All right, fine. Cool. We good, we good. Okay, fine. So, we were just talking about the session, right? So it's gonna be a 4 hour session. So I hope we can cover all of it in under 4 hours. So it's gonna be like a very crisp revision, right? So, uh, let us just start with it. Okay, and PDF is already been provided, so you should get it under in our group in Telegram. Definitely, you should be able to get this PDF. All right, yes. And these are my personal handles, my Telegram, my Instagram, my YouTube, right? So definitely feel free to send a message or anything you have. We can definitely uh, join in, yes, and we can have a good chat over there, yes. So all right, fine. So let us begin, and if we get time, we're gonna come back and we'll discuss the exam strategy as well. Okay, so all right, 7 minutes down, we will start the discussion. Okay, chalo start karte hain, theek hai, and the language is going to be English. Okay, all right. So uh, in the basics of dermatology, I'll be going very fast because the crux of the derma lies in the blistering disorders, papilloscamus disorders, right? All these topics we need to spend more time on. All right, so that is what we're gonna do. Okay, fine. So structure and function of the skin, right? Okay, fine. uh, ठीक है, चलो अभी ये करेंगे हम लोग. The language is gonna be English. All right, fine. ठीक है. स्ट्रक्चर एंड फंक्शन ऑफ स्किन क्या क्या है, ठीक है, सबसे ऊपर के बताओ क्या है ना. एपिडर्मिस है, डर्मिस है, एपिडर्मिस, डर्मिस एंड हाइपोडर्मिस. ठीक है, ये तो हमको सबको पता है. ठीक है, बट इनके फंक्शन क्या है ना. तो नो, कोई भी हमको पूछने नहीं वाला कि व्हाट आर द फंक्शंस, राइट, ऑफ दीज, बट व्हाट इज इंपॉर्टेंट इज टू मेक आवर concepts right. We should know these things, right? So majorly it helps us have a barrier function, right? Barrier function. Okay, it barrier function and permeability. Okay, it helps us in innate immunity as well, right? So because अगर कुछ भी अगर आ रहा है ना, अपने स्किन पे कुछ भी आ रहा है, तो क्या हो रहा है कि स्किन जो है रोक लेती है ना. ठीक है, स्किन जो है रोक लेती है, और it does not enter the systemic circulation. Okay, how about the dermis? Dermis, what it does is, yes, dermis, what it does is, it has these three components. Yes, mainly when we see the structure of the skin, what's going to happen is the vascular lymphatics, and there are going to be a lot of nerve networks in the dermis, right? So if now the clinical correlation comes in, if any fungus infection, right, it is just right over here, do you think it will have any सिस्टमिक मैनिफेस्टेशन? नो, क्योंकि भाई देखो यहाँ पे है, ऊपर ही ऊपर ही है ना. ठीक है, एपिडर्मिस में ही है, क्योंकि देखो जो नर्व नेटवर्क्स है वो तो यहाँ पे है, वास्कुलर लिम्फेटिक्स यहाँ पे है. ठीक है, तो अगर मैं बोलता हूँ कि कोई फंगस इन्फेक्शन है वो डर्मिस में आ रहा है, तब जाके तो भाई वी विल हैव all this manifestation, right? Okay, why? Because of the nerve networks which are lying in the dermis. Okay, all right. How about the next one? We have hypodermis. Hypodermis क्या कर रहा है? Very easy, it provides uh, insulation, right? Insulation it provides, and it helps us in mechanical strength. Yes, okay, that is all about the hypodermis. Okay, fine. Insulation and mechanical integrity, it helps. Okay, so now let us come to the next one right over here. Yes, so one thing about me is I love coffee. Yes, every day, definitely I start my day with coffee, whatever it is, wherever I am. This is the must do thing, right, for me. Okay, and these images you take, right? So this all these images I've taken by myself, so I like photography as well. So that is something I like. So I like to teach and as photography as well, so everything is going hand in hand. Okay, fine. So the reason I'm telling you all these things is, right, because I want to share this mnemonic with you. Okay, what is this mnemonic, right? So whenever now the next topic is going to be, right, so क्या क्या होने वाला है, अभी हम लेयर्स ऑफ स्किन पढ़ेंगे. ठीक है, लेयर्स ऑफ स्किन पढ़ेंगे हम लोग. ठीक है, इसमें क्या होने वाला है कि if you know this, it's become very easy. So what does the mnemonic tell me? Yes, big strong guys love coffee, right? Okay, so that is the mnemonic. ठीक है, ये mnemonic होने वाला है हमारा. Big strong guys love coffee, right? And this statement is very correct. Yes, okay, fine. So now let us just correlate what our mnemonic to this, right? This is something we have to remember. अगर ये वाला डायग्राम आपको समझ गया ना, ठीक है, तो आगे के जितने भी क्लिनिकल कोरिलेशंस आने वाले हैं वो बहुत ही आसान हो जाएंगे हमारे लिए. ठीक है, हम लोग अभी ये डायग्राम पढ़ेंगे, लेयर्स पढ़ेंगे, उसके बाद में हम लोग सेल्स देखेंगे. ठीक है, इसके अंदर कौन से सेल्स हैं, उनमें अगर कोई दिक्कत आ जाती है तो क्या होने वाला है. ठीक है, वही हम देखेंगे. चलो चालू करते हैं यहाँ से, है ना. स्ट्रेटम बेसियल. ठीक है, बिग. Big strong guys love coffee. All right, so that is what is important, right? Big strong guys love coffee. तो क्या क्या होने वाला है ये? Stratum basale, stratum spinosum, stratum germinativum, stratum lucidum and stratum corneum. जितनी भी लेयर दिख रही है यहाँ पे, हम लोग हर एक चीज को डिटेल में पढ़ने वाले, ठीक है ना? तो अभी अब इतना इतना आप देख लीजिए कि किसमें न्यूक्लियस है, किसमें न्यूक्लियस नहीं है, ठीक है? इसमें न्यूक्लियस दिख रहा है आपको? नहीं दिख रहा है ना? अगर इसमें न्यूक्लियस आ जाएगा तो क्या होगा वो, ठीक है? Anybody can answer me this question. Tell me one condition. Tell me, in which has nucleus in stratum corneum. Anybody who know this? Yes. So please be interactive. All right. So keep typing in. Type करते जाइए, ठीक है? मैं आपसे बहुत सारे सवाल पूछने वाला हूँ, ठीक है? Okay. Yes. Anybody who know this? Parakeratosis. Yes. Okay. That the answer is parakeratosis. Okay. All right. Fine. So that is about the layers of the skin. Yes. So that is all about that. Let us also point out the cells as well. Okay. So over here, right, you see there is melanocyte. We have Merkel cell, Langerhans cell, right? Okay. And we have these keratinocytes. Okay. We will learn about everything in each and everything in very detail as well. Okay. Right here. Let us start with the epidermis part, right? Okay, so first up, we should know this, what is the origin of it. The origin is ectoderm. Okay, all right. And the way I have structured all these notes is that in keratosis, no, in parakeratosis. Okay, all right. Abdullah Sheikh, all right. Yeah, in parakeratosis we'll be reading about all the conditions now. Okay, जो भी मैं क्वेश्चन पूछने वाला हूँ ना, ठीक है, हर एक का मैं आंसर दूंगा, ठीक है? All right. And the way I have structured all these notes is that there should be minimum of writing, ठीक है? अगर मैं लिखता जाऊँ ना, ठीक है, अगर मैं लिखता जाऊँ तो होगा क्या कि भाई the lecture is going to be very long, and one thing I don't want to do is I don't want to compromise with my notes. Okay, so if you do these notes all set, your life is set. All right, so this is what I really want to do, that don't never compromise with the notes, because we never know, right, what is the examiner thinking. So the if we अगर हम बहुत ज़्यादा पढ़ेंगे, ठीक है, and we know like our concepts, right, properly, and then there is where the confidence comes in, है ना? Okay, fine. तो चालू करते हैं एपिडर्मिस में, ठीक है? तो इट इज एन एक्टोडर्मल ओरिजिन. ओके, एंड इन दिस देयर आर 2 पॉइंट विच आर वेरी इंपॉर्टेंट, ठीक है? 2 पॉइंट इंपॉर्टेंट है कि रेटिरेजिस एंड पैपिलरी डर्मिस, ठीक है? रेटिरेजिस कहाँ क्या होता है, पैपिलरी डर्मिस क्या होता है, वो हम अभी देख लेते हैं, ठीक है? अभी ये डायग्राम हम समझते हैं, ठीक है? 2 पॉइंट्स ओवर ओनली. रेटिरेजिस क्या है? जो फोल्ड्स ऊपर से नीचे आ रहे हैं ना, जो फोल्ड जो है ऊपर से नीचे आ रहे हैं, दोज आर कॉल्ड एज रेटिरेजिस, ठीक है? इतनी बात समझ गई आपको? ऑलराइट, ठीक है, इतनी बात समझ गई आपको, है ना? रेटिरेजिस जो है वो एपिडर्मिस से जो डर्मिस में आ रहे हैं वो है रेटिरिजिस, ठीक है? तो मैं कैसे याद रखता हूँ, ठीक है, इसको कि रेटे है, आर मतलब रूफ, ऊपर वाला, है ना, ऊपर वाला, ठीक है? रेटिरिजिस जो है ऊपर वाला है, ठीक है? ऑलराइट, दैट इज ऑल अबाउट इट. एंड पैपिलरी डर्मिस इज द अपोजिट, जो नीचे से ऊपर आ रहा है, जो डर्मिस से एपिडर्मिस में जा रहा है वो है पैपिलरी डर्मिस, ठीक है? ओके, सेल्स कौन से होते हैं इसके अंदर, ठीक है? वी हैव कैडिनोसाइट्स, मेलानोसाइट्स, लैंगरहैंस सेल्स एंड मर्कल सेल्स. हर एक सेल के बारे में एक एक के बारे में बताऊंगा आपको, ठीक है? ऑलराइट. नेक्स्ट अप वी हैव स्ट्रैटम कॉर्नियम. अब हम लोग क्या करेंगे, सो जो हमने जो इमेज देखी थी, है ना, बिग स्ट्रॉन्ग गाइस लव कॉफी वाली, हम एक एक लेयर जो है पढ़ने वाले हैं, ठीक है? ऑलराइट, एवरीबॉडी इज गुड, ऑल गुड, या फाइन. स्ट्रैटम कॉर्नियम. ओके, स्ट्रैटम कॉर्नियम में क्या है कि भाई यहाँ पे वी हैव केराटिन. ऑलराइट, द शेप इज फ्लैट. टेल मी, इज देयर एनी न्यूक्लियस और नॉट? इज देयर एनी न्यूक्लियस और नॉट? देयर इज नो न्यूक्लियस. न्यूक्लियस की जरूरत ही नहीं है ना, ठीक है ना? बट अभी क्वेश्चन में पूछ रहा हूँ, ठीक है? ऐसी कौन सी बीमारी है ना, ऐसी कौन सी बीमारी है इन विच कंडीशन देयर इज increase in the turnover rate? Yes, that is the reason we have nucleus in there. Yes, पैराकैरेटिस तो हो गया. पैराकैरेटिस जो है वो कंडीशन का नाम है ना, रिटेंशन ऑफ न्यूक्लियस पैराकैरेटिस. बट इन विच कंडीशन it is? Yes, psoriasis. Yes, Abdullah Sheikh, you are very correct. Psoriasis is the answer. Okay, fine. But yes, definitely yes, psoriasis is the answer. All right, so in which condition we have this? Okay, we can remember this by this mnemonic T's. Okay, yes, psoriasis, eczema, actinic keratosis, seborrheic dermatitis and squamous cell carcinoma. Okay, pretty easy. Yes, nothing much over here, but what is important is, if you know, do you know the concept about this one? Yes, uh, Ahmad Khurshid, yeah, yes, you are very correct. Psoriasis is the answer. Yes, tell me about this one. Yes, actinic keratosis किस में होती है, कौन सी कंडीशन में होती है, ये बताओ, है ना? बाकी सब तो हमको पता है ना? बाकी सब हमको पता है, हम किसमें ये जो चीज़ है वो किसमें होती है बताओ? Anybody? Yes, I'm just waiting. I just wait for like 5 or 7 seconds. There is a little bit of lag. All right. Diarrhea's disease is the answer, right? Diarrhea's disease. We'll be reading this in very great detail. Okay. Diarrhea's disease. Okay. Next up. Any bacterial cause? Not any bacterial cause. No. Okay. This is genetic cause. Okay. Fine. All right. राइट ओवर हियर वी सी स्ट्रैटम लूसिडम। ओके, स्ट्रैटम लूसिडम जो है ये है ना, ये पहली बात तो ये दिस इज अ क्लियर सेल लेयर, ठीक है, इट्स प्रेजेंट इन पाम्स एंड सोल्स। ओके, इट इज अ क्लियर सेल लेयर, इट इज अ क्लियर सेल लेयर एंड प्रेजेंट पाम्स एंड सोल्स। ओके, ठीक है, ऑलराइट, ओके, ऑलराइट, यस चिराग कोहली, ऑलराइट फाइन। स्ट्रैटम ग्रैनुलोसम, ठीक है, इज आल्सो कॉल्ड एज स्ट्रैटम जर्मिनेटिवम। अब यहाँ पर जो है ना मेन एक्शन जो है होने वाला है, ठीक है, स्ट्रैटम यहाँ पे जो ग्रैनुलोसम में है, ठीक है, हो क्या रहा है, यहाँ पर दो तरह के ग्रैनुलोसम को मिलेंगे, केराटोहाइलन ग्रैन्यूल्स एंड लैमिनार ग्रैन्यूल्स। ठीक है, ये जो केराटोहाइलन ग्रैन्यूल्स है वो क्या होने वाला है, दे आर गोना कन्वर्ट प्रोफाइलाग्रिन टू फाइलाग्रिन। ठीक है, दे विल कन्वर्ट प्रोफाइलाग्रिन टू फाइलाग्रिन। ओके, ऑलराइट, इससे क्या होगा कि इट इंक्रीजेस द स्ट्रेंथ। okay, and if there is mutation in this, it will cause this, what is this, tell me, this is ichthyosis vulgaris, है ना, ichthyosis vulgaris। ठीक है, अब बताओ what is the other name of ichthyosis vulgaris? ठीक है, we will be reading about this as well। okay, anybody who know about this ichthyosis vulgaris? Okay, no worries, ठीक है, the answer is fish likes, yes, fish like scale, definitely correct, Abdullah Sheikh, yes, you are very correct। Okay, fish like scale is the answer। okay, yes, so right here when the profilagrine, this point is very important। okay, next up we have is laminar granules, and do tell me, like, you know, if the speed is okay, I want to go more faster, right, because I want to cover a lot of topics, I don't want to compromise with the thing, right? okay, और फास्ट फास्ट बोलूँ मैं, चलेगा क्या? ठीक है, और फास्ट थोड़ा सा है ना, सही रहेगा, वी कैन कवर द होल थिंग वेरी वेरी फास्ट। ओके, ऑल गुड, फाइन सर, ओके फाइन, परफेक्ट, ओके, ठीक है, लैमिनर ग्रैन्यूल्स है ना, इसमें क्या है, देयर आर ऑर्डलाइन बॉडीज, व्हाट दे डू इज दे लुब्रिकेट द स्किन। ठीक है, दे लुब्रिकेट द स्किन, यस, ऑलराइट, ठीक है, what do they do is, how do they lubricate it? They synthesize the lipids। okay, they synthesize lipids। okay, it is nothing but, you know, it is like a skin moisturizer, it is a skin moisturizer। okay, all right, so over here what's going to happen, this condition, in this condition, in which condition it is absent, tell me, कौन से इसमें नहीं होता? yes, एक्जिमा, राइट, एस्टेरोटिक एक्जिमा में ये नहीं होता। ठीक है, हर चीज़ जो है हम डिटेल में पढ़ने वाले हैं अभी। सटम स्पाइनोसम, okay, this in this, the main thing is you should remember is about the desmosomes। over here you see, yes, these are the desmosomes, yes, all right, that is very important। okay, in keratinocyte they are connected by desmosomes। okay, fine, this is one thing which is very important over here, and these are proteins, or we'll talk extensively about it। yes, jitne bhi this acts as antigen, right, when we read about Bullous pemphigoid disease। okay, all right, stratum basal, the very base one, that is the keratinocyte, melanocyte and Merkel cell, three cells are active, and this is the most mitotically active layer। okay, all right, so now we are done with all the layers of the skin, fine, now let's just come with, you know, keratinocytes, yes, right over here, okay, yes, the cells। okay, now we're done with the layers, now we start with the cells। yes, keratinocytes and non-keratinocytes, ठीक है, इसका ectodermal origin, and these are Langerhans cells, Merkel cells and melanocytes। okay, these three things are there। अब बताओ keratinocytes में बताओ, ठीक है, क्या हो रहा है यहाँ पे, यहाँ पे हो रहा है केराटिनाइजेशन। नाउ दिस कंसेप्ट यू नीड टू रिमेंबर इज वेरी क्लियरली। ओके, केराटिनाइजेशन, इससे क्या हो रहा है, वी आर इंक्रीजिंग द स्ट्रेंथ, वी आर इंक्रीजिंग द स्ट्रेंथ ऑफ द सेल। ठीक है, अब बताओ मेरे को एक कॉन्सेप्ट क्या है कि कौन से लेयर में जो है आपको स्ट्रेंथ ज़्यादा चाहिए? एनीबडी हु कैन आंसर दिस? यस, इन विच लेयर वी नीड मैक्सिमम अमाउंट ऑफ स्ट्रेंथ, टेल मी। Yes, in all the layers, right from the stratum basal to stratum corneum, in which layer do we need maximum amount of strength? Yes, in stratum basal, right, minimum, है ना, stratum corneum में आपको maximum amount of strength चाहिए, है ना, ठीक है, okay, so when the cell goes right from stratum basal to stratum corneum, the keratinization occurs। okay, all right, फाइन, ऑलराइट. Next up we have melanocyte. यहाँ पर 2-3 questions are very important here. So if you remember this one sentence I made up over here, your life will be very easy. So बात क्या है कि हमको मेलानोसाइट जो है, ठीक, क्या करता है ये बताइए? इट इम्पार्ट्स कलर, है ना? बट this is like a layman thing. Yes, melanocyte impart color is a layman thing. Okay, actually it is a melanosome, right, which contain melanin. Okay, so if you remember the sentence, that is melanocyte contain melanosome and melanosome contain melanin. ठीक है, अगर आपको ये चीज पता है ना, ठीक है, then it become very easy. Yes, that is the melanocyte, about the melanocyte. Okay, and content is melanosome, that is very important. Over here the markers are very important over. Yes, so it is HMB45, S100 and melanin A. These are used to diagnose melanoma. Yes, okay, yes, all right, fine. This is what we see over here, right? This is a melanocyte. Okay, and this is the question. Color of the skin does not depend on what? Yes, so if we don't know this answer, right, so we would just go ahead and just say, okay, melanocyte, but I'm asking no, right? No, I'm asking yes. So it depends on what? It depends on the melanin production, the number of size of melanosome and the degree of transfer. Okay, all right, yes, yes, very correct, very correctly said. Okay, next up we have the Merkel cell. ठीक है, Merkel cell, definitely we'll talk a lot about this. Yes, it is ectodermal in origin. Okay, and what does it do? Tell me, what does Merkel cell do? इसका function बताओ क्या है ना? Definitely it is written on the screen as well. Yes, but is one very key word that I have not written over here deliberately. What is that? Yes, I'll tell you that when I'm discussing about the cells, right? The receptors in the cell. Okay, here is the next topic. Receptor in the cell. Okay, this is the Merkel cell, Ruffini, Pacinian, and Lesions. Okay, over here we have all of it. Okay, over here, yes, 2-point differentiation is the answer. Yes, definitely, that is correct. 2-point differentiation was the one that I wanted to hear. Very well said, very well said, excellent. Okay, all right. So Merkel cell, ठीक है, yeah, fine. क्या करता है ये? 2-point differentiation. And how do you remember this is? Yes, how I remember this is Merkel, एक लड़का, ऐसे लग रहा है कि लड़के का नाम है ना? तो मर्कल इज द नेम ऑफ अ बॉय, ठीक है, बट द पॉइंट इज मर्कल इज द नेम ऑफ अ ब्लाइंड बॉय. ओके, इन ब्लाइंड पीपल दे रीड थिंग्स बाय ब्रेल. if you if you just catch this thought, right, they read things by braille, then what becomes easy is that blind people are using Merkel cell, and in this we have 2-point differentiation. Right over here you see, this is very easy. Remember, that is Merkel is the name of a blind boy. Okay, best in 2-point differentiation. Okay, fine, take care. Now let us come with Measner's corpuscle. Yes, and the best way to remember is this sentence, that is Miss likes gentle touch or Miss likes soft touch. Okay, this is how you would remember it. Yes, Measner's corpuscle. Okay, and that is the reason you see this is so low frequency and gentle tap. Yes, is what it is, what it does. Okay, how about Ruffini and Pacinian? Tell me, बताओ, Ruffini and Pacinian. एक तो जो है वो स्ट्रेच रिफ्लेक्स करता है ना? यस, दैट इज करेक्ट, दैट पर्ली गर्ल, योर करेक्ट, आंसर इज करेक्ट. रफीनी जो है, एक वन ऑफ इट डज इज इट हेल्प्स इन स्ट्रेच. ओके, टेल मी व्हाट इज दैट? यस, okay, so the Ruffini is the one, right? It's stretch, and the Pacinian corpuscle, which is like deeply situated, it is like it helps in deep touch, deep crude touch. Okay, all right, fine. Right here I have written everything. So it is the most sensitive one, Pacinian. It lies very deep. Okay, and it helps in deep touch, deep or crude touch. Okay, fine. Pacinian fast. Yes, that is correct. Yeah. All right, fine. So next up we have this basement membrane zones. I want to spend like about 2-3 minutes on this, right? Basement membrane zones. If you remember this one diagram, yes, and even if you just understand this one diagram, right, then the bullous diseases becomes very easy. Okay, so let me just start with something right here. This is what you see is, this is an epidermal layer, and this is epidermal layer, and this is the dermis. Okay, fine. So this one is a basal keratinocyte. Okay, basal keratinocyte का जो लास्ट का जो है, ठीक है, वो है ये. ओके, ऑलराइट, फाइन, एवरीथिंग इज लुकिंग गुड. ओके, दिस इज द केराटिनोसाइट एंड दिस इज द डर्मिस पार्ट. ठीक है, ऑलराइट, इतनी बात समझ गए आपको? ये जो है केराटिनोसाइट, ठीक है. अब इस केराटिनोसाइट के अंदर देखो आप, ये जो ये दिख रहे हैं आपको ब्लैक फिलामेंट जो दिख रहे हैं वो है केराटिन इंटरमीडिएट फिलामेंट्स, ठीक है। बट व्हाट इज इंपॉर्टेंट इज दैट व्हाट आर दे गेटिंग अटैच्ड टू, दे आर गेटिंग अटैच्ड टू दिस रेड सेल. Okay, what is this red cell? This is hemidesmosome. Okay, that is hemidesmosome. Okay, all right. And in this hemidesmosome, you see this structure. Yes, this is what is this? Tell me. Anybody who can tell me what is this? Yes, this is the BP1, right? Bullous pemphigoid 1. Yes, Bullous pemphigoid 1. ठीक है. Okay, if this is 1, then what is 2? Tell me. What is 2? Yes, 2 is something right here. 2 is not inside. 2 is outside the hemidesmosome. Okay, that is what we need to remember. Yes, this is outside. Okay, over here you see we have this layer in between, right? This layer is called as lamellin. Okay, lamellin is the one who is which connects the basal keratinocyte to this layer. Okay, ठीक है, lamellin है. और ये जो lamellin है ये दो पार्ट में डिवाइडेड है, ठीक है, जो है लैमिना लूसिडा, लैमिना डेंसा. ठीक है, लैमिना लूसिडा, लैमिना डेंसा, दो चीज में डिवाइडेड है ये, ठीक है. ऑलराइट. And over here you see these fibers. Yes, these fibers, the yellow fibers you see. What are these yellow fibers? Yes, these are the anchoring fibers. Yes, this is very important. Yes, to know this. The location is very important to know. Okay. All right. And over here you see these dots. These yellow fibers which are connected to the blue dots. These are anchoring plugs. Anchoring plugs. Okay. And right at the bottom, what do we have? We have something as dermal connective tissue. Okay. All right. The reason all this story I'm going to tell you is because these things. So if you know, right? Okay, fine. If I tell you बुलियस पेम्फिगॉइड कि भाई एंटीजन किस में बन रहा है, तुमको एग्जैक्टली पता होगा कि भाई एंटीजन किसके अगेंस्ट बन रहा है, ठीक है. इन इफ आई एम टेलिंग यस इन बुलियस पेम्फिगॉइड, टेल मी एनीबडी हु कैन आंसर मी, एनीबडी हु कैन आंसर मी दिस क्वेश्चन कि भाई बुलियस पेम्फिगॉइड में जो है, ठीक है, जो एंटीबॉडीज है दे आर मेड अगेंस्ट विच वन, वन और टू, वन और टू, इतना तो आप लोग बोल सकते हो, है ना, वन या टू. टेल मी anybody who can answer me. All right. Yes. Khalid Ahmed Bhati. That is very right. The answer is both. Both is the answer, right? So one and two both. Yes. So if in the exam, right, we have this option one or two. So the answer will be two. Yes. Okay. The answer will be two. बन तो दोनों से रही है, but two is the one which is more common. Okay. One and two. Two is the one which is more common. ठीक है. In cicatricial pemphigoid, tell me कौन सा है, one या two? इसमें भी टू है, ठीक है. लीनियर आईजीआई डिजीज में कौन सा है, इसमें भी टू ही है, ठीक है. ऑलराइट. बट द लास्ट वन विच इज देयर, राइट, दिस एपिडर्मल बुल्लोसा डिस्ट्रोफिका, ईवीडी जो है, ठीक है, इसमें क्या होता है कि इट इज समथिंग इज एब्सेंट इन दिस. यस, सो this is a very important topic to we should remember it. Yes, it what is absent is the collagen type 7 is absent over here, right? So you see collagen type 7 is absent. Okay, right here you see. ओके, अगर कोलेजन टाइप 7 एब्सेंट होगा तो एंकरिंग फाइबर्स होंगे क्या, नहीं होंगे, ऑब्वियसली नहीं होंगे ना, ठीक है. ठीक है. एंड देयर इज अ डिस्प्यूट रिगार्डिंग विच टाइप ऑफ कोलेजन इट इज देयर. आई हैव चेक्ड इन द फिट्जपैट्रिक टेक्स्ट बुक ऑफ डर्मेटोलॉजी एंड द आंसर इज कोलेजन 7. ओके, सो wherever you see you have to mark 7. Okay, fine. Tell me which is the in this layer which is the predominant one, predominant collagen, what is it? Is collagen type 4. Okay, fine. And what is the weakest part? Yes, in lamina lucida is the weakest part. Yes, simple. Lamina lucida is the weakest part. Fine. So, fine. So over here, these are all the things, right? We just I just told you about. When you are reading the notes, you can definitely go through this. Fine, and these notes are definitely sufficient for it. Next up is the hypodermis. Hypodermis में क्या है भाई, मैकेनिकल इंसुलेशन एंड प्रोवाइड कर रहा था अपने को, ठीक है. फ्रॉम हियर आई विल बी गोइंग ऑन फास्टर, ठीक है. इज इट ओके एवरीबॉडी, ऑल गुड? यस, या फाइन. Okay, fine. So we have over here hypodermis. Yes, hypodermis. What it was doing is it was providing, mechanical strength. Yes, and insulation it was providing. Yes, all right. But inflammation over here, right? This is what it is important. What the inflammation of it is, what actually happens? Yes, it is called as paniculitis. Paniculitis, ठीक है? Paniculitis बोलते हैं इसको. All right, inflammation जो है इसका paniculitis बोलते हैं. But अगर आप इसको देख रहे हो, ये जो डायग्राम है आप इसको देख रहे हो, तो क्या हो रहा है ये, है ना? ओवर हियर यू सी दिस लॉब्यूल्स, है ना, लॉब्यूल दिख रहे हैं हमको, और इसके अंदर जो ग्रे स्पेस दिख रही है ना, तो या तो इन्फ्लेमेशन लॉब्यूल्स की हो सकती है या तो जो ग्रे एरिया है उसकी हो सकती है. सिंपल, है ना, इतनी बात है. तो अगर ये इसकी हो रही है ना, इसकी हो रही है तो हम तो कुछ अलग होगा, यहाँ पे हो रही तो अलग होगा, ठीक है. इन्फ्लेमेशन वुड हैपन इन द लॉब्यूल्स एंड सेप्टा, है ना. तो अगर लॉब्यूल्स की हो रही है तो और इसकी हो रही थी तो बोथ विल हैव डिफरेंट डिफरेंट नेम. तो सेप्टल फॉर सेप्टल paniculitis and lobular paniculitis would be the answer. Okay. All right, fine. Okay, right. Inflammation will cause these two things would happen, that is septal paniculitis and lobular paniculitis. Fine. Okay. Over here you see, everything is important. Okay, fine, no worries. But you have to know these names, right? These names are very important. What is it? It is erythema nodosum and erythema induratum. Okay. Yes. Yeah, yeah, yeah. Okay. Erythema nodosum and erythema induratum. These are the two things that are very important. Yes. Paniculitis. Yes, that's correct. Okay. Microabscess, this is one page that I really want you guys to remember everything around this page. This is a star page, right? Okay, you have to remember, you cannot go to the exam without reading this page. That is the microabscess page. Okay. What is it? It is three things are very important: the type of cells, yes, what is actually happening, and the fancy name of it. Yes, ठीक है, तीन चीज जो है हमको याद रखनी है यहाँ पे. Alright, so eosinophil जो है, eosinophil they are in get accumulated in basement membrane zone in pemphigus vegetans. Okay, pemphigus vegetans, but there is no fancy name for this. Okay, but what is important over here is the lymphocytes. Okay, lymphocytes, which are very important. Yes, lymphocyte, tell me, what is the fancy name? Anybody who know this, the answer would be what? Tell me. Anybody who know this? Lymphocytes. Yeah. Portreous microabscess, right? The answer is Portreous microabscess. Okay, fine. It is seen in which condition? Mycosis fungoides and cutaneous T cell lymphoma. All right. Yes, Sandeep. Very correct. Okay. How about the neutrophils? Yes, in neutrophils you see. Yes, if neutrophils are accumulated in stratum corneum, tell me what is it called as? Okay, Monroe's microabscess. Yes, Monroe's microabscess. Okay, fine. In stratum spinosum, if it is accumulated, what it is called as? Tell me. Anybody who know this? Anybody who know this answer? Yes, what is it? Spongiform pustule of Kogoch, right? This is the answer. Spongiform pustule of Kogoch is the answer in stratum spinosum. This is psoriasis. Yes, we will be reading extensively about this. Okay. In papillary tip, tell me. In papillary tip, if there is microabscess, the cells are getting accumulated. What, in which disease can we see this, sir? Okay, so we can see. Uh, you can see these two microabscesses, that is stratum corneum and stratum spinosum, we can see in psoriasis. Okay, Abdullah Sheikh, that is the answer, psoriasis. I have also written here as well. Okay, fine. And papillary tip microabscess, tell me, in which disease can we see this? We can see this in dermatitis herpetiformis. ठीक है, हम लोग इसके बारे में पढ़ने वाले हैं. ठीक है ना? बहुत एक्सटेंसिव हम लोग पढ़ने वाले हैं. ओके, very interesting topic. Yes, personally ask me, very interesting topic. Yes, fine. Over here we are done with all of basics. Yes, now what is important is we go ahead with the skin conditions. Yes, so I just want to give you a quick correlation of the skin condition. You see over here, this is a wall, it is a brick wall, right? But if I zoom it in, these are, ये क्या है, ये बताओ क्या चीज़ है ये है सीमेंट है, ये जो है, ये ईंटें हैं, ये है ना. ठीक है, दीज आर द ब्रिक्स. ठीक है, और इसके बीच में जो है क्या है, सीमेंट है ना. इसके बीच में क्या है, सीमेंट है. ठीक है, तो अगर हम लोग ऐसे समझ लें कि भाई यही है हमारी स्किन, ठीक है, तो एक्चुअल में क्या होने वाला है कि या तो दिक्कत जो है इसमें हो सकती है ना, सेल्स में दिक्कत हो सकती है, या तो दिक्कत हो सकती है इसके अंदर, जो सीमेंट के अंदर दिक्कत हो सकती है. ठीक है, बट यहाँ पर एक्चुअली बात ये है ना कि सीमेंट बनाने वाला जो है वो भी सेल्स के अंदर ही बैठा है. ठीक है, समझ के, इतनी बात समझ के, आपको सीमेंट बनाने वाला भी जो है सेल्स के अंदर ही बैठा है, उसका नाम क्या है? ठीक है, सो फर्स्ट ऑफ ऑल वी हैव द ए पॉइंट, दैट इज these cells आर कॉल्ड एज keratinocytes. ठीक है, एंड देयर आर बी जो है सीमेंट, क्या है सीमेंट, जो है इंटरसेलुलर लिपिड्स है ना. ठीक है, ऑलराइट. बट कौन बना रहा है ये, कौन बना रहा है ना. ये जो लैमिनर बॉडी जो हमने पढ़ी थी, है ना, ठीक है, जब केराटिनोसाइट पढ़ रहे थे हम, लैमिनर बॉडीज पढ़ी थी, ये लोग जो है बना रहे हैं बैठ के. ठीक है, इतनी बात समझ गई. अब आओ हम लोग देखेंगे कि इंडिविजुअली इसमें दिक्कत क्या हो रही है. ठीक है, ऑलराइट, फाइन. Individually, what problems are gonna happen in this, we will discuss about it. Fine. Okay, this page is very important. Okay, fine, very extremely important page. Destruction in the keratinocyte itself. ठीक है, अगर केराटिनोसाइट जो है हमारी, जो ईंट ही टूट गई है ना, ईंट ही टूट गई कोई वजह से, ठीक है, तो क्या होगा, है ना, ऐसी सिंगल सिंगल ईंट दिखेंगी आपको, है ना. ये सिंगल सिंगल जो ईंट दिख रही है वो, उसी को हम लोग बोलते हैं अकैंथोलाइटिक सेल. ठीक है, ये जो है दिस इज अकेंथोलाइटिक सेल, ठीक है। बट द रीजन कि भाई ये अकेंथोलाइसिस क्यों हो रहा है, दिस इज वेयर द रियल कॉन्सेप्ट कम्स इन, ठीक है। प्राइमरी अकेंथोलाइसिस, सेकेंडरी अकेंथोलाइसिस, ठीक है, जो प्राइमरी में है, ठीक है, दिस इज वेरी इंपॉर्टेंट, ओके, दिस इज वेरी इंपॉर्टेंट टू नो, दैट इज इन प्राइमरी अकेंथोलाइसिस व्हाट इज हैपनिंग इज द प्रॉब्लम इज इन द डेस्मोसोम इटसेल्फ, ठीक है, प्रॉब्लम डेस्मोसोम में इटसेल्फ, खुद में ही दिक्कत है, ठीक है। सेकेंडरी में क्या है कि भाई डेस्मोसोम में दिक्कत नहीं, बाकी सब में कुछ भी दिक्कत हो कोई बात नहीं, ठीक है, ओके। तो जो प्रॉब्लम है डेस्मोसोम इटसेल्फ, ठीक है। डेस्मोसोम क्या कर रहा था, स्ट्रैटम स्पाइनोसम अगर आपको याद होगा, ठीक है, हमने देखा था, मैं आई मेड दिस सेल्स राइट, एंड दो सेल्स वर होल्डिंग ऑन टू ईच अदर, यस, those double shape, I made this the pink color structure, right? What they were doing, they were providing strength, mechanical strength, अगर वो ही नहीं होगा तो क्या होगा, ऐसे ही घूमते रहेंगे सिंगल सिंगल, है ना, ठीक है। ये अकेंथोलाइटिक सेल घूम रहे हैं यहाँ पे सिंगल, बट ये माइंडेड दैट इज सिंगल, ओके, दिस इज नॉट, दीज आर नॉट अक्यूमुलेटेड, दीज आर नॉट क्लम्प्ड, सिंगल सेल है, ठीक है, ओके फाइन। अगर ये सिंगल सेल है तो सेकेंडरी अकेंथोलाइसिस में क्या बोला था मैंने कि भाई जो प्रॉब्लम है वो डेस्मोसोम में नहीं है, डेस्मोसोम के बाहर है ना, ठीक है। कोई भी अगर अलग वजह हो सकती है, डेस्मोसोम के बाहर दिक्कत है, ठीक है। उसमें आप देखिए क्या हो रहा है, सिंगल सेल दिख रहा है कि नहीं दिख रहा आपको, नहीं दिख रहा भाई, क्यों, क्योंकि प्रॉब्लम डेस्मोसोम में नहीं है ना, ठीक है। प्रॉब्लम जो है डेस्मोसोम में नहीं है, डेस्मोसोम के other cells are there, which are there, they that is the problem, all right, fine, yeah, all right. So that this is the one you see, right? If you correlate this with pathology, this is the multinucleate giant cell of herpes, okay, fine। इतनी बात समझ गई आपको, प्राइमरी अकेंथोलाइसिस, सेकेंडरी अकेंथोलाइसिस में बात समझ गई आपको, है ना, ठीक है। डेस्मोसोम्स यहाँ पर है, और यहाँ पर जो है प्रॉब्लम इज नॉट इन द डेस्मोसोम, समवेयर एल्स, okay, yes, okay, fine। The examples are very important over here. We'll come back to this example, right, when we discuss about the topic, okay, so cool। The problems could be in the calcium pump itself। अब बताओ, ठीक है, अगर मैंने बोला था कि प्राइमरी में जो है, ठीक है, दिक्कत होने वाली है, प्राइमरी में जो है दिक्कत होने वाली है, ठीक है, तो किस में होगी, डेस्मोसोम में दिक्कत होगी, ठीक है। in calcium pump for some reason there is deficiency in working in desmosomes, तो क्या होगा, प्राइमरी अकेंथोलाइसिस ही होगा, ठीक है। दैट इज द रीजन यू सी डायरिया डिजीज, हाइले डिजीज, राइट, वेरी इंटरेस्टिंग टॉपिक, दीज टू टॉपिक्स मैंने देखा, मजा आ जाएगा भाई, है ना, ठीक है, बहुत ही जबरदस्त मजा आ जाएगा, दीज टू टॉपिक्स आर वेरी वेरी इंटरेस्टिंग, ओके फाइन। सो एन इंटरसेलुलर लिपिड, सीमेंट में प्रॉब्लम हो रही है, ठीक है। सीमेंट जो क्या कर रहा था, मॉइस्चराइज कर रहा था, है ना, इट कंटेन्स व्हाट, इट कंटेन्स सेरामाइड्स, लिपिड्स, ओके, ऑल राइट, इट कंटेन्स सेरामाइड्स, इट कंटेन्स लिपिड्स, ओके फाइन। ये कौन सी बीमारी में जो है चला जाता है, टेल मी, कौन सी बीमारी में चला जाता है। आई थिंक सबको ये बीमारी के बारे में पता है, बट एक्चुअली बात क्या होती है कि वी डोंट एक्चुअली फोकस मोर ऑन दिस, इट इज लॉस्ट इन एक्जिमा, right, it is lost in eczema, yes। So what actually happens is, अब बताओ, it's very interesting, right, ठीक है। अगर we will just complete all of this in like under 2 minutes if you understand this one thing, ठीक है, yes, very correctly said, yes। अगर स्किन की बैरियर लेयर ही चली गई, ठीक है, सेरामाइड ही चले गए, तो क्या हो गया, स्किन में क्रैक्स हो जाएंगे, ठीक है। अगर स्किन में क्रैक्स हो जाएंगे, ठीक है, बैरियर फंक्शन जो है चला गया, ठीक है, तो क्या होगा, इन्फेक्शन हो सकती है बार बार, ठीक है, इन्फेक्शन बार बार हो सकती है, ठीक है, तो बैरियर फंक्शन इज लॉस्ट, ठीक है। एंड व्हाट हैपेंस इज कि भाई ये तो चला गया, देन जो जो गैप है ना सेल्स के अंदर, ठीक है, दिस इज फिल्ड बाय फ्लूइड, दिस इज फिल्ड बाय सम फ्लूइड, ओके, ऑलराइट, एंड इट इज कॉल्ड एज स्पॉन्जियोसिस, ऑलराइट, एंड दिस इज अ वेरी कैरेक्टरिस्टिक पॉइंट ऑफ एक्जिमा, ठीक है। अगर आपको ये चीज पता है ना, आप लोग कभी भी गलती नहीं करोगे एक्जिमा के अंदर, ठीक है, ओके, ऑलराइट। अब आगे बात इसके अंदर की, ठीक है, अब ये रहे हमारे जो है एलर्जेंस हैं, वायरस हैं जो कि दिक्कत कर रहे हैं ना, तो व्हाट आर वी गोना डू इज, ट्रीटमेंट में हम लोग क्या करने वाले, विल जस्ट अप्लाई मॉइस्चराइजर, ठीक है, विल गिव पेशेंट दिस गुड क्वालिटी ceramides we would give, and all good, okay। What is happening is because of the entry of microorganism, right, there is recurrent infection, okay fine, okay, this is what I'm talking about, right, spongiosis, yes। अगर आपको इतनी बात समझ रही है, देखो इसके अंदर जो है इंटरसेलुलर लिपिड्स नहीं है ना, सीमेंट प्रॉब्लम है, ठीक है। इसी वजह से देखो यहाँ पे मैंने बोला था कि दिस इज अ वेरी कैरेक्टरिस्टिक साइन ऑफ एक्जिमा, स्पॉन्जियोसिस, ठीक है, वेरी 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 क्लियरली सीन राइट हियर, ओके, ऑलराइट फाइन। नेक्स्ट अप वी हैव, सो वी आर डन विद चैप्टर नंबर 1, ओके, ऑल गुड, yes, the I think the speed is good, I will increase the speed more from here, okay fine। लेजन इन द स्किन, अगर आपको ये टेबल समझ गई ना, ठीक है, तो कोई टेंशन ही नहीं है ना, या अगर आपको टेबल समझ गई एंड इट इज ऑल गुड, ओके, ओवर हियर यू सी यस, प्राइमरी स्किन लीजन, सेकेंडरी लीजन एंड स्पेशलाइज्ड स्किन लीजन। ठीक है, प्राइमरी कौन सा होता है, जो कि पहला आया अगर और पहले के ऊपर कोई दिक्कत हो रही, कोई चेंजेस आ रहे हैं उसके अंदर, ठीक है, दैट इज व्हाट इज कॉल्ड एज सेकेंडरी। ओके, सो द चेंजेस व्हिच हैपन फर्स्ट, फर्स्ट चेंज, फर्स्ट फॉर्म वन, ठीक है, दैट इज व्हाट इज कॉल्ड एज प्राइमरी। ओके, सेकेंडरी चेंजेस कौन से हैं, ठीक है, जो उसके ऊपर हो रहा है चेंज, ठीक है, दैट इज व्हाट इज कॉल्ड एज सेकेंडरी वंस। ओके फाइन, ऑलराइट। Next up we have is primary skin lesions. Okay, over here if you give me like 2 minutes, ये जो है आपका, ठीक है, जो टेबल है एकदम, I'll make it like very crisp clear, because myself, I used to get confused in all these vocabularies. Okay, so chapter 1 and 2 are all about vocabularies. Yes. Okay, so if we start from here, right, flat. Yes, if a lesion is flat, okay, and you see the size could be less than 1 or more than 1, you can also take this as 0.5. if you're taking this 0.5, you can also take this as 0.5 as well. Okay, all right, fine. So देखो, अगर ये लीजन, अगर ये जो है फ्लैट है, ठीक है, तो हम लोग क्या देखेंगे, विल लुक अप टू द कलर, ठीक है, या तो वो मैक्यूल होगा या तो पैच होगा, ठीक है, कलर देखेंगे। फ्लैट अगर कोई लीजन होगा, हम उसका कलर देखेंगे, तो लेस देन वन तो मैक्यूल है, मोर देन वन पैच है, ठीक है। अगर वो चीज़ सॉलिड है तो भाई हम देखेंगे कि उठी हुई है क्या नहीं, है ना, उठी हुई है क्या नहीं। अगर वो चीज़ कोई उठी हुई है, ठीक है, लेस देन 1 सेंटीमीटर है, विल कॉल इट एज अ पैप्यूल, ठीक है। नेक्स्ट आप वी हैव, अगर इफ इट इज मोर देन वन, वी कॉल इट एज प्लाग एंड नोड्यूल, ठीक है। ऑलराइट, सो next up we have this fluid fill, right, fluid fill thing is there, क्लियर, राइट, क्लियर फिल होगा या तो फिर उसमें पस भरा होगा, ठीक है, या तो क्लियर होगा या तो पस भरा होगा उसके अंदर। अगर वो क्लियर है, ठीक है, वी वुड कॉल इट एज अ ब्लिस्टर, यस, और अ वेसिकल इफ इट इज लेस देन 1 सेंटीमीटर, ठीक है। इफ इट इज मोर देन 1 सेंटीमीटर, विल कॉल इट एज अ बुल्ला। ओके फाइन, ऑल गुड। यस, इफ इट इज पस फिल्ड less than 1 centimeter, it is pustule, and it is more than 1 centimeter, it is abscess, ठीक है। ओके, pustule and abscess, ठीक है, fine. So एक एक को देखते हैं हम लोग, we do this quickly. Yes, we just did this flat lesions. This is the solid lesions we just did, and I'm not going to go through reading all this again. Okay, we just did the table. Okay, fine. Over here you can see this clear fluid one, right? This is less than 1 centimeter. Okay, all right, and this is bulla. Yes, bulla's pemphigoid, we have this one. Okay, all right. Pus filled, we see this is pustule, and this is, they are the large abscesses. Okay. Next up, we have the extravasation of blood, which is there, petechiae, purpura, and ecchymosis. Okay, what you see over here is 1 to 2 mm. Yes, it is called as petechiae, and purpura would call it as more than 3 mm, and this is ecchymosis. Okay, this is a very important question in forensics as well, right? So, where is the fracture happening? Yes, these are the raccoon eyes, right? Anybody who knows it, these are the raccoon eyes. Okay, all right. Wheels, right, wheels, we have urticaria. Yes, urticaria. What is very interesting about this is, right, tell me, can anybody tell me, what are actually these things? Yes, these wheels which are there, right, so these are red, right, erythematous, yes, they erythematous, pruritic and transient. Yes, okay fine, that would be the characteristic property of wheels. Okay, ठीक है, ये जो यहाँ पे लिखा हुआ मैंने सारा, ठीक है। All right, so these notes that I have made, right, so I don't want to be like writing for a long time. Okay, I just want to make this lecture as compressed as possible. I could be writing, right, for 12 hours straight, no problem. Yes, but it would just waste our time, and the exam is so nearby. Okay, all good. Secondary skin lesions. Okay, so the changes that happen on the on the primary, they are secondary. Okay, okay. So this is something that I'm not going to answer, you guys would be answering it, if that is good. Okay, you guys would be answering this thing. Okay, so tell me, silvery white scales are present in what? Yes, i will I will say it will save time. Yes sir, yes, definitely, Abdullah. This is, that is the reason I made notes this way, that it would just compress our time. Yes, and the notes as well. So yes, psoriasis is the answer. Very well said, very well said. Okay, psoriasis. So tell me, fish like scales, है ना, ठीक है। Yes, Khalid Ahmed Bhati, you are also very correct. All right. That is my father. My father is also in this session as well, right? And I really owe thanks, right, to all my family and friends. And yeah, you're very correct. Ichthyosis, yes. Ichthyosis vulgaris would be the answer. Greasy scales, इसका बताओ, किसी को पता है कैसा greasy scales किसमें दिखने वाले हैं? Tell me, anybody. Psoriasis doesn't have scales. Quality of scales तो होता है ना, ठीक, quality of scales तो होता है ना, ठीक है। हम लोग जब इमेज देखेंगे ना psoriasis वाला, तब मैं आपको दिखाऊंगा ग्रे मैटर, राइट, यस, ओके फाइन, आई शो यू द स्केल्स। ओके फाइन, ग्रीजी स्केल्स किस में होता है, बताओ, सेबोरिक डर्मेटाइटिस, है ना, ठीक है सब, एंड बिकम्स ड्राई, ये बताओ ये किसमें होता है, टेल मी, बिकम्स ड्राई, यस, ठीक है, बिकम्स ड्राई किसमें होता है, एनीबॉडी हु नो दिस, एनीबody who know this becomes dry? I'm sorry, confused. So no, no, it's absolutely fine. No worries. We just learn from each other. No worries. Yes. So becomes dry. बताइए किसमें होता है? Tell me. Yes. Anybody who can tell me? Okay, no worries. Okay, it is lichen planus. Okay, lichen planus. Okay. Colorate of scales. Yes, we would see herald patch. Okay, देखो मैंने herald patch भी लिख दिया यहाँ पे. किसमें होता है ये? Yes, very correct. Herald colorate of scales किसमें देखेंगे हम लोग? Anybody? Yeah. Yes. Pityriasis rosea, right? Okay, yes, Pityriasis rosea. So everything, we will be learning about all these things, right? So when we read about हर एक चीज का, यस, खालिद अहमद, ये वेरी करेक्टली सेड, यस, ओके फाइन। सो ओवर हियर यू सी, यस, यही यही स्केल्स की बात कर रहे हैं ना, ठीक है, ये रहे स्केल्स। तो एक एक करके बताओ कि क्या चीज है ये, व्हाट आर दिस, टेल मी। दिस इज द extensile surfaces, right? You see, this is very important. When we read psoriasis, you should know this point. Herald patch, ichthyosis vulgaris, okay, fine. I'm not spending too much time on the images. These are individual topics. Seborrheic dermatitis, yes, these are becomes dry, okay, fine. Crust, tell me, what are these crust, right? These are also the secondary lesions, yes, okay. Crust, honey colored crust, yes, we see in what? Bullous impetigo, right? Bullous impetigo we see, okay, fine, all right, ठीक है। अब ये वाला बताओ, है ना, फिशर हो गए, इरोजन हो गया, अल्सर, ठीक है, सिंपल है ना। दिस इज लाइक इन द फुट, राइट, यूजुअली द इन द फीट during the winter season, somebody or they might have these things, yes, fissure, erosion जो है वो है, ठीक है, erosion the definition is break in the epidermis, simple, ठीक, इसमें देखो आप जो है ना, एपिडर्मिस, डर्मिस, हाइपोडर्मिस, ठीक है, एपिडर्मिस ब्रेक हो रही है, बाकी ये सब बढ़िया है। अल्सर में देखो क्या दिक्कत है ना, इसमें जो पूरा का पूरा चंक ही चला गया, ठीक है ना, अल्सर में देखो पूरा चंक चला गया, है ना, ठीक है। सो ब्रेक इन व्हाट, एपिडर्मिस एंड द डर्मिस एज वेल, ठीक है। व्हेन वी रीड about in the bacterial infection, right, we should know this topic, okay, all right, fine, okay. Loss of epidermis and dermis, heals with scarring, all right, fine. So next up we have excoriation, right, superficial excoriation of the skin, yes. So it is because of scratches. Definitely there could be more than one reason for the scratch, right. I'm pretty sure about that, yes, there could be more than one reason, okay. We have lichenification as well, right, lichenification, you see this increase in skin markings, yes, this is one of the secondary uh, findings as well, right, okay, lichenification and scars, scars are also there, okay. Tell me what is this, anybody who can tell me what is this, सर्जरी का बहुत ही इंपॉर्टेंट टॉपिक है ना, anybody, and tell me the location, keloid, yes, the answer is keloid, very correctly said, keloid is the answer, okay. And tell me the location, और कहाँ कहाँ होता है ये, बताओ, कौन बताएगा मुझे, और कहाँ कहाँ होता है ये, भाई ये टॉपिक बहुत ज़रूरी है ना, सर्जरी में हमको ऐसे ना हर जगह जो है अ, पढ़ा जा, यस, स्टर्नम, स्टर्नम इज द आंसर, राइट, इन स्टर्नम, यस 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 यस, ठीक है, ओके फाइन, ऑलराइट। स्पेशल लीजन्स, yeah, I'll go through this quickly. Yeah, sternum is very correct. Sure, yeah, you're very correct. Burrow, right? Burrows किस में दिखते हैं? Tell me in what Sarcoptes scabies, right? We'll see these burrows. Okay, fine. Comedons, ठीक है? Close comedon, open comedon, ठीक है? जो होते हैं ना, ये वाले, है ना? ठीक है? Black heads, white heads, lower side of ear also. Yes, 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 definitely. ब्लैक हेड वाइट हेड जो होते हैं ना, ठीक है, जो अब मुझे बताइए कि ये क्यों ओपन जो कॉमेडॉन्स है ना, ये ब्लैक क्यों है और क्लोज जो है वो वाइट क्यों है, बताइए, एनीबडी हु कैन टेल मी, एनीबडी हु कैन टेल मी दिस आंसर। जो ओपन कॉमेडॉन्स हैं, राइट, बिकॉज ऑफ ऑक्सीड, यस, वेरी करेक्ट, यस, वेरी करेक्ट, अब्दुल्ला शेख। सो यू नो ऑल द कॉन्सेप्ट्स, वेरी वेरी इंप्रेसिव टू सी, यस। सो राइट हियर देयर इज ऑक्सीडेशन, राइट, सो क्लोज में क्या है, ऑक्सीडेशन नहीं हो रहा है ना, इसलिए जो है वो बचे हुए हैं ना, दे आर सेफ, यस, सो दे आर क्लोज, दे आर सेफ, तो वाइट है वो, है ना, सिंपल एज दैट, यस। सो ऑक्सीडेशन एंड नो ऑक्सीडेशन विल बी द आंसर, okay, fine. Next up we have the telangiectasia, yes, it's also one of the specialized skin lesions, and then we have the target skin lesions, okay, fine, all right, that is all done. Next up we have this lines in dermatology, yes, lines in dermatology is very important, yes. So हर बार क्वेश्चन आते ही आते हैं इसके अंदर से, तो वी जस्ट डू इट क्विकली। ब्लास्कोस लाइन्स एंड लैंगर्स लाइन, ओके। ब्लास्को का जो बी है ना वो बहुत ज़रूरी है, ठीक है। क्यों? क्योंकि ये दीज आर द लाइन्स ऑफ एम्ब्रियोनिक डेवलपमेंट, ठीक है, ओके। लाइन्स ऑफ एम्ब्रियोनिक डेवलपमेंट, तो मैं ऐसे याद रख रहा हूँ जैसे कि ब्लास्को है, बी फॉर ब्लास्को, बी फॉर बच्चे, बी फॉर ब्लास्को, बी फॉर बच्चे, है ना, बेबीज। ऑलराइट, सो दिस इज लाइक एम्ब्रियोनिक डेवलपमेंट, ओके, fine. And we cover up this one first, okay. Let us just do in comparison manner. Langer's line, tell me about Langer's line, tell me what is the significance of this, ठीक है। अगर आपने आंसर नहीं दिया ना, सर्जरी वाले आपको, है ना, पिटाई कराएंगे आपकी, है ना, ठीक है। लैंगर्स लाइन बताइए, ठीक है। This is used in incision, right, in surgical incision, very important, yes. So it is along the lines of Langer's line, ठीक है। But what is important over here, what is interesting is the orientation, है ना, orientation, yes, surgical incision, yes, very correctly said, yes। So orientation of collagen and muscle fibers, ठीक है, collagen and muscle fibers, okay, fine. It is parallel to collagen and perpendicular to muscle fibers, okay, all right। How to identify them? ब्लास्टकोस लाइन जो है, ठीक है, एग्जाम में आता है क्वेश्चन है कि भाई ये दे विल शो दिस डायग्राम एंड टेल यू, दैट इज वन क्वेश्चन। सेकंड क्वेश्चन इज दे वुड जस्ट आस्क यू द एग्जांपल्स, ठीक है, दो क्वेश्चन बन गए इसमें, ठीक है। इसमें देखिए आप, एट द बैक यू सी दिस वी स्ट्रॉड ऑफ स्ट्रक्चर, एंड इन द फ्रंट, इन द चेस्ट एरिया आल्सो यू सी देयर इज वी स्ट्रॉड ऑफ स्ट्रक्चर ओवर हियर, ओके, फाइन। दिस इज ब्लास्को लाइन, ओके। एंड ओवर हियर यू सी देयर इज अ टोर्नाडो इन द हेड, ओके, ठीक है। 3 पॉइंट आप पकड़ लिया आपने यहाँ पे, और ये रहा हमारा इनकॉन्टिनेंशिया पिगमेंटा एग्जाम्पल, ठीक है। Now we come to, right over here, that is the healing will be better without scarring, yes, very correct, very correct, yes, Ahmed Khurshid, very correct, yeah, okay. Over here you see, on its stomach, it is these lines you see, and also on the head you see there is no tornado, okay, फाइन, ठीक है। आपको डिफरेंशिएशन जो है आना चाहिए इसके अंदर, ठीक है, फाइन। और आप इसमें देखिए, इसके जो स्टमक में जो है ना, आई फॉरगॉट दिस पॉइंट टू टेल, ओके, there is S shape. S shape. This S shape is there, right? This is very peculiar about the Blaschko's lines. Okay, fine. We're done with this part. Okay, dermatological investigation. We'll do this quickly. Okay, under like 2-3 minutes we'll be done, and we'll start the next chapter. Okay. क्या क्या करने वाले हैं हम लोग, KOH माउंट करने वाले हैं, ठीक है। we use KOH mount, Zank smear and Boone's lamp, okay। everything will be done, it is just like priming you all with all the topics which are gonna come, okay। क्या क्या होने वाला है यहाँ पर, ठीक है। इन पिटासिस वर्सिकलर, ठीक है। हाँ, हम लोग के एओएच माउंट के अंदर क्या देखने वाले, टेल मी, कोई तो बोलेगा, ये कोई तो बोलो, है ना, ठीक है, एनीबॉडी, ओके। व्हाट इज द अपीयरेंस वी सी इन पिटासिस वर्सिकलर, टेल मी व्हाट इज इट, एनीबॉडी? All right, no worries. This is the spaghetti meatball appearance, right? Okay, fine. This is very important. Spaghetti and meatball appearance we see. Bacterial vaginosis, whiff test we do. And we have this fishy odor. Fishy odor would be there, right? And how about this one? These are mites. अभी हमने पढ़ा mites, sarcoptes के भी हमने पढ़ा, ठीक है? How about this one? The last one, very important. Meatball. Yes, thanks, Mir. Yes, very correct, very correct. Yes. Yeah. Over here you see, this chromoblastomycosis is very important. This copper penny bodies, राइट, मेडलार स्क्लेरोटिक बॉडीज, ठीक है, वेरी एक्सट्रीमली इंपॉर्टेंट, ओके, ठीक है, बहुत ज़रूरी है, ये अपने को पता होना चाहिए ये चीज़, ओके। और मदुराई फूड, दिस इज नॉट मदुराई फूड, ओके। मदुराई फूड वी विल बी रीडिंग राइट इन एक्टिनोमाइसिस, ओके, फाइन, एक्टिनोमाइसिस, एंड we'll be doing a comparison regarding that as well, okay, all right, okay, फाइन। इन जैंक्स मेयर हम लोग अभी पढ़ने वाले हैं, ठीक है। ये वाला जो कॉन्सेप्ट है आपको आता है, मैंने पढ़ा रखा है ये, ओके, पढ़ा रखा है मैंने, जैंक्स मेयर। सो यूनिन्यूक्लियेटेड एंड मल्टीन्यूक्लियेटेड अकैंथोलिटिक सेल्स, ठीक है। अब इसमें देखिए, अभी वाली बात जो है ना, यू कैन टेल मी, यू गाइस कैन टेल मी, राइट। सो ये सिंगल सेल है, ठीक है। तो द प्रॉब्लम इज व्हाट, वेयर इज द प्रॉब्लम, दिस इज एन एग्जांपल ऑफ प्राइमरी अकैंथोलाइसिस, है ना, ठीक है। आई एम टॉकिंग अबाउट दिस वन, दिस इज एन एग्जांपल ऑफ प्राइमरी अकैंथोलाइसिस, ठीक है। हाउ अबाउट दिस वन, टेल मी, द प्रॉब्लम इज वेयर, इट इज इन द डेस्मोसोम और नॉट, टेल मी, डेस्मोसोम में दिक्कत है क्या, नहीं है। सेकेंडरी अकैंथोलाइसिस जो हमने पढ़ा था, डेस्मोसोम में दिक्कत नहीं थी, कोई और वजह से दिक्कत थी, है ना, ठीक है। तभी देखिए, वी कैन सी दिस मल्टी न्यूक्लियर जाइंट सेल, ऑलराइट, फाइन, इतनी बात समझ गई, ठीक है। नेक्स्ट अप वी हैव इज इंक्लूजन बॉडीज, राइट, which are there, these are the HP bodies, yes, Henderson Patterson bodies, yes, in molluscum contagiosum, okay, all right, fine. So लेट अस डू वुड्स लैम्प एग्जामिनेशन, ठीक है। इसमें जो है ना द कलर आर वेरी इंपॉर्टेंट, ठीक है। द कलर्स आर वेरी वेरी इंपॉर्टेंट, ठीक है। सो एरिथ्राज्मा में कौन सा कलर दिखता है? एनीबडी नो दिस? बताइए, किसको पता है क्या? है ना, एरिथ्राज्मा में कौन सा कलर दिखता है? टेल मी। वी हैव कोरल रेड, कोरल रेड कलर, ठीक है। ड्यू टू व्हाट? दिस इज अ $1 million क्वेश्चन। ड्यू टू व्हाट? एनीबडी हु कैन आंसर दिस क्वेश्चन, एंड it would just make my day. Anybody who can answer this? Due to what? ठीक है, this is why the real count. Yes, a life of a doctor. Yes, very correct, very correctly said. A life of a doctor, very correctly said. That is red or pink. Yes, okay. Due to what? Tell me. ठीक है. If you know this one, you know your biochemistry really well, right? This is how you integrate, all these 19 subjects together, right? And it is so fun, right, to be learning like this. Due to what? The colors is being imparted due to what? Anybody? Okay, no worries. Okay, fine. So everybody promise me that say, from now you guys would never make this wrong. It is due to porphyrins. Yes, yes, yes. Porphyria. Yes, yes, yes. Definitely, definitely. It is due to porphyrins. Yes, extremely correct. Yes. Okay, porphyrins. We also read one topic, right? That is Porphyria cutanea tarda. Okay, even there, this porphyria is coming, right? Fine. Okay, in biochemistry, this is a very interesting topic. Okay, in Pityriasis, what is the color? Tell me, anybody? Pale yellow color. Okay, fine. Now we'll go a little bit faster. These are the images you see. This is what you see. This is the coral red color. Okay, fine. A life of a doctor. Answer it correctly. That is कोरल रेड कलर। ओके, ठीक है। अब ये देखिए जो पेल वाइट जो कलर है, ठीक है, वी सी इन दिस थिंग इन albinism. Okay, all right, fine. Coming up in the therapies, we have cryotherapy and we have phototherapy. In cryotherapy, we use cold liquid nitrogen. Yes, we use this in wards. Okay, all right. And in phototherapy, देखो इसमें जो these two things are very important. Yes, ठीक है। इसमें क्या जरूरी क्या है कि इसकी जो वेवलेंथ है वो ज़रूरी है, यूज़ ज़रूरी, उससे ज़रूरी यूज़ है, ठीक है। सोरियासिस में यूज़ करते हैं हम लोग ये चीज़, ठीक है। ओके, सोरियासिस में हम लोग ये चीज़ यूज़ करते हैं कि ये क्या करता है, इन्फ्लेमेशन कम कर देता है, ठीक है। कुछ भी नहीं करना, पेशेंट को जो है अंदर जाके बिठाना है और ये बंद कर देना, लाइट चालू कर देनी है, बस, ठीक है, इतना ही करना है। बट दिक्कत क्या होती है ना, पेशेंट आर वेरी रिलेक्टेंट टू दिस बिकॉज फॉर द ट्रीटमेंट दे हैव टू कम टू द हॉस्पिटल अगेन एंड अगेन अगेन एंड अगेन अगेन एंड अगेन, ठीक है। हफ्ते में 3 बार 4 बार कौन आएगा भाई, है ना, ठीक है। तो इवन तो ये बहुत अच्छा है, पेशेंट्स डू कम, राइट। यस, 311 नैनोमीटर, वेरी करेक्ट, +-2, वेरी करेक्ट। ओके, दिस इज वेरी इंपॉर्टेंट, राइट। ओके, ठीक है। एंड वी ऑल्सो हैव PUVA, that is the solar and ultraviolet A light which is there, right? So 320 and 400 nanometer, this is the range we use. Okay, fine. All right, so we are done with that. I'm pretty happy we could complete that, right, in under I guess under 50 minutes we did it. Okay, all right. But from now we'll be going on much faster. Okay, I hope whenever I have some topic, right, I just get so intrigued about it and we just like talk more and more about it. Yes, so fine. A papilloscamus disorder, let us just begin, right? So this word is very important, ठीक है। तो ये जो word है इसका मतलब क्या है? Tell me. स्केली पैप्यूल्स, ठीक है, स्केली पैप्यूल्स, ठीक है। और जितनी भी बीमारी यहाँ दिख रही है आपको, ये सब दिस लाइक द वेरी इंपॉर्टेंट टॉपिक्स of dermatology, like start topic of dermatology we will be discussing here, right? Okay, the start topics are just about to get started, ठीक, बेसिक्स वगैरह हो गई हमारी, ठीक है। अभी हम लोग रियल बात करने वाले हैं, ठीक है। एक्चुअल में जो चीज मैटर करती है वो ये है, लाइकन प्लानस, ठीक है। अभी आप देखो, ठीक है, दिस माइंड मैप परफेक्ट थिंग, लाइक इफ यू जस्ट रिमेंबर दिस थिंग, लाइफ इज सेट, ठीक है, कोई टेंशन की बात ही नहीं है ना। ओके, जो चीज मैंने हाईलाइट कर रखी है इसके अंदर आप लोग जो देख रहे हो, ठीक है, दिस इज व्हाट यू नीड टू रिमेंबर। ओके, लेट अस स्टार्ट विद इंट्रोडक्शन पार्ट, राइट। व्हाट इज लाइकन प्लानस? Tree moss, right? Okay, lichen, if you guys remember, right, lichen, if you guys remember, this was used as an ecological biomarker for pollution, ठीक है ना। 11th 12th में हमने पढ़ा ये बात, ये है ना, ठीक है। in our 11th and 12th standard we read about this, that lichen is an ecological marker, right, about pollution. Okay, fine. So that is nothing related to derma but just knowledge point. Okay, over here this is very important, that it is an autoimmune disease. Okay, autoimmune disease है, और ठीक है, and associated with what? Alopecia areata, vitiligo and ulcerative colitis. Okay, that is what it is associated with. Fine, ठीक है। ट्रिगर फैक्टर्स बताइए, बहुत जरूरी है, बहुत जरूरी है ना। हो क्यों रहा है ये, हो क्यों रहा है, टेल मी, है ना। This is the most interesting one. We'll take up in the last. Let us just go with the drugs first. Yes, so anticonvulsants are the most common drugs which elicit lichen planus. Okay, fine. Over here you see it could cause also because of infections, right? Some infections could also be caused because of this. Okay, dental filling, कौन सा जो element है ना, that is the reason it happens. Tell me, कौन सा जो element है ये? Mercury. right? The mercury amalgamation, right, over here. Okay, ठीक है, we'll come back to this topic as well. प्रेजेंटेशन, टेल मी, जब लाइकन प्लैनस बोलते हो ना तो आप लोग एक गहरी सांस लेना चाहिए आपको, ठीक है। अमेलगम, यस यस यस, वेरी करेक्ट सरफराज खान, वेरी करेक्ट, यस। सो fluoride would not be the answer. Yes, Ahmed Khurshid, the answer would be the amalgam which they use, right? You know, these coax which are there, right? Okay, they use these, you know, cheap chemicals, and they end up giving us lichen planus. Okay, free gift. Let us talk about this, right? Over here, what you see on the screen is this five piece, right? So tell me, lichen planus जब भी हम पढ़ते हैं, ठीक है, we take a deep breath and we just say these five things. You know, it is like golden rule. Okay, fine. This is purple pleuritic polygonal plain flat top lesions. ठीक है, okay fine. So this is all of it. ठीक है ना? साइज तो हो जाएगी, पैप्यूल्स हो जाएंगे, माइक्रोस हो जाएंगे, ठीक है। दिस इज वेरी इंपॉर्टेंट, ओके। इफ यू नो दिस वन, यू विल नेवर गो रॉन्ग. Examiners is going to use these words. Tell me, really guys, he or she, they would use these words. And आपको, आपकी आंखें जो है इन्हीं पे जानी चाहिए, है ना? ठीक है भाई, हमको ये दिख रहा है कि नहीं, है ना? ठीक है। We now we learn about different type of lichen planus. Okay, one of the very classical feature about lichen planus, nail lichen planus, is what? Tell me. It is pterygium. Pterygium, ठीक है, ये pterygium रहा. That is a very classical feature. Okay, ये क्या हो रहा है इसमें, देखिए आप, जो proximal nail bed है ना, ठीक है, ये जो है यहाँ पे आके जो है एक्सटेंड हो जा रहा है ना? ठीक है, ओके, यहाँ पे जाके एक्सटेंड हो जा रहा है, ठीक है। दिस इज व्हाट इज pterygium, ठीक है। वी ऑल्सो रीड दिस इन ऑप्थेल्मोलॉजी एज वेल, राइट? ओके, what are the other findings? This thinning of the nail plate is the most common finding. Yes, thinning of the nail plate, है ना? और इसमें देखिए क्या हो रहा है, ये anybody who know this sign, anybody who know this sign, tell me what is this? Anyone? Just take a guess, ठीक है। इसमें हो क्या रहा है, देखो भाई, जो यहाँ पर है, जो सेल्स हैं वो बढ़ रहे हैं, है ना? ठीक है, एक एक करके जो सेल जो है बढ़ रहे हैं, ऐसे मोटे मोटे से हो गए यहाँ पे, है ना सर? ठीक है, केराटोसिस, यस, केराटोसिस इज करेक्ट, बट द बेटर वे टू से इज हाइपर केराटोसिस, है ना? ठीक है, very good Abdullah Sheikh, very correct, but the better way we can say this is hyperkeratosis. Yes, okay, fine. We can also see this sign, ठीक है। what is this sign called as tenting and puffing sign, है ना? जैसे टेंट जैसे नहीं दिख रहा आपको ये नाखून, है ना? टेंट जैसे नहीं दिख रहे, यस यस करेक्ट, यस, टेंट जैसे नहीं दिख रहे नाखून आपको, ये रहे टेंटिंग एंड पफिंग साइन। ओके फाइन, we have over here. Okay, next up we have this, you know, becomes dry आने वाला है, ठीक है, very interesting. This criss cross streaks in the mucosa we have, right? ठीक है, मैंने जब पहले हम लोग इंट्रोडक्शन कर रहे थे तब मैंने बताया था आपको ये आने वाला है, ये रहा becomes dry, ठीक है। ओके, ये रहा जो आपको दिख रहा है, ठीक है, फाइन। The very important thing is, right, this is this leukoplegia, right? This is the most common, what, this is the most common pre-malignant lesion, ठीक है, this is the most common pre-malignant lesion, ठीक है, all right, fine. Over here you see, uh, but the thing is, you know, in oral lichen planus, it takes about 10 years to get converged into the metastasize. It metastasize, it takes 10 years. Okay, all right, fine. So अब देखिए this point, right? I told you I'm going to come back. You see, some person, you know, he just went to a quack. Yes, he got in this mercury, stupid mercury filling in his teeth. Yes, then eventually what happened was he ended up having this, that is becomes dry, ठीक है, जो कि है ना becomes dry. And what happened is oral lichen planus, okay, in 10 months, yes, it is pre-malignant, yes, in 10 years it get converted to a malignant version, है ना? ठीक है, did you connect these 3 points? Okay, so that is what, like, if you read these mind maps, you can connect things so easily, so fast. Okay, ठीक है। The last thing we have over here is follicular lichen planus, ठीक है। इसमें क्या हो रहा है कि two things are very important, the colors are very important. The color of the scalp is very follicular, blue gray macules, ठीक है, ये रहे, ठीक है। The etiology, like why it is blue gray, is very important. Okay, very interesting, because there is extra vesicant of blood. Okay, all right. Over here we see the histopathology. This is the most interesting point of lichen planus, ठीक है। वेरी, मतलब इसमें तो मजा आने वाला है आपको हिस्टोपैथोलॉजी में, ठीक है। इसमें क्या होने वाला है कि we will just do it like a story. Okay, fine. I told you because this is an autoimmune condition, ठीक है। ये यहाँ रही, ये मैंने लिखा यहाँ पे, है ना, कि ये autoimmune condition है, ठीक है। अगर ऑटोइम्यून कंडीशन है तो क्या होने वाला है, बॉडी इज गोना एक्ट, बॉडी जो है अटैक करने वाली है ना, अपने खुद के सेल्स पे। ठीक है, सेल्स कौन से हैं, बेसल एपिडर्मल डिस्ट्रक्शन। ठीक है, जो सेल्स कौन से, जो सेल्स पे अटैक करने वाली है बॉडी। ठीक है, इसमें क्या हो रहा है, CD8 सेल्स आर गोना कम, दे गोना अटैक द सेल्स। ऑलराइट, इससे क्या होगा, देयर इज गोना बी लिक्विफैक्शन। यस, लिक्विफैक्शन होगा एंड दिस गोना सेटल डाउन। ठीक है, नीचे बैठ जाएगा वो, है ना। ठीक है, जब वो नीचे बैठ जाएगा तब क्या होगा, दीज बॉडीज राइट, दे वुड बी कॉल्ड, दे वुड बी नेक्रोस्ड, these bodies would be necrosed, they would be apoptotic. ठीक है, now these bodies are called as what, tell me, anybody who can answer me this question, like it would be like perfect, really. Tell me what is this, anybody who can tell me where we T cells attack follicle. Yeah, the CD8 cells, right, in the dermis, they are under attack. Okay, fine, tell me the name of the bodies, right, in this. The answer would be सिवेट बॉडीज, सिवेट बॉडीज। ओके फाइन, ये जो है आपको याद रखनी है। ठीक है, इतनी जो स्टोरी है आपको याद नहीं रहेगी, कोई बात नहीं, कंसेप्ट आपको क्लियर होने चाहिए। आपको पता होना चाहिए सिवेट बॉडी जो है, इट इज अ टॉपिक ऑफ लाइकन प्लानस। ओके, सिंपल। ओके, नाउ नेक्स्ट अप वी हैव दिस वेज शेप हाइपरकेराटोसिस। ठीक है, वेज शेप हाइपरकेराटोसिस। ठीक है, विकम स्ट्राइज हमने पढ़ा था, वो यही था। ठीक है, जो हाइपरकेराटोसिस, लाइक बिकॉज ऑफ दिस, दैट इज द रीजन वी सी ऑल दिस ट्राई। ठीक है, ओके, all right, that is the reason it becomes like this, right, that is the reason you see all these striae. Okay, fine, colloid body, it is civate body, Ahmad Khurshid, it is civate body. Okay, all right, rete ridges, yes, and over here you see, yes, over here we just complete this one point from this image. Yes, you see this invagination, right, of the epidermis is going down, right, these, okay, this roof हमने जो बोला था क्या थी, rete ridges थे। ठीक है, these these are called as sawtooth rete ridges, sawtooth rete ridges. Okay, so Ahmed Khurshid, uh, the answer is civate bodies. Okay, all right, fine, apoptotic bodies are called as civate bodies. Okay, all right, I hope your question is clear. If you want to ask more questions, definitely you can write me like a exact question of yours, and we can have a discussion on that as well. No worries. Okay, how about the treatment? Autoimmune है तो बॉडी की इम्यूनिटी कम करनी पड़ेगी, स्टेरॉइड दे देंगे, वी कैन गिव टॉपिकल स्टेरॉइड्स, ओरल स्टेरॉइड, एसिटेटिन दैट इज अ विटामिन ए डेरिवेटिव, एंड वी कैन गिव फोटोथेरेपी एज वेल। ठीक है, ऑलराइट, सो दैट इज ऑल अबाउट लाइकिंग प्लानस। ठीक है, तो कैसा लग रहा है तरीका आपको पढ़ाने का? वी विल जस्ट फॉलो दिस माइंड मैप्स थिंग इन ऑल ऑफ आवर डर्मेटोलॉजी। ओके, ठीक है, एंड आई वुड रिकमेंड यू गाइस टू डू दिस एज वेल, राइट, सो इट इज वेरी इंटरेस्टिंग to learn this way, because you can just switch between concepts, right, one after the another. Now comes the psoriasis. ठीक है, psoriasis will be starting about it. Okay, very start topic, very important topic, right, psoriasis. Okay, over here you see few things are important. First of all, you should know the factors in it. Second thing what is important is you should definitely know about what are the, okay, thank you so much Ahmed Kurshi, thank you so much. Okay, what is important over here is, yes, you should know the classification. ठीक है, अगर आपको क्लासिफिकेशन पता है ना, ठीक है, तो आपको सारे के सारे एक क्वेश्चन तो आने वाला है। देखो, ये रहा क्लासिफिकेशन, ऐसा पढ़ाऊंगा ना आपको मजा आ जाएगी। ठीक है, मजा आ जाएगी आज तो, है ना, ऐसा पढ़ाऊंगा मजा आ जाएगी आपको। ऑलराइट फाइन, सो लेट अस जस्ट स्टार्ट विद इट। ठीक है, it is, these are the factors, right, these are the etiological factors, yes, because of that is happening, genetic factors, immune factors, and these are environmental factors as well. ठीक है, इसमें जो जेनेटिक फैक्टर्स है वो हमको याद रखने हैं। ठीक है, तो HLA की सीरीज जो है हमको याद रखनी है, बहुत ज़रूरी है। ठीक है, तो HLA CW7 B13 एंड B17, ठीक है, ये जो है वो कॉज कर रहा है HLA B27, it has an association with sacroiliitis. ठीक है, B27 predisposes to a lot of things. Okay, fine, over here we have this triad. ठीक है, triad, anybody, you may know this, you may not know this. ठीक है, it is absolutely fine. Yes, so but from now you should know, tell me. Okay, अब से पता होना चाहिए बात है। ठीक है, अगर सोरासिस आप पढ़ रहे हो तो ये triad जो है आपके दिमाग में आ जाने चाहिए, भाई हाँ सर ने ये पढ़ाया था। ठीक है, what is this triad about? First of all we have this angiogenesis, very important। ठीक है, angiogenesis, ठीक है, एक एक चीज जो है, ऑस्पिट्स ट्रायड। ठीक है, दिस इज द सोरियाटिक ट्रायड। ठीक है, फाइन, angiogenesis. ठीक है, all right, and we have the next one, right, we have the keratinocyte proliferation. ये रहा keratinocyte proliferation। ठीक है, and there is T cell dysfunction. Okay, Now I'm going to come back on this again and again, again and again. I'll just make sure you remember this in class itself. Okay, ठीक है, बार बार हम लोग ये करने वाले हैं, ठीक है। अब आप देखिए जो एनवायरमेंटल फैक्टर्स हैं, है ना, कौन से हैं, ठीक है। अब मैं क्या करने वाला हूँ ना, आई विल स्किप दिस टॉपिक एंड आई विल कम बैक. Let us do the immune factors from now. Okay, it increases what, pro-inflammatory cytokines, ठीक है. Yes, nice and easy explanation, thank you so much, thank you so much. uh yes, Rakesh, thank you so much. All right, so we have increase in pro-inflammatory cytokines. Okay, this predisposes us to that. Okay, fine, this is what it is. Now let us just come and we do about the classification part, ठीक है. We'll go back to that topic again, yes, but now I just want to take that small bit of information, that triad that I showed you, tidbits of information, and come to this. Okay, अब इसमें आप देखिए, है ना. So in the next 5 minutes we will be completing this whole types of psoriasis and your life will be set. ठीक है, life is set after this, nothing to be worried about. Okay, all right, fine, ठीक है, all right. So first up, yes, we have this pustular psoriasis. ठीक है, pustular psoriasis हम लोग पढ़ने वाले हैं. दो तरह के होते हैं ये, दो तरह के होते हैं ये. एक तो लोकलाइज होगा या तो पूरी बॉडी में होगा. ठीक है, अगर वो लोकलाइज होगा तो या तो हाथ पैरों में होगा, दैट इज गोना बी कॉल्ड एज पाल्मो प्लांटार टाइप. पाल्मो प्लांटार टाइप, ठीक है. अगर वो पूरी बॉडी में हो रहा है, इट इज गोइंग टू बी जनरलाइज टाइप. ठीक है, दिस इज द वन विच इज वेरी इंपॉर्टेंट, जनरलाइज टाइप. ओके, दिस हैज अ वेरी स्पेशल नेम, दैट इज वॉन जम्बर्स टाइप. ठीक है, वॉन जम्बर्स टाइप. ओके, वेरी क्लासिकल फीचर, विल टॉक अबाउट दिस. इसमें हो क्या रहा है कि there is severe reaction, severe reaction. Okay, so it is also called as lake of pus appearance, lake of pus appearance. Okay, fine, that is one thing we need to know about. Fine, tell me about the nature of the pus. बॉडी की खुद की वजह से हो रहा है कि ये स्टेराइल होगा, क्या ये इन्फेक्टेड होगा? टेल मी. दिस वुड बी स्टेराइल पस, राइट, बिकॉज ऑफ द बॉडी, है ना. ठीक है, बॉडी की वजह से हो रहा है, कोई बाहर का इन्फेक्शन जो है आके वो प्रॉब्लम नहीं कर रहा है अपने को, है ना. ठीक है, in pregnancy, this happens. This condition is impetigo herpetiformis, and this is a misnomer. This is a misnomer. Okay, all right. But this condition becomes more important because of the treatment aspect. Okay, because of treatment aspect. What is the treatment over here, right? Over here, you see, we will give patient steroids. All right, we would give patients steroids, but this is the only psoriasis in which we give steroids. ठीक है, बाकियों में नहीं देते, बाकियों में कॉन्ट्राइंडिकेटेड है, इसमें हम देते हैं. ठीक है, समझ गए इतनी बात आपको? ओके, ये स्टेरॉइड्स और कॉन्ट्राइंडिकेटेड. ठीक है, अगर किसी पेशेंट में स्टेरॉइड्स अगर कॉन्ट्राइंडिकेटेड है तो हम क्या देंगे? टेल मी. वी वुड गिव साइक्लोस्पोरिन्स, राइट, साइक्लोस्पोरिन्स वुड गिव. दिस वेरी इंपॉर्टेंट पॉइंट, ये आपको याद रखना है. यू कैन नॉट अफोर्ड टू फॉरगेट दिस. ओके, ऑलराइट, फाइन, ऑलराइट, गुड, यस, एवरीथिंग इज नाइस. ठीक है, विच इज डन विद द पस्टुला सोरियासिस. नेक्स्ट अप वी हैव द प्लाक सोरियासिस. अभी यहाँ पर जो है ना, अब और मजा आएगा अपने को. अब देखना, प्लाक सोरियासिस में क्या हो रहा है. इसके अंदर जो है ना, जो मोस्ट कॉमन टाइप है, मोस्ट कॉमन टाइप को क्या बोलते हैं? चलो इतना बता दो मुझे, है ना, मोस्ट कॉमन टाइप को क्या बोलते हैं? ठीक है, बताओ, मोस्ट कॉमन टाइप को क्या बोलते हैं? एनीबडी? मोस्ट कॉमन टाइप इज कॉल्ड एज vulgaris type, right? Okay, this is the vulgaris type. The psoriasis vulgaris is the most common type. ठीक है, we need to remember this because we need to set some benchmarks here. Okay, fine. This is the chronic plaque psoriasis we are reading over here, right? So but the nature of this is very important, that it happens only on the, कौन से साइड में हो रहा है बताइए? ठीक है, ये वाली साइड कौन सी साइड है ना, एक्सटेंसर है या फ्लेक्सर है? बताइए चलो. यस, एनाटमी. ठीक है, एनीबॉडी? एक्सटेंसर साइड, राइट. ओके, एक्सटेंसर surfaces. Okay, fine. Yes, a life of a doctor, very correct, very correct. ठीक है, this is important. Why? Yes, now I'll just take a pause right here and we just come to this one, that is inverse psoriasis. इसमें उल्टा होता है. ठीक है, एक्सटेंसर में नहीं होता है, फ्लेक्सर सर्फेसिस में होता है. ठीक है, ओके, ऑलराइट. अब आ जाइए आप लोग, वी कम बैक टू दिस psoriasis vulgaris. ठीक है, यू सी दिस ट्रायड. किसी को अगर याद है कि हमने जो पढ़ा था, है ना, वी आई सेड समथिंग अबाउट एंजियोजेनेसिस, है ना. यस, वेरी करेक्ट, वेरी करेक्ट, अहमद खुर्शीद. A Life of a Doctor. Yes, and Abdullah Sheikh, very correct. Yes, extensive services. Okay. There is thickening, right? Thickening मैंने बोला था ना, ठीक है. Increase in keratinocyte proliferation, है ना, ठीक है. Let me go back to that little triangle of ours, ठीक है. Okay, some triangles in life are good. This is one of it, ठीक है. In psoriasis, ठीक है. All right, we have this. The next up, we have this type of psoriasis. This is acute gutted psoriasis. Tell me, I did not take, the etiology, one etiology I did not take when I was explaining the types because of this topic. Yes, acute gutted psoriasis. Tell me, what is the etiology of it? This we have to remember. Okay, if you know this thing, the life is set. कोई टेंशन की बात ही नहीं है फिर तो, है ना. Now let us come back here. Environmental factors. Yes, some infections. Yes, some infections. Right? Like what? Streptococcal. Right? The post-streptococcal infections. Yes, it will cause gutted psoriasis. Okay, fine. This point you need to remember it very clearly. Yes, streptococcus, very correct, very correctly said. Okay, so in a question, if you see a patient, it has all these psoriatic findings, but in that question, if you see that the person had history of streptococcal infection, तो कौन सा होने वाला है? नॉर्मल psoriasis तो नहीं मार्क करोगे ना आप, तब आप मार्क करोगे गटेड psoriasis. ठीक है. ऑलराइट. Sudden withdrawal of systemic steroids is also the answer. ठीक है. So hence this steroids are contraindicated. But हम लोग कौन से में देने वाले हैं? टेल मी. चलो इतना बता दो, मैंने अभी जस्ट पढ़ाया था. कौन से हम लोग देने वाले हैं बताइए, जल्दी से बताइए कौन से हम लोग देने वाले हैं. एनीबॉडी? Yes, in one psoriasis we were giving, what was it? In impetigo herpetiformis, right? We were giving steroids. ठीक है, सिस्टमिक स्टेरॉइड्स हम लोग दे रहे थे, है ना. बाकियों में कॉन्ट्राइंडिकेटेड, बट इसमें इंडिकेशन है उसकी, है ना. ठीक है. साइक्लोस्पोरिन हम तब देंगे जब स्टेरॉइड भी कॉन्ट्राइंडिकेटेड है किसी में. ठीक है. तो देयर इज टू लेवल ऑफ थिंग. ओके, एक तो जो है कि इम्पेटिगो में, है ना, हम लोग स्टेरॉइड दे रहे थे. अगर स्टेरॉइड्स भी अगर वो पर्सन में जो है नहीं दे सकते, तो हम लोग साइक्लोस्पोरिन देंगे. ठीक है, इतनी बात समझ गई. ओके फाइन, वी कम बैक to these other factors, right? So there could be uh, drugs, right, also, which could elicit that as well. Okay, you guys can read this. Fine. Okay, so we're done with environmental factors. Oh, done. Now we will just come here and cover this whole table. ठीक है. अभी यहाँ पे आ जाइए, थोड़ी सी जो है ना आपकी वोकेबलरी जो है मैं आपको सही कर दूंगा आज. ठीक है. Right here you see this is erythrodermic psoriasis. ठीक है. Tell me anybody who know this, like erythrodermic meaning. What is the meaning of this? Erythrodermic, what is the meaning of it? Tell me. Anybody who? Okay. Erythrodermic. Yes, so this word is used when more than 90% of body is involved. This is a general term we use across all the 19 subjects. Erythrodermic. Okay. All right, then more than 90% area body is involved. That is what it is, erythrodermic. ठीक है. अगर मैं बोलता हूँ आपको कि भाई erythrodermic psoriasis, तो क्या होगा ये? It is more than 90% of skin is involved in it. Simple. इतनी सी बात हो रही है ना यहाँ पे, है ना. ठीक है. More than 90% of skin is involved. ठीक है. All right. This is the most severe variant. Fine. Psoriatic arthritis. अब इसमें मजा आने वाला है. ठीक है. Psoriatic arthritis. ठीक है. इसमें क्या होता है ना, दिस देयर इज अ कैच. ठीक है. कैच क्या है इसके अंदर कि भाई ये अर्थराइटिस तो है, बट ये सीरो नेगेटिव वाला है, ये नॉर्मल वाला नहीं है ना. दे आर इम्पोस्टर्स. ठीक है, इम्पोस्टर है ये. अर्थराइटिस का नाम तो ले लिया, ठीक है, बट ये वो नहीं है. क्यों नहीं है बताइए? क्योंकि दिस इज अ सीरो नेगेटिव वेरिएंट. ठीक है. इसमें जो है आर एफ फैक्टर, रोमेटॉइड फैक्टर एंड एंटी सीसीपी नेगेटिव है ना. ठीक है. दिस विल बी द क्वेश्चन. क्राइटेरिया कौन सा इस्तेमाल होता है? कैस्पर क्राइटेरिया इस्तेमाल करते हैं भैया, है ना. ठीक है. उससे भी जरूरी क्या है ना, ठीक है, दिस सॉसेज डिजिट्स वी सी. ठीक है. सॉसेज डिजिट्स एंड इन एक्सरे वी वुड सी पेंसिलिन कप डिफॉर्मिटी. ठीक है. I should have added the X-ray here as well. Okay, the image is just like a sausage. ठीक है. I should have added these images. No worries. We'll I'll do that later on. No worries when I send this PDF. Okay. Next up, you see, this is one topic, not of derma, it is ortho topic. Yes, but I want to take it because I feel most of the students, we mess up in this one topic. ठीक है. जो पैर बाहर जा रहा है, अंदर आ रहा है, ठीक है, lateral है, medial है. This is one thing we usually mess up. Over here you see दिस इज व्हाट कॉल्ड दिस कॉल्ड एज हेलस। ठीक है, हेलस है, और ये बाहर की तरफ आ रहा है, ये इस तरफ आ रहा है। ठीक है, तो क्या आ रहा है, लैटरल आ रहा है कि मीडियल आ रहा है? ये आ रहा है बाहर की तरफ, तो लैटरल है ये, है ना। अगर कोई भी चीज़ लैटरल आ रहा है तो वो वेल्गस है ना। ठीक है, बट इसमें इंपॉर्टेंट क्या है ना, कि भाई हमको जॉइंट से देखना है, जॉइंट से देखना है, यहाँ वहां से मत देखना, जॉइंट से कहाँ जा रहा है वो देखना है अपने को। ठीक है, इसमें देखिए आई ड्रॉन दिस डायग्राम। ठीक है, द लेग्स ओवर हियर यू सी, राइट राइट फ्रॉम द जॉइंट, राइट फ्रॉम द नी जॉइंट। ठीक है, बाहर जा रहा है तो ये वैल्गस हो गया, अगर अंदर की तरफ आ रहा है तो वो वायरस हो गया। ठीक है, ओके। Over here you see this image is taken by me. I was on the way to my class, okay, in Hyderabad, and I saw this guy, right? He was walking, and both his legs are, they're not of like same orientation. Right over here you see, it is going where, and this one is going where? Tell me. Okay, anybody who can answer me? Yes. ठीक है, जॉइंट से देखना है अपने को, जॉइंट से देखो ये अंदर आ रहा है तो ये मीडियल हो गया, मीडियल हो गया तो वायरस हो गया। ठीक है, अरे जॉइंट से यहाँ जा रहा है। ठीक है, इफ दिस पर्सन इज स्टैंडिंग स्ट्रेट देन इट विल बी वेलगस। ठीक है, ओके फाइन, इतनी बात समझ गई अपने को। अब आ जाओ नील सोरियासिस में। ठीक है, दिस इज वेरी 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 इंपॉर्टेंट पॉइंट। ठीक है, नील सोरियासिस इज वेरी इंपॉर्टेंट पॉइंट। ठीक है, इसमें क्या है, we will remember this by mnemonic. I'm not too fancy with mnemonics, right? So the lesser the mnemonic, the better it is for us. Okay, so P stands for what? ठीक है, pitting. P stands for pitting. ठीक है, yes, the nail findings in psoriasis we are doing it one by one. Okay, P stands for pitting, and the nature of this pitting is irregular pitting. ठीक है, okay. O is for oil drop. ठीक है, oil drop or onycholysis. ठीक है, and L is leukonychia, white nails. ठीक है, all right, we have over here, and H is for hyperkeratosis. Concept over here what to remember is, because of this hyperkeratosis there is separation. ठीक है, नेल है यहाँ पे, वो बढ़ते 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 इतना बढ़ गया कि वो अलग ही हो गया। ठीक है, ओनाइकोलाइसिस। ठीक है, दिख रहा है आपको? ओके, you remember this 2 3 points, you all good. So we just completed the whole psoriasis topic, right? The types are covered. Now only two things are remaining. These are the signs, right? These are the signs. So Abdullah Sheikh, you were telling about the OSPET triad. Actually it is OSPET sign. ठीक है, these are the dots we see. Okay, so what is going to happen is, superficial scales which are there, right, when we remove it this by Gartrage method, कोई fancy कुछ भी नहीं है ना। ठीक है, कुछ नहीं करते, we just take a slide, patient, ठीक है, for example have it on the extensor surface, we just take a slide and we just scrape it। ठीक है, we scrape it scrape it scrape it scrape it, and then there will be a membrane। ठीक है, membrane से आएगी, है ना, thin membrane, that membrane would be called as bulky membrane। bulky membrane, ठीक है, और जब bulky membrane when it is taken off, it would have pinpoint bleeds, pinpoint bleeds। ठीक है, ये रहे, that is called as Auspitz sign। ठीक है, Auspitz sign। now come to my triad again। yes, angiogenesis। ठीक है, angiogenesis हो रहा है यहाँ पे, है ना। ठीक है, because of this what is happening is, you see, on that area there was increased blood vessel। वैसे तो नहीं आना चाहिए ना, अगर आपको मेरे को ऐसे में घस दूं, है ना, तो नहीं आना चाहिए। ठीक है, बट इनमें जो है आ रहा है, क्यों? क्योंकि बिकॉज ऑफ एंजियोजेनेसिस। कैन यू कोरिलेट थ्री थिंग्स, थ्री फोर थिंग्स, है ना, समझ में आ रही है बात आपको, कि भाई ये जो ट्रायड है दैट इज गेटिंग फुलफिल्ड प्रॉपरली। वी कैन कोरिलेट दिस विद द क्लिनिकल फाइंडिंग्स, दैट इज अबाउट द ऑस्पेट साइन। ठीक है, कॉर्नर फेनोमेना, व्हाट इज कॉर्नर फेनोमेना, एनीबॉडी? the trauma lesions we see, right? The trauma lesions we see, okay, agar if in any conditions uh, there is a trauma and after that we see new lesion, that is true Koebner phenomena। okay, all right, the lesions that develop along the lines of trauma, fine। next up we have this true or pseudo। ठीक है, pseudo जो है वो, it is seen in molluscum contagiosum and warts। क्यों होता है? I have drawn a very good diagram about this as well when we do the viral infections। ठीक है, treatment aspect, treatment aspect of psoriasis, we'll do this। टॉपिकल जो है, ठीक है, फर्स्ट ऑफ ऑल कि भाई हमको डिसाइड करना पड़ेगा कि भाई एक्चुअल में दिक्कत क्या है ना, दिक्कत क्या है, हम लोग वो डिसाइड करेंगे कि व्हाट विल बी द, व्हेन वी वुड पिक अप टॉपिकल, व्हेन वी वुड गिव फोटोथेरेपी एंड व्हेन वी वुड गिव सिस्टमिक, सो हाउ वुड वी डिमार्केट? ठीक है, दैट इज वेयर द परसेंटेज ऑफ बॉडी कम्स इन। ठीक है, सो इट वुड बी लेस देन 10%। ठीक है, 10 to 30% एंड मोर देन 30%। ठीक है, ये चीज़ जो है हमको याद रखनी है। Over here we have, yeah, we would give corticosteroids and vitamin D. It decreases the proliferation. ठीक है, 10 to 30% अगर है तो we would give the phototherapy. Systemic involvement जो है, we would give methotrexate. Yes, and we would give one biological agent that I want to discuss over here. That is what? That is alpremast. Alpremast, right? That is very important that we need to remember it. Okay, what it does is it inhibits PDE4. Okay, fine. Okay, and it decreases the inflammation. Okay, fine. So we go on to the next one over here. That is Pityriasis rosea. Okay, we will come with this one. We do Pityriasis rosea right now. Okay, Herald patch. अगर किसी को याद होगा, this is where we come in. This is the Herald patch over here, right? What is actually happening is this is a mild inflammatory skin lesion. Okay, what is the origin of it? That is the most important thing. What is the origin of it? That is the we have a viral origin. Viral origin. Okay, fine. It is more common in children. प्रेजेंटेशन क्या होगा ना, ये सबसे पहले यही आने वाला है, हेराल्ड ही आने वाला है, ठीक है, ये रहा, सबसे पहले यही आने वाला है, ठीक है, ओके. एंड ओवर हियर यू सी द कॉलरेट ऑफ स्केल्स. यस, कॉलरेट ऑफ स्केल्स, दिस अपीयरेंस, यस, इज वेरी वेरी क्लासिकल. ओके, ऑलराइट. इन इट वी ऑल्सो हैव क्रिसमस ट्री डिस्ट्रीब्यूशन. क्रिसमस ट्री डिस्ट्रीब्यूशन, ठीक है. क्यों है ये क्रिसमस ट्री, क्या है ये चीज़, हम लोग अभी पढ़ लेते हैं. अब इसमें क्या हो रहा है कि ऑन द बैक यू सी, राइट, these lesions are there, and these lesions, you know, they coalesce with each other, and because of skin stretching they give an appearance, right, like this one. Okay, this is what is Christmas tree appearance. Okay, ठीक है. And when they coalesce with each other, right, because skin on the back is like the largest, right, on the back, what happens is when the skin is stretched and relaxed, they look like curtain. They look like curtain, so we also call this as hanging curtain sign. Hanging curtain sign, ठीक है. ठीक है, तो दो तीन नाम जो है वो बहुत ज़रूरी है यहाँ पे. नाम आपको आप देख लो, देन ऑल गुड, नथिंग टू वरी अबाउट. Diagnosis, anybody who can tell me this one, diagnosis, what is let me give you a history. Patient A, B, they both come to you and they both have these lesions, right? Okay, so मैंने एक बताया आपको हेराल्ड पैच, ठीक है, और दूसरा भी तो हेराल्ड पैच हो सकता है, दोनों भी तो डायग्नोसिस तुम, है ना, पिटरस रोजा कर सकते हो, है ना. बट क्या चीज़ होगी जो आप इसको 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 पिटरस रोजा होगा कि नहीं होगा, टेल मी, हाउ वुड यू डिफरेंशिएट दिस टू. एनीबडी हु कैन आंसर मी दिस क्वेश्चन. Yes, see, whenever we see a patch, right, whenever we see a patch, yes, so this has a correlate of scales, ठीक है, that is one thing. But in case this is not there, right, what we would do is we would prepare a KOH examination, ठीक है, and we put the slide and you annular lesions with elevated, yes, 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 yes. But the better way is that we can put prepare a slide, put it under the microscope, yes, and we can see, yes, कि भाई हाइफे दिख रहा है कि नहीं दिख रहा है, हाइफे दिख रहा है कि नहीं दिख रहा है. हाइफे अगर दिख रहा है तो वो टीनिया का इन्फेक्शन हो गया, ये रहा, है ना, ये टीनिया का इन्फेक्शन हो गया, ये है हमारे पिट्राइसिस रोजिया. ओके, सिंपल, इतनी बात समझ गई. मार्जिन, यस यस यस. ओके, it is a pretty self resolving condition, yes, within 6 to 8 weeks it resolves. Okay, that is all about that, ठीक है. So let us start with bacterial skin infections. This is very interesting. Yes, so what I've done is I've included all the micro aspect as well, ठीक है. माइक्रोबायोलॉजी जो है मैंने सारी बैक्टीरियल स्किन इन्फेक्शंस में, फंगल इन्फेक्शंस में, वायरस में, ठीक है, तो इट्स गोइंग टू बी an overlap of these subjects in here. Okay, fine. So let us just start with that. Bacterial skin infections, ठीक है. Okay, so you see everything I've just written in one page, एक ही पेज में. So it is so easy for you guys, right, just to open this page. I hope you guys have like a big device with you guys, iPad or tablet, anything. Yes, and you can just see it and it is so easy to revise. Okay, so over here let us just start with the discussion. Fine, bacterial skin infections है ना, ठीक है. इसमें देखो मेन बात क्या है ना कि भाई इन बाल इन्वॉल्व है क्या नहीं. बाल इन्वॉल्व, हेयर इज इन्वॉल्व और नॉट. इफ इट इज नॉट इन्वॉल्व इट इज नॉन फॉलिकुलर, इफ हेयर इज इन्वॉल्व इट वुड बी फॉलिकुलर वेरिएंट. लोकलाइज्ड एक जगह पे है, डिफ्यूज सब जगह पे है, ठीक है. हम लोग ऐसे ही इसको क्लासिफाई करने वाले हैं, सिंपल, ठीक है. एक जगह पे है, बहुत जगह पे. एक जगह पे अगर है, नॉन फॉलिकुलर है, बाल अगर इन्वॉल्व नहीं है, और अगर वो सुपरफिशियल है, ऊपर ऊपर ही है, तो वो क्या है, इट इज बुल्लस इम्पेटिगो, ठीक है. और अगर डीप चला गया तो एक्थाइमा, डीप चला गया तो एक्थाइमा, ठीक है। बट अगर नॉन फॉलिकुलर डिफ्यूज है, सब जगह पे है, ठीक है, तो क्या होगा, हो सकता है वो डेट इज एरिसिफिलिस, एरिसिफिलिस, ठीक है। और इफ इट इज डीप, इट इज सेलुलाइटिस, ठीक है, सिंपल। नाम नाम पढ़ेंगे अभी, है ना, सारे चीज़ों के बारे में पढ़ेंगे, ये पूरा जो पेज है हमारा इसी के बारे में है। बट इफ यू कैन लाइक कॉन्सेंट्रेट ऑन दिस वन थिंग, ऑल गुड, ठीक है। ओवर हियर यू हैव folliculitis. Yes, it could be superficial and could be deep, है ना। Over here we would have Bocard's impetigo, ठीक है, that would be that the image is there, we talk about the image as well. Perifollicular variant, ठीक है। अभी इसके अंदर आता है कि hairs are involved, hairs are involved, ठीक है। अगर एक hair involved है ना, we are talking about perifolliculitis, that is around the follicle, okay। एक hair involved है तो it would be what, anybody can tell me this one variant, tell me। We would have this furuncle, right? Furuncle is the answer. Furuncle. You guys can see it? Yes. You guys can see. Furuncle, yes, yes. Abdullah Sheikh, very correct. Very correct. Furuncle, yes. And if it is, if multiple hairs are involved, yes, around that, what it is then? Tell me. It is carbuncle. ओके, ठीक है। तो आपको इतनी बात समझ गई, इतनी बात समझ गई, आपको क्लासिफिकेशन समझ गई। अगर आपको क्लासिफिकेशन समझ गया ना भाई, ठीक है, आधी दिक्कत आपकी खत्म है, ठीक है। ये सारा जो दिख रहा है ना आपको, ये सारा very easily we would be covering it, all of it, ठीक है। very interesting actually, you know, if you learn by the concepts one by one, you know, it is very interesting to learn। non bullous impetigo, ठीक है। तो जो impetigo है वो दो तरह का है, ठीक है। it it could be either non bullous और it could be bullous, ठीक है। दोनों की etiology है जो भाई अलग अलग है, ठीक है। ऑलराइट, तो ये बात अपने को देखनी है। नॉन बुलस इसकी जो है स्टाफ और स्ट्रेप, स्टाफ और स्ट्रेप इज द वन हु इज कॉजिंग इट, ठीक है। what is happening is there are these बुल्लास, यस। व्हाट आर द कलर ऑफ द बुल्लास, टेल मी। अब बताओ, ये टॉपिक मैंने पढ़ा रखा है पहले, ठीक है। टेल मी व्हाट आर द कलर ऑफ द बुल्लास। ओके, आई विल जस्ट आल्सो जूम इट इन, ठीक है। लाइकन प्लानस, नो, यस। व्हाट आर द कलर ऑफ द बुल्लास, टेल मी। हनी कलर्ड, राइट, हनी कलर्ड, यस। ओके, golden honey colored crust, right, we see। okay, that would be the answer over here, okay। what are the complication of it, this is very interesting। what are the complication, जब भी आपको दिखे ना ये जो दो भाई है जो है ये, ठीक है, स्टैफ एंड स्ट्रैप, ठीक है। कॉम्प्लिकेशन में यू जस्ट मार्क PSGN, ठीक है। ठीक है, PSGN पोस्ट ग्लोमेरुलर नेफ्राइटिस, ओके फाइन। यू जस्ट मार्क दैट एंड इट इज ऑल गुड, ठीक है। और दैट इज द कॉम्प्लिकेशन अबाउट इट। what would we do for the treatment is we would give topical mupirocin or we can give oral antibiotics as well, ठीक है। bullous impetigo, bullous impetigo में what is the etiology, yes, what is actually happening is the toxin is the one who's causing the mayhem। toxin is by staph aureus, staph aureus is releasing the toxin, okay, all right। what is doing is this toxin is going ahead and destroying the desmosomes, destroying the desmosome, that is the reason you see, we see these blisters, okay, are you guys concentrating with me, that is the reason we see these blisters, okay, all right। it this epidermolytic toxin is the one I want you to focus on, okay। bullous impetigo we are reading about, ठीक है। अगर ये लोकल है तो बुलस इम्पेटिगो, अगर ये सिस्टमिक है तो वो स्टेफाइलोकोकल स्कैल्डेड स्किन सिंड्रोम, ठीक है। ये क्या चीज़ है वो यहाँ पे है, ठीक है, ये रही वो चीज़, ठीक है। दैट इज द रीजन दिस माइंड मैप्स मेक एवरीथिंग सो इजी, है ना। वी कैन स्विच बिटवीन टॉपिक्स एंड कनेक्ट, यू नो, वी कैन मेक ऑल दिस कनेक्शन सो इजीली, राइट। दैट इज ऑल अबाउट इट, okay। we have over here is, here you see, okay, I will ask you one question regarding uh, ophthalmology। yes, this is what is called as हाइपोपियन, ठीक है, ये हाइपोपियन है। अगर ये हाइपोपियन है, ठीक है, तो आप मुझे बताइए, हम ऑप्था पढ़ते हैं उसके अंदर भी हाइपोपियन आता है ना। बट किसमें दो तरह के इन्फेक्शन जो होते हैं, एक तो या तो हो सकता है फंगल है या तो बैक्टीरियल है, ठीक है। एक महीना बाकी है एग्जाम को, तो हमको ये क्वेश्चन जो है आना चाहिए, ठीक है, इज हॉट टॉपिक। फंगल में भी आता है हाइपोपियन, बैक्टीरियल में भी आता है हाइपोपियन, तो फर्क क्या हुआ। anybody who can answer me this question, ठीक है। what is the nature of hypopion in fungal corneal ulcer, anybody who can tell me। yes, the answer would be, this is, if it is fungal, it is fixed, it will not move, if you tell the patient it will not move, but ठीक है, it will not move. Okay, in bacterial it will move. Yes, it would be sterile. Yes, 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 yes. But we're talking about the, yes, that would be the nature of hypopion as well. But it will, in fungal, it is fixed. In bacterial, it is not fixed. Okay, when you tilt the patient, the hypopion will move. Okay, okay, fine. We come up to the reason why this blister is forming. I will tell this one time. Okay, the this is a summary of everything we read about, and why the blisters are formed in bullous impetigo. This slide will explain it. What is actually happening is the staphylococcus, right? It enters the skin, it creates the toxin, the epidermolytic toxin. Okay, because of that, there is the desmosomes are broken. Desmosomes are broken. Okay, and because of this, you see, there is free spaces, and the acantholytic cells are formed, and this free space is being formed by what? Yes, this free space, and this is filled up by the fluid. This is why there is a formation of blister. Okay, this is why there is a formation of blister. Okay, fine. I hope this is clear to you guys. Okay, next up we have is ecthyma. Okay, next up we have ecthyma, and over here you see this is caused because of either it could be streptococcal or it is staphylococcal. And over here you see this appearance is very classical, right? This ulcers are formed. Ulcers are formed. Okay, fine. Next up, you see, we're going to start with the diffuse variant, that is erysipelas and cellulitis. Let us just compare these two and study. In erysipelas, erysipelas, right? What is actually happening is the etiology. Beta hemolytic group A streptococcus is the one. Okay, and in this, the margins would be very clear margins. You see, when we can just compare these two diagrams and we can, complete this topic. Erysipelas, what it is, clear demarcation. Cellulitis, it is diffuse. ओके, ऑलराइट। इसमें ऐसा क्यों हो रहा है बताओ, इसमें ऐसा क्यों हो रहा है? क्योंकि बात यह है कि ओनली द सुपरफिशियल डर्मिस इज इन्वॉल्व इसमें, है ना, अंदर तक नहीं गई बात। इसमें जो है डर्मिस अंदर तक चली गई बात, जो इन्फेक्शन है वो अंदर तक चला गया। इस वजह से देखिए जो कितना डिफ्यूज वेरिएंट है ना। ठीक है, आप जो दूसरी जो इमेजेस हैं आप उसमें भी देखिए, है ना, कितनी क्लियरली इसमें बताया, ऐसे लिए इसे कंफ्यूज मत कर लेना, ठीक है। ऑलराइट, वी हैव ओवर हियर दीज आर टू थिंग्स, दैट इज एरिसिपिलिस एंड सेलुलाइटिस। ओके, फॉलिकुलर इन्फेक्शन, ठीक है। अब नाउ द हेयर्स आर इन्वॉल्व, हेयर्स आर इन्वॉल्व, ठीक है। अब तक जो है बाल इन्वॉल्व नहीं थे, अभी बाल आ गए है ना। तो दिस इज डीप एंड सुपरफिशियल, दिस इज द डीप वेरिएंट, यू कैन सी दिस इज द डीप वेरिएंट। ओके, एंड दिस इज सुपरफिशियल वेरिएंट, ठीक है। और ये जो इमेज है ना, ठीक है, दिस इमेज इज वेरी वेरी क्लासिकल, यू शुड नो अबाउट दिस वन। व्हाट इज दिस? दिस इज व्हाट इट इज, टेल मी। This is Bocard's impetigo, Bocard's impetigo. Okay, this is important, we should know this. Okay, पेरीफोलिकुलाइटिस अराउंड द फॉलिकल्स। फर्स्ट अप वी हैव फरंकल एंड कार्बंकल। अगर एक हेयर इन्वॉल्व है तो फरंकल है, उससे ज़्यादा है तो कार्बंकल है। आप एक देख लीजिए, यूजुअली आफ्टर लाइक shaving, maybe somebody have it, somebody don't have it, but we all, some, the guys, right, guys and girls as well, after the shaving, usually one abscess would be there, ठीक है, one furuncle would be there, ठीक है। ये रहा, और ये रहा नॉर्मल फरंकल एंड कार्बंकल। ओके, all right, fine, we done with that part. Yes, and over here we just start with this one, that is the toxin mediated thing, right? Toxin mediated. Over here, please mind that there is source of infection, एपिडर्मोलाइटिक टॉक्सिन बन रहा है, उस वजह से जो है सारा मेहम हो रहा है। अगर आपको इतनी बात पता है ना, दिस टॉपिक इज वेरी इजी फॉर यू गाइस, आई एम टेलिंग यू, ठीक है, बहुत आसान है हमारा टॉपिक अगर आपको ये इतनी बात पता है तो, ठीक है। ऑलराइट, where is this infection coming from? Tell me. In this kid, right? In this kid, where is this infection coming from? There could be from otitis media, है ना। otitis media की वजह से जो है वहाँ पर infection हो गया है, and that is the reason it is entering the whole systemic circulation, right? Yes, it could be because of that, and because of this there is whole mayhem which is happening. Yes, but the most classical thing is, yes, perioral scaling and crusting, ठीक है। perioral scaling and crusting would be very very important over here, that we need to know, ठीक है। Nikolsky sign is positive. What is this Nikolsky sign? Is that when there are blisters, we just push, we add a tangential pressure to the blister, it just scups off. Okay, that is what it is. Yes, okay, that is that is all about Nikolsky sign. Okay, all right, We're done with the major chunk of it. We're keeping the most interesting for the last. Huh? Or we have Corynebacterium infection. Yes. Okay. The anthrax will be taking in the last part. Okay. Corynebacterium infection. Three things could be caused because of this. ठीक है. Cause पता होना चाहिए. एक तो है एरिथ्राज्मा, पिटेड केराटोलाइसिस एंड वी हैव ट्राइकोमाइकोसिस एक्सिलैरिस. ठीक है. तीन चीज जो है इसकी वजह से हो रही है. अब बताइए, anybody who can tell me the color of investigation, Wood's light. Tell me, what would be the color in Wood's light? Anybody who can tell me? We discuss about this. Yes, yes, Salman Chaudhary, you are absolutely correct. Coral red. Yes, ठीक है. Very correct. He said coral red. Okay. Yes, yes, yes. Abdullah Sheikh, you very. Due to what? Due to what? Tell me. पढ़ा है ना ये बात, ये तो मैंने पढ़ा रखा है, वापस से आ गया ये, है ना, हमने बेसिक्स में पढ़ी थी बात ये, है ना, बताइए. ड्यू टू porphyrins, due to porphyrins. Okay. In petit keratolysis, what is important is these feet. Yes. So all the foot fetishes are getting accomplished right here. Do you see these small dots? Yes, in the skin, very beautiful looking. It is because of Corynebacterium. Okay. Trichomycosis axillaris. If you are having a dinner, yes, right now you can definitely adore this image and have a wonderful dinner. Yes, and this is all about Trichomycosis axillaris, right? But the two things what is important is, one is the Corynebacterium infection. The second is, it is not a fungal one. It is not a fungal one. कहाँ गया? ओके, इट इज़ अ मिसनॉमर. ये माइकोसिस पढ़ के जो है ना, आप ये मत कर देना कि नहीं मैंने ये देखा था तो फिर ये Corynebacterium कैसे होगा. इट इज़ अ मिसनॉमर. ठीक है. ओके, that is all about it. Yes, so now we come with the anthrax. Now the question is waiting for you guys. Okay, are you guys ready for the question? ठीक है. एंथ्रैक्स जो है दो तरह का होता है. ठीक है. ये कौन सी तरह का एंथ्रैक्स है आप बताइए मुझे. ठीक है. चलो मैं बोल देता हूँ. अगर आप लोग नहीं बोलोगे 3 सेकंड में मैं बोल दूंगा ये आंसर. ठीक है. तो नेक्स्ट बट आपको देना पड़ेगा. ओके, शौर्य त्रिवेदी. यस. एक्टिनोमाइसिस का है. एक्टिनोमाइसिस का है. ए. क्यूटेनियस. यस, सलमान चौधरी. वेरी करेक्टली सर, सलमान चौधरी. वेरी गुड. This is the cutaneous variant. Okay, good. So what is the other variant? Tell me. We read in micro. We read in micro. Yes, tell me. What is the other variant? Other variant is the pulmonary anthrax. है ना? Pulmonary anthrax is the another variant. Okay, ठीक है. The occupation. This is an occupational hazard. है ना? ठीक है. तो ये किस में होता है बताइए? जो cutaneous anthrax है, सलमान चौधरी आप बताइए और बाकी सब भी बताइए कि किस में होता है. ठीक है. What occupation predisposes us of having this? This is a hide porter's disease, है ना. ठीक है. तो the skin of the animal, like the people who are working in the leather industry, okay, they put this thing on the back and the animal is actually infected with the anthrax, and this is when they have all these cutaneous manifestations. Okay, all right. ठीक है. Next up, I said you about the pulmonary anthrax. ठीक है. I said you about pulmonary anthrax. Let me just write that point down. Something wrong with the pencil? Just a moment, guys. No worries. Okay, something wrong with the pencil. No worries. So pulmonary anthrax. Okay, uh, what is the occupational hazard about the pulmonary anthrax? Tell me, what is it? The answer is wool sorters, right? The people who are in wool industry. Yes. Okay, that is the one. They inhale the spores and then they have this. Okay, all right. इतनी बात समझ गई आपको? All right, so we are done with all the bacterial skin infections all at one site. Okay, so I hope this discussion is good. Yes, everything is nice. This mind maps thing, right? We should be definitely revising it multiple times, and then it is all good. Nothing to be bogged down about. Okay, next up we have the fungal infections. I have prepared 3 slides about fungal infections. 3 slides. Okay, massive slides. This will be like a long topic. Okay, fine. All right, let us just start with it. Fungal infections. Even here, I just want you to focus on this one part. If you know this one slide over here, like this part, then you will easily be able to elicit all those you can clinically you can correlate things very easily. Okay, about here what we see, the superficial, right? If the fungus is just involved in the superficial part, okay, superficial epidermis and the dermis is involved, okay, in this one, superficial epidermis, okay. अब बताइए सुपरफिशियल में क्या था? बिग स्ट्रॉन्ग गाइज लव कॉफी, है ना? बिग स्ट्रॉन्ग गाइज लव कॉफी, सबसे ऊपर कौन था? बताओ, सब कौन था? बताओ। ठीक है, सबसे ऊपर था स्ट्रैटम कॉर्नियम, है ना? ये जो लिखा है यहाँ पे यही तो है आंसर, है ना? स्ट्रैटम कॉर्नियम, ओके, ऑलराइट, है ना? इफ नाउ टेल मी, डज दिस लेयर हैव एनी सेंसरी इनर्वेशंस? ये स्ट्रैटम कॉर्नियम, अब्दुल्ला शेख, यू आर करेक्ट। सेंसरी इनर्वेशंस है क्या? नहीं, नहीं है ना? ऊपर वाले में तो नहीं है, डर्मिस में हमने पढ़ी थी, है ना? ठीक है, अगर नहीं है तो क्यूटेनियस मैंने तो सिस्टमिक मैनिफेस्टेशन आएंगे कि नहीं आएंगे? नहीं आएंगे, यस, ओके। इट इज अ डेड स्ट्रक्चर, हेंस इट इज एसिम्प्टोमेटिक, ठीक है। डिड यू गाइस गेट इट? यस, श्योर एज त्रिवेदी लाइफ ऑफ अ डॉक्टर, नो, यस यू गाइस आर करेक्ट, ओके। दैट्स व्हाई यू सी, you know, in Pityriasis versicolor, right, we have these lesions, right? But the person is not, uh, it doesn't itch. The person is comes because of the hypopigmentation. The reason the patient comes to us is because of the hypopigmentation part. All right, fine, okay. So we're done with one thing, and these are the other examples, that is Pedra and this Tinea nigra are examples of this as well. How about the next one? That is, these are the cutaneous features, right? The cutaneous features which are there. Tell me, what is this? In this, tell me, will there be systemic manifestation, yes or no? ठीक है, खुजली आएगी कि नहीं? बताओ। ठीक है, खुजली आएगी कि नहीं आएगी? खुजली जो है ज़रूर आएगी, है ना? सिम्टोमेटिक इचिंग जो है होने वाली है, ठीक है। क्यों? क्योंकि यहाँ पे डीप डर्मिस, यस यस यस, सलमान चौधरी, यस यस, मोहम्मद आसिफ, वेरी करेक्ट, ओके, ऑलराइट, that is the reason, right? So if we know the concepts, so we don't need to memorize कि डर्मेटोफाइट्स में भाई खुजली आने वाली है ना? ठीक है, और टीनिया वर्सिकल में खुजली नहीं आने वाली। नाउ यू नो द एग्जैक्ट रीजन, दिस इज वेयर हाउ वी गेट कॉन्फिडेंस, राइट, है ना? एग्जाम में बैठे हैं, कॉन्फिडेंस से भी आता है ना, हमें मुझे एग्जैक्टली वो चीज़ पता है कि एक्चुअल में हो क्या रहा है ना? तभी तो मजा आता है कोई चीज़ करने का, यू नो, लाइक कि ऊपर ऊपर से पढ़ के भाई कोई मजा नहीं है ना? वी शुड नो द एग्जैक्ट डिटेल्स अबाउट एवरीथिंग वी रीड, राइट? In subcutaneous infection, we have chromoblastomycosis, and yes, somebody mentioned about the Madurai foot. This is what we will be covering in this, right? So sporotrichosis and actinomyces are also examples of this. We would be covering that as well. Okay, so let us just begin with Pityriasis versicolor, that is Tinea versicolor as well. Etiology बताइए, copper penny bone. Yes, 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 yes. Etiology बताइए इसकी. Tell me. Etiology is Malassezia. Yes, okay, this is the one who's causing it, and even in Malassezia there is Malassezia globosa who's causing it, okay. It affects only the superficial epidermis. We talk about a lot about this topic, okay. Clinical features, tell me, there is perifollicular, yes, perifollicular hypopigmentation, you see over here, है ना? ठीक है, जैसे फॉलिकल, ये जो रहा बाल रहा, इसके आसपास जो है वो है अटैक कर रहा है, ठीक है। फरफर ऑल्सो, यस यस यस, मेलासीजिया फरफर एज वेल, यस, सलमान चौधरी, वेरी करेक्ट, यस, मेलासीजिया फरफर एंड मेलासीजिया globosa, both of these would be causing it, okay. But the answer, if you tell me both globosa, you have to pick that as well, okay, all right. Perifollicular distribution is there, and in it, it is very interesting, this sign is very interesting, that is a scratch sign. If a patient comes to you, right, Pityriasis versicolor patient comes to you, and if you ask, just like just scratch on that lesion, what's going to happen is, क्या होने वाला है कि वो जो lesion है बहुत ही properly दिखेगा, it would be very well demarcated, ठीक है, it would be very well demarcated, है ना? इसकी वजह से क्या होने वाला है कि it would be easy for us to diagnose, है ना? ठीक है, सीधी सी बात है, it would become more prominent, ओके। इतनी बात समझ गई आपको, है ना? अभी आओ ना, एक क्वेश्चन जो मैं आपको पूछने वाला हूँ, ठीक है, कि जो लीजन्स हैं, ठीक है, वैसे कलर के, वो हाइपर पिगमेंटेड हाइपो पिगमेंटेड दोनों होंगे या एक ही होगा? हाइपो पिगमेंटेड ही होगा, बचपन से, मतलब व्हेनेवर वी सी दिस इज वन इमेज वी सी, राइट, ओके। हाइपर होगा, हाइपो होगा, टेल मी, और इट वुड बी बोथ? When I used to read, right, in my initial time, I used to always think that कि भाई खाली हाइपो ही होता है, but ऐसी बात नहीं है ना? The answer is that it is either hypo or hyper. No, the answer is both. Salman Chaudhary, the answer is both. Okay. All right. You see, that is the reason I made sure, like, I add this image. Muhammad Asif, you're very correct. Both. Okay. What is the reason? Yes, regarding this hypopigmentation and hyperpigmentation. Tell me. Okay. Hypopigmentation is because of what? यस। तो ये जो मेलासीजा ग्लोबोसा मेलासीजा फरफर जो है कुछ तो बना रहा है, ऐसा है ना, बैठ के कुछ तो बना रहा है ना, ताकि जो है हाइपोपिगमेंटेशन पैच आ जाए। तो वो क्या बना रहा है बताइए? क्या एनीबडी हु नो दिस? एनीबडी हु नो दिस? टेल मी। इट इज मेकिंग, यस, अजीलिक एसिड। अजीलिक एसिड, ठीक है। इसकी वजह से जो है इट इज इनहिबिटिंग द टायरोसिनेज इन द मेलानिन प्रोडक्शन, ठीक है। दैट इज द रीजन वी हैव हाइपोपिगमेंटेड पैचेस, ठीक है। All right, very interesting things to know, right? When we know all these nitty gritty details, right? So it is very interesting to remember things. For me, I definitely, these things are very easy if I know these details. Otherwise it is just memorization thing, right? Hyperpigmentation क्यों हो रहा है, ठीक है? It is just because there are abnormally large melanocyte. Okay, fine, ठीक है। इतनी बात हो गई हमारी इन्वेस्टिगेशन में। वही सेम बात हमने पढ़ी है ये कि these are the spaghetti and meatball appearance, है ना, ठीक है। We'll see pale yellow color and spaghetti and meatball appearance, ठीक है। Wood Islamic pale, yes, yes, Salman Chaudhary, very correct, spaghetti and meatball appearance, okay। We would give azoles, okay, we would give azoles, yes, in this one। But the thing is, uh, what the question comes कि भाई क्या देना क्या नहीं है ना। अजोल फैमिली में कौन सी जो ड्रग है जो नहीं देना है ना। तो anybody who know this answer? The answer would be that it is hepatotoxic, yes, it is hepatotoxic, and the answer is कीटोकोनाजोल, है ना। ओरल कीटोकोनाजोल जो है वो हेपेटोटॉक्सिक है, ठीक है। तो हम नहीं देंगे। हम व्हाट वी विल यूज, वी वुड यूज ओरल इट्राकोनाजोल एंड फ्लूकोनाजोल। दीस आर टू थिंग्स दैट वी वुड यूज, ओके। ऑलराइट, एंड वी आल्सो हैव ओरल टर्बिनाफिन एंड ग्रेजोफल्विन। ये देंगे क्या नहीं देंगे? ये नहीं देंगे, काम ही नहीं करता है। तो जो काम नहीं करता है वो ज़्यादा पता होना चाहिए भाई क्या नहीं काम करता, ये कौन सा पैराटॉक्सिक है, ठीक है। ओके, एंड these are the, like, the limitless hot words, okay, that I want you guys to know about this topic, right? I also wanted to make a series regarding all these limitless hot words regarding the complete derma. If you see this thing, then mark this, something like that. Definitely, we'll make a video with that as well. If you see hypopigmented macules which become prominent on scratch, hypopigmented macule which become prominent on scratch, which sign is positive? The scratch sign is positive over here, right? So the answer would be Versicolor. Okay, fine. You have things over here done, ठीक है। Versicolor वाला पूरा टॉपिक हो गया। अब आ जाओ पीड्रा पे। दो पीड्रा होते हैं, व्हाइट पीड्रा, ब्लैक पीड्रा, ठीक है। तो पीड्रा हॉटे एंड ट्राइकोस्पाइटोम बिजली, दिस इज द वन हु इज कॉजिंग इट, ठीक है। ओवर हियर यू सी दिस ब्लैक हार्ड ब्लैक नोड्यूल्स, दिख रहे हैं कि नहीं दिख रहे, है ना। हार्ड ब्लैक नोड्यूल्स दिख रहे हैं ना आपको, है ना। दैट इज व्हाट इज पीड्रा, ब्लैक पीड्रा, ठीक है। द नेक्स्ट अप वी हैव इज राइट हियर, इट इज द व्हाइट पीड्रा, ठीक है। तो सॉफ्ट नोड्यूल्स व्हिच यू सी, द सॉफ्ट नोड्यूल्स दैट यू सी, यस, दिस इज बिकॉज ऑफ ट्राइकोफाइटोन बिजली, ओके। ऑलराइट, we have this thing done, okay। Over here you see we are completely done with the superficial variant, all done, okay। We will go on to the cutaneous variety now। आ जाओ अभी cutaneous variety पे, ठीक है। अभी इसमें एग्जांपल क्या क्या थे हमारे, कैंडिडियासिस एग्जांपल था, है ना, ठीक है। अभी आ जाओ कैंडिडियासिस, जब भी हम लोग देखते हैं ना, ठीक है, वी ऑलवेज रिमेंबर दिस वन इमेज, है ना। ये इमेज हमारे दिमाग में थी, वाइट ओरल थ्रश आ रहा है, ठीक है, विच इज इजीली बी स्क्रैप्ड ऑफ, ठीक है। दिस वन इमेज वी ऑलवेज हैव इन आवर हेड, बट द थिंग इज, राइट, what is important is to know the other types of candidiasis as well, okay। Tell me about this one, anybody who know this? मजा आ जाएगी भाई अगर, if you know this then it is like good, you guys are prepared for the exam, yes। Tell me anybody who know this? This is the red type, this is an antibiotic tongue, this is erythematous type, this is red type of candidiasis, ठीक है। तो खाली white नहीं होता, red भी होता है ना, ठीक है। व्हाइट नहीं होता, रेड भी होता है, दैट इज व्हाट इट इज इंपॉर्टेंट, ठीक है। तो अगर हम पूरा पढ़ेंगे तब तो जाके हमको पता चलेगा भाई कि कौन से कौन तरह के हैं। खाली हम लोग अक्सर क्या होता है, PYQ करते हैं, ये पढ़ते हैं और चले जाते हैं, एग्जाम में आ जाता है कुछ और, ठीक है, फिर बोलते हैं भाई कि पास नहीं हुए। आप हम लोग अगर जब पूरी पूरी टॉपिक पढ़ेंगे तब तो नहीं बात समझेगी हमको कि एक्चुअल में हो क्या रहा है, ठीक है। तो वी जस्ट स्टार्ट विद दिस टॉपिक, दिस इमेजेस आई हैव एडेड जस्ट टू गिव एन इंट्रोडक्शन, ओके। कैंडिडा जो है इट इज नॉर्मल कंडीशन में रहता है हमारे बॉडी पे, ठीक है, बट इट बिकम्स पैथोजेनिक अंडर फेवरेबल कंडीशंस, देयर आर सर्टेन प्रीडिस्पोजिंग कंडीशंस, राइट? क्या कौन से कंडीशंस हैं कि भाई अगर किसी को दे आर इम्यूनो कॉम्प्रोमाइज, ठीक है, और इफ यू नो इफ समबडी इज यूजिंग सम सॉर्ट ऑफ डेंटल थिंग्स, ठीक है, बूढ़े लोग जो है क्या इस्तेमाल करते हैं, जैसे कि जिनके दांत नहीं होते हैं ना, ठीक है, दे यूज सम सपोर्टिंग थिंग इन द टूथ, राइट? उसको क्या बोलते हैं ना, क्या बोलते हैं बताइए? एनीबडी हु नो दिस? एनीबडी हु नो दिस? Yes, the answer would be dentures, right? Dentures would, they would use dentures, right? So if they are ill fitting dentures, उसकी वजह से भी हो सकता है, बिल्कुल हो सकता है ना, ठीक है? That is also predisposing factor of having the candidiasis. Yes, dentures, Mumina Bhati, very correct. Yes. Okay, fine. So types of candidiasis. So I gave you already a preview about this as well. Yes, so this is white plaque and the red plaque. Okay, white plaque क्यों हो रहा है, ठीक है? It is because, ठीक है, grayish white plaque on the surface. Okay, Anas Sheikh very correctly said dentures. Okay, Anas Sheikh very correct. Okay, they can easily be scraped off. That is one thing. Okay, all right. Yeah, and it is because of leukoplakia. Leukoplakia, tell me, it can be scraped off or not? Or not? It cannot be scraped off. Yes, okay, it cannot be scraped off. Leukoplakia हमने ये पढ़ा है जब हम लाइगन प्लानस कर रहे थे, कोई नई चीज़ नहीं है आपके लिए, ठीक है? Okay, leukoplakia. All right, Salman Chaudhary, no, yeah, very correct, very correct. Chronic pseudomembranous candidiasis, tell me. Okay, it cannot be scraped off. Okay, and this is the pre-malignant lesion. Tell me about this one, the red flag which are there. Red flag which are there, the two conditions which is there, right? So this image I already talked about. This is what? This is antibiotic tongue. Antibiotic tongue, है ना? ठीक है? All right, and over here, this is the denture thing I was talking about. Okay, the red flag which are there. Okay, fine. We go to the next variant. Yes, this is over here. What is कैनेडा में सबसे जरूरी बात क्या है ना कि भाई हमको पता होना चाहिए कि ये चीज़ कहाँ पर है, ठीक है? कोई आपको एकदम डिटेल में नहीं पूछने वाला, बट अगर आपको पता है कि भाई कैनेडा इंटरट्राइगो जो है वो ऐसा दिखने वाला है, तो आप जो है क्वेश्चन सही करके आ जाओगे, ठीक है? ये वेर इट इज हैपनिंग इज इन द ग्रोइंग, ठीक है? ये धोबी इच नहीं है भाई, है ना, ठीक है? दिस इज नॉट धोबी इच, प्लीज प्लीज बी वेरी केयरफुल रिगार्डिंग दिस कैनेडा इंटरट्राइगो, ठीक है? Be very careful about this. Next up we have is Candida pelarcae. It happens, and the angles of mouth. Vulvovaginitis. Vulvovaginitis also Candida is involved. There would be severe itching. Severe itching would be there, right? Would be pruritus, yes. And there would be white curdy discharge. Okay, white curdy discharge would be there in Candidal vaginitis. Okay, fine. The next up we have ये है हमारे पास में, that is बैक्टीरियल वेजिनाइटिस में क्या हो रहा है? आपको मैं एक बात बहुत ज़रूरी है यहाँ पे, प्लीज माइंड दिस थिंग, दैट इज आई एम टॉकिंग अबाउट वेजिनाइटिस एंड इट इज नॉट वेजिनोसिस, ठीक है? ओके, ऑलराइट, वेजिनाइटिस एंड वेजिनोसिस. Alright, over here you see what would be the color of discharge? Greenish discharge, right? The greenish discharge would be there. Okay, there would be greenish discharge. Fine. Most candidal infection, right, they are non-sexual. Okay, then what is the predisposing factor about this? Tell me, what could be the predisposing factor, right? it there could be diabetes, yes, or if the person could be taking a lot of antibiotics, that could predispose to that. Now tell me, क्वेश्चन जो है यहाँ से बनता है, क्वेश्चन क्या है कि भाई पार्टनर को ट्रीटमेंट करना है कि नहीं करना है, बताइए? पार्टनर को ट्रीटमेंट करना है कि नहीं करना है? पार्टनर का ट्रीटमेंट जो है नहीं करना है ना, ठीक है? सो पार्टनर विल नॉट बी ट्रीटेड. ओके, फाइन. ओके, सो विल फिनिश दिस अप एंड विल गो फॉर अ ब्रेक. यस, we'll finish this topic and we'll go for a break. And the next up we have is Candida balanitis. Okay, the papules over the glans penis. Okay, but the presentation, the type of presentation, sir, greenish trichomycosis. Yes, yes, in both we see. Okay, all right. uh, Candida balanitis. Okay, over here the presentation is very important. Yes, कि कब होने वाला है? That is immediately after a sexual intercourse. Immediately after a sexual intercourse we would have this. Okay, and if the prepuce is involved, it is called as balanoprosthitis. ठीक है, balanoprosthitis बोलते हैं इसको, ठीक है? फिशर्स होंगे, ठीक है, नहीं भी हो सकते हैं फिशर्स, ठीक है, but it is also suspected, right, in patients having diabetes. Okay, fine, because it impairs the healing property. The last up we have is paronychia around the nail. ठीक है, 2-3 things are very important over here in paronychia to get a question right. Yes, what are the things, right? That no yellow discoloration of the nail plate. ठीक है, we just zoom it in. ठीक है, देखो नाखून के आसपास जो है ना, यहाँ पे इन्फ्लेमेशन है, यहाँ पे इन्फ्लेमेशन है, यहाँ पे इन्फ्लेमेशन है, ठीक है, पस भी है, यहाँ पर है, but nail is okay. Nail is okay. Okay, there will be red erythema around the proximal nail fold. All right, and there will be no subungular hyperkeratosis. ठीक है, तो किसमें दिख रहा था subungular hyperkeratosis? किसमें दिख रहा था बताइए? In psoriasis, right? We read about psoriasis, है ना, उसमें दिख रहा था subungular hyperkeratosis. If you guys remember the image, okay, that was one about it. And the history of water work. Okay, that is one thing about it. Fine. That is all about the cutaneous infections. Okay, next up we have the dermatophytosis, and now we will take a break about 10 minutes. We will take a break and we'll just, it is already 8:02. We would start at 8:10, right? 8:10 we'll start the discussion. Okay, all right, I'll see you in about 8 to 10 minutes. Okay. right, so let us begin. It is exact 8:10. Fine. We just start. All good. We start our session. Okay. That's fine. Fine. Let us start our session. Okay. Fine. It is already 8:10. Cool. Uh, Dermatophytosis. This topic is very important. Yes. Uh, all right. लेट अस स्टार्ट विद दिस, ठीक है, बहुत ज़रूरी है ये, बट सबसे ज़रूरी इसमें क्या है ना कि आपको पता होना चाहिए कि जो टेबल है सामने दिख रहा है जो, ठीक है, वो टेबल एक्चुअल में क्या है ना। इसमें जो है तीन चीज़ें यहाँ पर, ये देखिए आप, ट्राइकोफाइटोन, माइक्रोस्पोरम एंड एपिडर्मोफाइटोन, तीन चीज़ें हैं यहाँ पे, ठीक है। ऑलराइट। तब इसमें है कि बट ये स्किन, हेयर एंड नेल तीन जगह ही अफेक्ट कर रहा है, ठीक है, बट अक्सर क्या होता है ना कि वी आर कंफ्यूज इन दिस, ओके, दैट इज व्हाट द प्रॉब्लम इज, वी आर यूजुअली कंफ्यूज कि भाई किसमें क्या होता है किसमें नहीं होता है, ठीक है। सो what I'm going to do is I'll give you a very easy mnemonic, okay, with that it is very easy, right? So definitely skin is all, सब जगह होगा, ठीक है, बट किस में नहीं होगा, है ना, ठीक है। सो इन एपिडर्मोफाइटोन, राइट, देयर इज, it will not affect the hair, okay, and it will affect, these two guys would affect, okay, but and the microsporum which is there, okay, it will not affect the nail, ओके। एम जो है वो एन को अफेक्ट नहीं करेगा, माइक्रोस्कोप जो है एन को अफेक्ट नहीं करेगा, ठीक है, बाकी दोनों को अफेक्ट करेगा, इट वुड बी प्लस एंड प्लस, ओके, फाइन। अब how to remember this is just by very simple mnemonic over here, right, what is it, e, epidermophyton, e which is there, okay, in alphabet, a b c d e f, in the alphabets what is happening is e is very close to h, zoom it in, e is very close to h and m is very close to n, right, e is very close to h and m is very close to n, right. So because of this, you see, e will not affect h, epidermophyton will not affect the hair, and the microsporum will not affect the nails, okay, simple, okay, epiderm, इतनी बात समझ गए आपको, if you do this then it is all good, nothing to worry about, okay, fine. Over here you see we have three different types, that is microconidia, yes, shape, pencil shape, spindle shape and club shape, right, respectively about trichophyton, microsporum and epidermophyton, okay। टीनिया इन्फेक्शन जो है बहुत ज़्यादा हम कवर करने वाले हैं इसके अंदर, ठीक है, टीनिया इन्फेक्शन, ओके, ऑलराइट। Examples you should remember, okay, this is one thing we need to know about, all the tinea infection, right, except capitis, okay, most common organism, what you need to answer is trichophyton rubrum, trichophyton rubrum, we need to answer this, okay, and in tinea, but except tinea capitis, in tinea capitis किसमें, what should be answered then, Trichophyton violacum, Trichophyton tonsillaris, and Microsporum canis. Okay, there are three things that we need to remember about. Okay, how do we do the diagnosis? KOH में देखेंगे हम लोग, KOH डालेंगे, we put it under the slide, and we would see what, we would see a septate hyphae. Yes, branched hyphae we would see them. Okay, very classical thing that we should know about. Okay, टॉपिकल ट्रीटमेंट क्या क्या करने वाले हैं हम लोग इनके लिए, वी वुड गिव नेल लैकर्स, yes, we would give, and what is an example of nail lacquer, this thing is important, right. So amrolfin, right, so I'll also include the image as well, right, amrolfin, okay, that is one thing, that is we just apply it once a week, and there is continuous action of this drug because of this, okay. Systemically, when do we give the systemic drugs is, if you know this one thing, then it is all good. Systemic drugs are being given when the three or more nails are involved, okay, systemic treatment is being given only then, okay, all right, we would give itraconazole and terbinafine, okay, and these are the doses, okay. The next thing is pulse therapy, why, high doses for short period, simple, okay, all right, no worries with that. Now let us come with tinea capitis, okay, tinea capitis, yes, it is in the scalp area, okay. Over here, if you remember the one concept about the nature of the fungal spores, this whole topic is done, okay, we would sir, but epidermophyton में सब है, Oh yes, yes, yes. This will be E will not give H. I'm sorry about this. Okay, this will be negative, right? Okay. Thank you, Abdullah Sheikh. All right. Okay. Thank you, Abdullah Sheikh, for that. Okay. Fine. Tinea capitis. Okay. Thank you for pointing that out. In Tinea capitis, the nature of the spores, right? That is important. The nature of the spores. Yes. One thing we need to do over here is if it is endothrix or if it is ectothrix. Endothrix or ectothrix. Okay. Agar endothrix है, it is fungal spores are inside the hair shaft. Ectothrix है, it is outside the hair shaft. Okay. Inside and outside. Okay. All right. Fine. And over here you see, yes, the non-inflammatory and inflammatory one. There are two things over here. All right, two things over here, that is non-inflammatory and inflammatory. Because of this, there will be scarring alopecia or it would be non-scarring alopecia. Okay, two things would be here. Okay, organisms are very important over here. That is the Trichophyton violaceum and Trichophyton tonsularis. Two things that we need to remember. Okay, all right, two things that we need to remember over here. Okay, Trichophyton violaceum and Trichophyton tonsularis. Okay, yes, this the presentation are the most important things in this four things you are seeing, right? The presentations are the most important ones. Okay, over here you see these are the black dots. The black dots you see over here, I can just zoom it in if you get this PDF. Yes, you can also zoom it in and see it very clearly. There are these certain black dots which are there. Why these are there, right? Because of the nature of the fungal spores. Because of this, what is happening is the spores were inside the hair. That is the reason the hair broke, the hair shaft broke, right? The hair shaft broke. Because of that, what happened was we see these black dots. Be, why do we see it? Because of the nature of the एंडोथिक्स, है ना? ठीक है, एंडोथिक्स की वजह से जो है ये हुआ. ओके, इतनी बात समझ गए आपको? फाइन, ठीक है. This is the reason we have all these black dots. Okay. Yes, Abdullah Sheikh, I'll again see that table once again. Once I complete this topic, I'll go again see that table. We'll discuss that again as well. Okay, all right. Next up, in inflammatory one, right, in the scarring alopecia, what do we see? The examples are very important. In this, we would see a chirion. Okay, we would see chirion. Yes, it is a boggy swelling with multiple sinus discharges. Okay, chirion, multiple sinus discharges would be there. Okay, simple as that. Examples: Tinea mentagrophytes and Tinea verrucosum would be the one to go for. Okay, all right. And in the next one we have this gray patch we see, and we have this Tinea favus. Gray patch is there. Okay, and over here you see, why do we have this gray patch? Because of the nature of the fungal spores. Okay, nature of the fungal spores. Okay, एक्टोथ्रिक्स अंदर की तरफ नहीं, बाहर की तरफ है, इसलिए देखिए कि आप हेयर जो है नॉर्मल है, आसपास में जो है वो ग्रे कैप है. ठीक है, कौन कर रहा है ये? फेरोजिनोसम एंड कैनिस. ठीक है. Favus में क्या होता है कि there is, because it's endothrix, there are hair spaces inside. Okay, and we see Tinea Schondini is the one who causes it. This is cradle cap. Okay, all right. Crust is called as scatula, and it is on the scalp, and you can see definitely this is a very important image-based question as well. Okay, all right. So how to remember this is, if you just remember this one thing, these two sentences you remember, you're all good to go. Okay, what are these two sentences? That is, TV is seen in the house. TV tonsilitis and Volasium. TV is seen in the house. In the house matlab endothelic, that is the nature of the fungal spores that I'm talking about. Okay, and what is this? Gray cats are furry. Gray cats are furry. So gray patch जो है ना, it is caused by what? Gray patch जो है, it is caused by, so the mnemonic is gray cats are furry. Cats are furry. Okay, all right. Two things that we have to know here. Okay, treatment we would give graziofulvin, and we would give, yes, okay, fine, Trichophyton, we would give terbinafine. Yes, and in microsporum we would give graziofulvin. Okay, fine. This is two things that we need to remember here. Okay, fine. We just got done with that whole part. Yes, now what is remaining is these small types of tinea, which the name are very peculiar about it because they are confined to location. Okay, Tinea barbae, it is in the beard area. Okay, Tinea faciae, it is in the face. Okay, on it has a patch with central clearing. टीनिया कॉर्पोरिस, दिस इज वी व्हेन डू वी यूज दिस, कभी यूज करेंगे, ठीक है, जब ये कोई दूसरी जगह पे होगा जो कि डिफाइंड लोकेशन नहीं है, दूसरी जगह पे होगा, तब हम लोग जो है इसको यूज करेंगे, ठीक है। ऑलराइट, सो साइट है इसकी, है ना, depends on the site. Okay, what we would answer is Tinea mentagrophytes and Tinea rubrum. Okay, other things, right, we have over here, that is Succinata, Concentrium and Imbricata. The only reason I mentioned these things over here is because I want to know, like, if these names comes up in the question, you should not be, कि भाई ये क्या आ गए, है ना, they are Tinea infection. Okay, they come under corporis, because earlier we used to use these words for Tinea corporis. Now they come under the common umbrella. Fine. Tinea profunda is the one who's causing erythematous nodules. Okay. The next up we have this Tinea pedis. Okay. Tinea pedis is there. Okay. It is called as athlete's foot. Athlete's foot. Yes. Who causes it? Yes. What are the cause for athlete's foot? So okay, this part is, very common thing, right? If there is increase in sweat, or somebody who is using closed footwear, increase in sweat in somebody using closed footwear, that would be the one for it, right? And the next up we have this moccasin foot, right? This is what we see over here, right? So whenever we see, जब भी वैसे लगता है ना कि भाई ये टीनिया पेडेसी है ना, तो रूब्रम, यस यस यस, टीनिया पेडेसी है ये, तो क्या ऐसे क्या लगता है कि भाई हाँ खाली वैसे ना इंटरट्रीजनस एरियाज में होगा, है ना, बट ऐसा नहीं है, ये देखिए ये फुट पे भी हो रहा है, इसकी जो है ना near the soles, near the heel pads, right, it is happening. Okay, all right, so this is there one more variant is there, that is the bullous type. It causes severe uh, inflammation, and there are blisters as well. Okay, all right, so next up we have this Tinea cruris. This is dhobi itch, this is the dhobi itch. Okay, all right, you need to know this one, dhobi itch. Site, groin, humidity. Yes, site is groin, humidity. Okay, incognito, Tinea incognito, इसमें क्या है कि is because of a very incorrect treatment. If you see these things, right, what do you see over here? These are not active infections. They are not active infection. They are like very docile infection, right? Yes, steroid. Salman Chaudhary very correctly said. Yes. So एंटी फंगल इनको दवाई नहीं मिली है, इनको क्या मिली है, इनको स्टेरॉइड की कोई क्रीम जो है किसी ने क्वैक ने पकड़ा दी है, ठीक है, और उसकी वजह से क्या हो रहा है, ट्रीटमेंट इनका सही नहीं है ना, तो दैट इज द रीजन, इम्प्रॉपर ट्रीटमेंट। यस, जब ये स्टेरॉइड लगाना बंद कर देते हैं तो क्या होता है कि रिलैप्स हो जाता है ना, ये रहा रिलैप्स हो जाता है उनका, ठीक है। ओके, इतनी बात हो गई, और इसका जो प्रेजेंटेशन है अबाउट टीनिया उंगम एंड ओनाइकोमाइकोसिस, व्हाट अबाउट द प्रेजेंटेशन, ठीक है, हाइपर केराटोसिस होगा, ठीक है, इसमें भी दिखता है हमको, एंड इट वुड बी, सॉरी, पेल येलो कलर, ओके, येलो कलर ऑफ नेल्स वुड बी देयर, ओके, थिकन नेल प्लेट, हाइपर केराटोसिस वुड बी देयर, ओके, एंड how to differentiate between psoriatic nail and tinea ungum? Okay, I think right now you guys can easily differentiate कि भाई जो KOH है वो नेगेटिव होगा, ठीक है, और जो टीनिया अंगों में KOH जो है पॉजिटिव होगा, अंडर द वी नीड टू प्रिपेयर अ स्लाइड। पिट्स सोरियासिस में होंगे, इरेगुलर पिट्स होंगे, है ना, ठीक है, और इसके अंदर क्या होगा कि पिट्स नहीं होंगे, है ना, ऑब्वियसली, क्योंकि दैट इज द कंडीशन। ओके, ऑलराइट, सो दैट इज हाउ वी डिफरेंशिएट बिटवीन द टू। ओके, तो पूरा का पूरा डर्मेटोफाइट देखो हो गया हमारा, है ना, फटाफट हमने कर लिया। सबक्यूटेनियस माइकोसिस, अभी ये यहाँ पे आएगा जो है, जो somebody was asking, right, regarding the Madurai foot. This is the slide where it will come. Okay, sporotrichosis, this is the what disease, tell me, this is rose gardener's disease, this is sporotrichosis, this is rose gardener's disease, ठीक है। तो डॉक्टर्स को होगा ये, इंजीनियर्स को होगा ये, नहीं होगा, है ना, फ्लोरिस्ट को हो जाएगा ये, है ना, somebody who is dealing with flowers, yes, and gardeners and farmers, they would have it. Okay, but the most important thing is this image. Yes, this linear lymphatic image, right, you have over here. Yes, that is what it is. Yes, okay, yes, okay, this linear chain of thing which is there. Okay, and there are ulcers as well. Hmm? Histopathology. Now it is the this is like very interesting part, for the students and for everybody, who want to know the actual concept regarding कि भाई actual में क्या है। Yes, Salman Chaudhary asteroid body. Yes, but tell me, this is the catch actually. Whenever we read about this, right, sporotrichosis, asteroid body is the name which comes in our head. Okay, but now you answer me this question. Okay, what is the shape of the fungus? जो sporotrichosis का है, shape क्या है? एस्ट्रॉइड बॉडी है, उसका शेप की क्या शेप है उसका? उसका जो शेप है वो है सिगार शेप, है ना, सिगार शेप, ठीक है। बट ठीक है, सिगार शेप तो है, तो ये एस्ट्रॉइड बॉडी कैसे बन गया, ये जो चेंज है वो कहाँ से आ गया, ठीक है। इफ यू नो द concepts, you would be very very clear regarding this one thing, that is it, the body's immunity is acting on it, right? That is why you see this asteroid body, okay, that is why you see this asteroid body, okay। बॉडी की इम्यूनिटी काम करने के बाद में जो है ये हमको दिख रहा है, ओके, आफ्टर द इम्यूनिटी वी सी दिस asteroid bodies, फाइन, ठीक है, you got the concept, okay, cool। Next up, we have this treatment, that is itraconazole and terbinafine we would use, or we would use potassium iodide, okay, simple। अब आ जाइए इसके ऊपर, ठीक है, जो माइसिटोमा है, इसमें तो शौर्य त्रिवेदी, यस यस, ओके। माइसिटोमा जो है ना, ठीक है, जो मदुराई फुट जो है, वेरी इंपॉर्टेंट टॉपिक, ओके। इसमें व्हाट इज इंपॉर्टेंट इज दैट it can be caused by bacteria or fungus as well. We need to differentiate it. Why? Because the treatment aspect is very different. Treatment aspect is very different, okay, that is one thing we need to be very careful about, okay। There is a triad that is follows, okay, I'm always, very particular about the triad, because it can, it is easy for us, right, to remember things and add up things one by one, okay। What could be it, right? There could be grains, yes, there would be tumefaction, that is just fancy word for swelling, okay, and there would be discharges, there would be sinus discharges, okay, yes, these three things would be there। और हम ये जो क्या करेंगे ना, हम लोग इन्हीं पॉइंट को जो है ऐड करेंगे, एंड वी वुड डू सम एडिशंस टू इट, एंड वी वुड डिफरेंशिएट फंगस एंड बैक्टीरियल, ठीक है, सिंपल सी बात है, ओके। ये रहे है ना, yes, you see these images, now we just come up with this thing, okay। Actinomyces, that is the bacteria, and this is eumycetoma, that is the fungi, okay। How we would, who causes it, right? Yes, it is nocardia, actinomyces maduri species, and mycetoma, okay, all right। How would you remember this? Is we by NASA, NASA, so it is NASA, all right, NASA, okay, that is how you would remember it, okay। The next thing is कि भाई यूमैसिटोमा है यहाँ पे, ठीक है। इससे क्या हो रहा है कि ब्लैक कलर्ड जो ग्रेन्स है ना, ब्लैक इन दिस, इन फंगस वी हैव ब्लैक कलर्ड ग्रेन्स, इन द अदर वन वी हैव वाइट कलर ग्रेन्स, ओके, दैट इज वन डिफरेंशिएटिंग फीचर। पस है क्या, नहीं है, पस है क्या, नहीं है, आप बताइए, एनीबडी हु नो दिस? देयर वुड बी नो पस इन बैक्टीरिया, यस, और फंगा, टेल मी किस में पस नहीं होगा? बैक्टीरिया में पस होगा, ठीक है ना, और इसमें जो है अगले वाले में पस नहीं होगा, ठीक है, ऑलराइट। एंटीबायोटिक्स वुड बी द मेन कोर्स ऑफ ट्रीटमेंट, क्योंकि वह बैक्टीरियल इन्फेक्शन है, यस यस, फंगस, यस, एंड in this we would give antifungal drugs, okay। The regimen is very important, the regimen is very important over here, okay। Ahmad Qureshi, fungus, yes, you're very correct. Over here you see, yes, two things are with the Welsh regime, you would use Welsh regime, okay। Over here we would use this drug, that is amikacin and cotrimoxazole would be there. Another thing which is there is modified Welsh regime, so we would use the same thing, but we would add in rifampicin, add rifampicin in it, okay, all right, that is one thing that is very important, okay, cool। Now we come to the very important part, that is the treatment part, ठीक है। एंटी फंगल दे दिया, एंटीबैक्टीरिया एंटीबायोटिक हमने दे दी, ठीक है, बट यू सी, इवन दो इट इज़ अ वेरी इसमें कोई साइनस भी नहीं था, कुछ भी नहीं था, है ना, ठीक है, बट द पेशेंट हु कम्स विद द बैक्टीरियल इन्फेक्शन, ही विल गो विद 2 legs, but the fungus, the patient who come with antifungal with eumycetoma infection, right, the fungus one, he would only go with the healthy leg, not the affected leg, because the treatment is amputation, okay, the treatment is amputation right here, okay, all right, fine, we have this much over here, okay। So that is all about the subcutaneous mycosis, okay। I hope I did justice to the topic। Next up we have viral infections, extremely important topic, right, and a lot of skin manifestation as well, STDs are there as well, okay। So let us just go on with it। uh, Viral infections, the same way we did, like the prior topics, है ना, वैसे ही करने वाले हम लोग इसको। मेन आपको क्या पता होना चाहिए, आपको पता होना चाहिए कि भाई इसका क्लासिफिकेशन कैसा है, ठीक है, ओके। इसका क्लासिफिकेशन जो है वो कैसा है, वो आपको पता होना चाहिए, ठीक है। हर्पीज जो है, हर्पीज, इट इज डेफिनेटली, इट इज अ डिफरेंट एंटिटी, यस। तो व्हाट आई हैव डन इज वी हैव कन्वर्टेड दिस इनटू डिफरेंट टॉपिक, ओके। ये जो है कंप्लीट डिफरेंट टॉपिक है, यहाँ पे हर्पीज दिख रहा है, हर तरह का हर्पीज जो है यहाँ पे आ चुका है। तो यू जस्ट नीड टू डू दिस वन स्लाइड एंड यू आर डन, नो प्रॉब्लम। Okay, fine. Over here you see, uh, let us start with HPV first. Okay, HPV first, then we'll come with herpes, no problem. Okay, HPV जो है जो warts है ना, ठीक है, warts है, and this is the one, right, who was also, you know, when we go about this molluscum contagiation, it was showing this pseudocombinal phenomena, ठीक है, pseudocombinal phenomena, that was auto inoculation was there. So if you can understand this one diagram, right, which I've drawn over here, it will be very easy to understand pseudocombinal phenomena. हो क्या रहा है ये, स्टोरी सुन लो। ये जो HPV वायरस है, ठीक है, इस जस्ट ऑन द स्किन फॉर सम एक्स रीजन, फिर क्या होता है कि उसको जो है ना थोड़ा खड्डा वगैरह मिल जाता है स्किन में, देयर इज सम लैसेरेशन इन द स्किन, it enters it. So if you see over here, I have drawn the color, like two different colors I have used, that is, one is black color and one is red color. Okay, all right. In this red color, right, this is the affected one. Okay, what it is doing is this HPV is doing the benign proliferation of cells. Okay, benign proliferation of cells, ठीक है, इससे क्या हो रहा है, and it is releasing out its other offsprings. These go to another places and they cause, you know, uh, warts at other spots. Okay, fine, there is benign proliferation over here. Okay, fine, done. Warts जो है, now we'll see different types of warts over here as well. Okay, common types of wart जो है, that is, tell me which is the common type of wart. Vulgaris, right? Vulgaris is the word we use for common variant, right? Okay, sorry. Okay, Verruca vulgaris is the one we use. Yes, Verruca vulgaris is the one we use for common type. Okay, in the HPV one, this is the HPV 2. Okay, and in the plantar warts, there are two things we need to remember, that is 3 and 10 who's causing it. Okay, all right, there could be superficial and deep variants as well in this. Okay, we have mosaic warts and mermica warts. That is superficial and deep variant. If you just know the words, they're all good to go. Verruca plana, they are flat ones, they are the flat ones. Okay, so we see, like, you know, there could be, if you don't know this, that there could be flat warts, definitely, you know, what's going to happen is, you know, you would never know, like, you know, these were warts if you don't know this one topic. Okay, all right, what do we have over here is filiform warts. You'll see over here, right, on the eyelashes, filiform warts. Okay, then up we have is periungual warts. This is the one which has a very high recurrence warts. Okay, periungual warts. Okay, cool. Next up, there is anogenital warts. Anogenital warts. What is actually happening over here is, if you know, if it's caused by condyloma acuminata. Acuminata means what? Acuminata means pointed. Okay, I should have highlighted this. Acuminata means pointed. So these are the pointed warts you see, right? Okay. Yes, fine. The word means pointed. Okay. Next up, we have the transmission, sexual transmission, right? Sexual transmission are the most common route. Okay, and they are clearly visible, right? If they are not, like, you know, reached in a very pronounced state, yes, they would be clearly visible after application of acetic acid. All right, acetic acid, and this Gardasil thing is there, right? So we should remember this. And India also made its own variety of Gardasil as well, right? The What are the serotypes? 6, 11, 16, 18, 31, 33, yes, and 4, 5, 5, 2, 5, 8. So this is how I remember it, like 3 layers, yes. So 1, 2nd, and 3rd. I just remember it just like that. Yes, like 4, 5, 5, 2, 5, 8. This is where we usually end up. Yes, these are the most common variants as well. Okay, all right. uh, Two things that we can do for the patient is, one thing, like, you know, we can give some, you know, ointment to the patient, and other thing, you know, we can do some surgical procedures. Yes, what we could give to the patient is imiquimod. Imiquimod, what it does is increase pro-inflammatory cytokines. What are we doing is, you know, in these warty areas, what are we doing is, we are increasing the immunity of that particular area by giving imiquimod. It stimulates toll-like receptors. Okay, that is one thing. Syncactin and podophylotoxin. Okay, there are these two things. Okay, we can also give to the patient. Okay, what can we do? What procedures can we do? Yes, there are. We can do cryosurgery. We can use liquid nitrogen over here, right? And we can also give electrocautery to the patient. We can also do electrocautery procedure as well. Okay, and the carbon dioxide laser therapy is the most effective treatment. Yes, cryotherapy. Salman Chaudhary, very correct. Okay. Next up, we have measles. A very easy topics, you know, from now. Nothing much. Measles, it is called as rubeola. Yes, but tell me, what are the first lesions which come? Yes, 1 to 2 day. before the system and 4 days after. This is the infectious period, right? Tell me the spots which come in the buccal area and the name of the spot. Tell me. बताओ क्या बोलेंगे इसको? Anybody know this? Coplic spot, right? Coplic spot हम बोलेंगे इसको, है ना? Yes, yes, coplic spot. Yes, very correct. सलमान चौधरी, yes, yes, very correct. है ना, जो जानता है मैं, जो रेडनेस एरिया है, यस, अब्दुल्ला शेख, कॉप्लिक स्पॉट, वेरी करेक्ट. अहमद कुरैशी, यू आर ऑल्सो राइट, डेफिनेटली यू गाइस आर डूइंग ग्रेट. Okay, fine. How about the next one? Over here is, this location, it begins in forehead, it goes behind the ear and neck and the trunk. Okay, and it disappears by day 5. Yes, rubella. Coryza is the most important thing, also called as German measles. Okay, petechiae confined to the soft palate itself. So these 3 points you need to remember about the rubella. Parvovirus, yes, the slapped cheek appearance right over here with this cute baby. Yes, slapped cheek appearance. We have the 5th day disease. Yes, flat cheek appearance. Okay, and the one thing is there would be nasolabial sparing, है ना? ठीक है, दिख रहा है आपको यहाँ पर, ये इधर. यस, nasolabial sparing है यहाँ पे, है ना? ठीक है, ये रहा. ओके, 2 पॉइंट यू नीड टू रिमेंबर ओवर हियर. अब आ जाओ मोलसम कंटाइजेशन पे. ठीक है, बहुत ज़रूरी है ये मोलसम कंटाइजेशन. क्यों? क्योंकि बिकॉज ऑफ द कैरेक्टरिस्टिक प्रॉपर्टीज. It can happen in children, it can happen in adult as well. So the first variant which is there, okay, first variant which is there, it happens in children. The second variant, the molluscum contagion virus, the second one which happens in the adults. Okay, sexually transmitted है ये. Or you can see this, central umbilicated lesions. Central umbilicated lesions we see over here. Okay, what about the next one is the clinical presentation, right? This shiny pearly papules, with central umbilication, we just did about this. Okay, what is the most important over here is the histopathology. Okay, we see these Henderson Peterson bodies, dome shaped. Yes, dome shaped as well. Yes, yes, definitely dome shaped pearly papules, which we see. There would be molluscum contagiosum. Over here you see, right, we have this Henderson Peterson bodies, we would see. Yes, even in the basics of derma we did this as well. Okay, treatment, it is self-limiting condition. Yes, but for the adults what we can do is we can do needle removal, right? And also we can do the cryotherapy as well for the if you want to do some intervention. Yes, it is self-limiting condition, trichloroacetic acid and KOH and topical retinol, that is a vitamin A derivative, is gray matter. Molluscum. Yes, yes, yes. Okay, next up we have is enterovirus, and over here this is hand foot mouth disease. Okay, what is important over here is to remember these things. Coxsackie A16, this is the thing we need to remember. Okay, next up we have is herp angina. One point you need to remember in herp angina, that it does not involve skin. It does not involve skin. That is the most important thing. Okay, all right, that is about herp angina. So we're done with the viral infections. Now we have one big guy, which is remaining, that is herpes. Okay, आ जाओ herpes पढ़ते हैं, एक एक करके herpes पढ़ते हैं. ठीक है, all right. One thing I just want to talk right here is herpes में जो है herpes simplex virus है, ठीक है, and there is HHV, there is human herpes virus. There are two things. Okay, there are two things, HHV and HSV. So do not get confused in this part. Okay, 1 and 2. Okay, in HSV there are two variants, 1 and 2, they are part of this. Okay, and human herpes virus, right? Okay, so the पहले दो members हैं, उन्हीं का नाम जो है HSV है, बाकी के जो है वो HHV से कहला जाते हैं. ठीक है, ओके, इतनी बात समझ गई. फाइन, the respective names are written. I'm not going to read them each and every one, we will discuss. Okay, in HSV1 it is going to happen on the upper part of the umbilicus, right? And the HSP2 is the bottom part of the umbilicus. Okay, so up ऊपर हो रहा है, ये umbilicus के भी नीचे नीचे हो रहा है. ठीक है, now let us discuss about HSV1. Okay, orolabialis. ठीक है, after what do we have this? Tell me, anybody who know this, किसके बाद होता है ये? It is after the cold sore, right? Okay, fine, it is after the cold sore. It remains dormant in what? It remains dormant in what? Anybody know this answer? All right, no worries. Yes, dorsal cervical ganglion, right? Okay, dorsal cervical ganglion में जो है ये dormant रहता है. ठीक है, and whenever the immunity decreases, that is when what happens is there is reactivation. Okay, and we would give these drugs, right? What is it? Lipstick margin. Yeah. That is where it happens. Okay, no worries. Okay, uh, fine. Over here, you see this is acyclovir and valacyclovir we would give, but we would not give to the, like, normal. What happens is it usually, it settles by itself. Okay, that is about HSV1. How about HSP2? Over here is, HSP2 is sexually transmitted one. Okay, what happens is there are grouped vesicles, and in this, because of the friction, the bullas which are there, they rupture. Okay, they rupture. Fine. Okay, what happens is initially it is very painful and eventually it gets a very milder form. But what is most important is कि जेनेटल herpes जो है HSP2 में हो रहा है, ठीक है, इतनी बात जरूरी है. Okay, varicella zoster, this is very important that we should know about this. Varicella zoster virus, HHV3, varicella zoster virus. जो इसमें क्या है, जो प्राइमरी varicella, yes, over here, but the reactivation is called as what? Tell me. Anybody who can answer this, what is the reactivation called as? Herpes zoster, है ना, ठीक है, herpes zoster. The reactivation is called as herpes zoster. Okay, fine. Chicken pox. Yes. Chicken pox. Definitely, you are correct. Ahmad Khurshid, you're correct. Okay. Ballooning, right? Ballooning of the keratinocytes are there. Yes, what it does is the virus, it goes inside and it creates herpes zoster. Yes, you're correct. The virus, it goes in and it creates, right? It creates the toxin and it breaks the desmosomes. Yes, it breaks the desmosome. Tell me, it is primary or secondary acantholysis? It is secondary, right? Okay, secondary acantholysis is there. Okay, all right. So we did this concept before. So if you know this, then these parts become very easy. Pleomorphic rash is something we see everywhere, है ना, सब दिख रहे हैं हमको, हर चीज दिख रही है ना, ठीक है. Pleomorphic rash, papules जो है, like it's a full house. Okay, but what we are looking for is the vesicles. Vesicles is something we are looking for. Okay, all right. When it reaches the crust stage, it becomes totally asymptomatic, totally non-contagious. Non-contagious. Okay, fine. Vesicles are the one which we are looking for. And tell me, what are the name? Tell me, what is the name of this? This has a very particular name to it, and the findings are very classical. That is dewdrop on rose petal appearance. Okay, all right. That is dewdrop on rose petal appearance. We see. Okay, all right. Treatment would be acyclovir and valacyclovir. Okay, and yes, that would be the mainstay about it. HHV4, right, which is there, that is Epstein-Barr virus, EBV. Yes, over here you need to remember there would be fever, pharyngitis, and lymphadenopathy. But what's the most important thing is, right, yes, the rash is usually triggered by a drug, that is ampicillin. Okay, ampicillin is the one, because of that it happens. Okay, 7 to 10 days after the antibiotics, it happens. All right, so these are just, like, known etiologies. Associations, right? It has association with EBV, that is Epstein-Barr virus. It has association with Epstein-Barr virus. Oral hairy leukoplakia, ठीक है, ये बात है, पता होना आपको बहुत जरूरी है. और वो क्या करा रहा है? White plaque on the lateral surface of the tongue. Yes, on the lateral surface of the tongue. Okay, and what, कौन सी हमने देखी थी, है ना, जिसमें जो है, जो it was easily being scraped off? Tell me. Yes, easily being scraped off. Candidiasis में देखा था हमने, क्या ना, बहुत easily जो है वो, जो whitish membrane थी जो निकल गई थी, है ना, ठीक है. All right, and it is not a pre-malignant lesion. Okay, now come here, right? Now come here. That is the cytomegalovirus 5. Okay, this is a topic from pathology, but I want to take it because this is a very important topic. That is one thing. The next thing is that it is caused because of HHV5, that is cytomegalovirus. Okay, that is the reason about it. What do we have here is owl eye appearance, है ना. हम जो है बहुत बहुत commonly हम गलती कर जाते हैं कि हमको owl eye appearance, we just take it very easily, and we ended, and what happens is, we make up errors in the questions. Owl eye appearance, it is just an appearance, nothing much, right? But if owl eye appearance, is seen in EBV, we call it as an RS cell. Okay, we call it as an RS cell. This is an RS cell. Why this is an RS cell is because it has eosinophilic nuclei. जो nucleus है उसका पिंक कलर का है, ठीक है ना. तो फिर ठीक है भाई, अगर वो पिंक कलर का है तो साइटोमेगालो वायरस जो है, द रीजन वी आर डिस्कसिंग दिस इज बिकॉज ऑफ दिस गाय। साइटोमेगालो वायरस जो है, यू वुड हैव ऑल ब्लू ब्लू, है ना, बेसोफिलिक न्यूक्लिया एंड द ग्रैन्यूल्स आल्सो, द ग्रैन्यूल्स आल्सो ब्लू। ओके, if you remember this flow chart, you will never go wrong with owl eye appearance. Okay, next up we have this HHV, right? Exanthum subitum and rubella infantum. This is a 6-day disease, fever plus maculopapular rash. This is the very classical thing we see over here, right? Maculopapular rash. Okay, uveo pallidal spots are there. What are these called as? Anybody who know this? What are these called as? Tell me. They are called as Nakayama spots. Nakayama spots. You guys can see Nakayama spots. Okay, right over here you see. Okay, fine. That is something which is very important. Pityriasis rosea. You guys can teach me this topic now. Okay, etiology. It is a virus. It is a virus. Okay, fine. We covered this topic I think multiple times. Yes, herald patch. Initially present with herald patch, peripheral scaling, and central clearing. Okay, Christmas tree appearance is seen, and we also seen the curtain appearance are also seen, right? Hanging curtain sign is also seen in this. Okay, fine. So we are done with the whole herpes part. Okay, we got done with this pretty quickly. Okay, so first and second slide is done about the viral infections. Now we'll go ahead with this part. This is the STDs, right? STD ulcer. But definitely I should take this up in the next slide after we are done with the STDs, right? I'll come back to that slide again. Now we'll start with the parasitic skin infections. Okay, this is a very 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 I would say important one, right? Why? It's because of this topic, that is scabies. ठीक है, जल्दी जल्दी खत्म कर देते हैं स्केबीज को, ठीक है, ज़्यादा कुछ नहीं इसके अंदर। किसकी वजह से हो रहा है ये? सार्कोप्टिस स्केबी की वजह से हो रहा है ये, ठीक है। ओके, इट इज़ वेरी हाई, इट इज़ हाईली कंटेजियस। ओके, एंड कहाँ पे हो रहा है ये? इन वेरी क्लोज कॉम्पैक्ट स्पेसेस। ओके, लाइक वेरी बहुत सारे लोग जो है अगर बहुत कम जगह पे रह रहे हैं, सो दैट वुड हैपन, यस, इन क्राउडेड एरियाज। ओके, एंड इट इज ऑल्सो कॉल्ड एज अ वाटर शेड डिजीज। ओके, ठीक है, because the mites are being transferred while after somebody took a bath, and the water which is there, right, that can infect the other person in case uh, the person comes in contact with. Okay, reinfection can happen within 2 days, within 2 days of treating the patient. The presentation is very common कि पेशेंट तुम्हारे पास क्यों आ रहा है, क्यों आ रहा है पेशेंट तुम्हारे पास? क्योंकि वो रात में सो नहीं पा रहा है भाई, है ना, नॉक्टर्नल प्लूराइटिस की वजह से तुम्हारे पास आ रहा है वो, ठीक है। और राइट, कहाँ देखोगे आप? बरोज देखोगे आप, है ना, बरोज हमने स्पेशलाइज स्किन लीजन में पढ़ा था, बरोज, ठीक है। फिंगर वेब and the cubital fossa. Okay, what you see over here is, the face is not involved in the infants. Okay, because of what? Because of the sebaceous gland. Okay, because of sebaceous glands. All right, what you see here is circle of Hebra. Okay, that is ये जो जगहें दिख रही हैं आपको, इन ये जो सार्कोप्टिस के भी है, इन जगहों को बहुत पसंद करते हैं, तो यहाँ घूमना पसंद करते हैं वो, ठीक है। वो शुरुआत होती है उनकी वेब से, फिंगर वेब, ठीक है। फिर they would go ahead to wrist, and they would go to the flexures, right? In the elbow flexures they would go, anterior axillary fold, nipple and umbilicus, and they would end up in the groin area, that is the genital part. Okay, all right, that is all about that. Okay, fine. दिस इज सर्कल ऑफ हेब्रा, इंपॉर्टेंट, ठीक है। अब इसको जो है आप कभी गलत मत करना, ठीक है, सर्कल ऑफ हेब्रा है वो। Diagnosis, we would just, it's very simple, right? We would just do a KOH mount, yes, and in wood lamp we could also put a paste, and we could just see the trace of this organism, that is the burrows, we can see very clearly. But usually we don't do this. Why we don't do this is because uh, the भाई पेशेंट की प्रेजेंटेशन इतनी खतरनाक है, ठीक है, ऐसे देख के पता चल जाता है कि भाई ये स्केबीज का पेशेंट है, ठीक है। अडल्ट स्केबीज, इन्फेंटाइल स्केबीज, हाउ टू डिफरेंशिएट बिटवीन टू, ठीक है। ओके, पैप्यूल्स इसमें होंगे, है ना, पैप्यूल्स एंड वेसिकल वी वुड फाइंड इन द इन्फेंटाइल स्केबीज। व्हाट इज द मोस्ट इंपॉर्टेंट इज राइट, पाम्स एंड सोल्स किस में इन्वॉल्व है, किस में नहीं इन्वॉल्व, ठीक है। पाम्स एंड सोल जो है वो अडल्ट में इन्वॉल्व नहीं होंगे, नॉट इन्वॉल्व, है ना, ठीक है। अगले में जो है इन्वॉल्व होगा, ठीक है। वाई? is because you see palms and sole, we have the sweat glands, right? On the face there are so many sweat glands, on the palms and sole we have so many sweat glands. Okay, because of that, yes child, because of that, what is happening is the sarcoptes KB is not able to uh, affect this area. Okay, but in the child you see underdeveloped sebaceous gland. दैट इज द रीजन यू सी, पाम में हो गए ना। ओके, समझ गए इतनी बात, है ना? ओके, सो देर इज नो नीड टू मेमोराइज इफ यू अंडरस्टैंड द कॉन्सेप्ट्स, देर इज नो नीड टू मेमोराइज एनीथिंग। ओके, बट कुछ चीज़ें तो याद रखना पड़ेंगी, बट a lot of things could be handled with just with a very clear thought. This is one of it. Now we come to the most important, most interesting thing, right? This is the nodular scabies and the Norwegian scabies. Okay, so nodules क्यों बन गए? Anybody can answer me, nodules क्यों बन गए भाई? Nodules बन गए क्योंकि बॉडी जो है एक्ट कर रही है इन माइट्स पर, और बॉडी इज trying to like just compound it, it just trying to like don't want that the parasite to go any further. That is the reason we see these nodules. ओके, इसमें बरोज नहीं दिख रहे, देखो, है ना, बरोज नहीं दिख रहे, है ना? ठीक है, स्पोरोट्राइकोसिस नहीं मार्क करना है आपने, है ना? ठीक है, स्पोरोट्राइकोसिस अगर आंसर होगा तो दैट विल बी व्हाट, दैट विल बी रोज गार्डनर डिजीज, है ना? ठीक है, जो लीनियर चेन दिख रही है स्पोरोट्राइकोसिस मार्क नहीं करना आपने, है ना? ठीक है, इसको खुजली हो रही है भाई, है ना, ये सो नहीं पा रहा रात में, ठीक है? Alright, next up we have this Norwegian scabies. I feel this is the most interesting part of the whole parasitic infection. Why? Because मैं बोल रहा हूँ कि एक तो अगर माइट्स हो गए तो जो सो नहीं पा रहा, पेशेंट सो नहीं पा रहा, है ना? बट इसमें देखिए मैंने लिखा है कि देर आर मिलियंस ऑफ माइट्स, यस क्रस्टेड, देर आर मिलियंस ऑफ माइट्स, है ना? बट द पेशेंट इज ओके, डॉक्टर साहब सब बढ़िया है, सब अच्छा है ना? क्यों? क्यों? द रीजन बीइंग दैट एनीबडी कैन आंसर मी दिस क्वेश्चन, टेल मी, anybody who can answer me this question, this very interesting thing, कि why the patient, right, it is absolutely comfortable, you see this aggressive crust, you see, immunocompromised, that pearly girl, you are very correct, very correctly said, that pearly girl, very right. Okay, immunocompromised, yes, the patient could be immunocompromised, there could be loss of sensation in that particular area, हो सकता है ना? किसी को न्यूरोपैथी हो सकती है कि भाई पता ही नहीं चल रहा बॉडी में क्या हो रहा है ना? ठीक है, सो यू वेरी करेक्ट दैट इम्यूनो कॉम्प्रोमाइज इज वन स्टेट लाइक दैट. Okay, next up we have the patient could be go under the neuropathy is one thing, and we have the extension of neuropathy, that is it could be have paralysis. Okay, this is one thing very clear, you just see this, there are millions of might but still it is okay, body कुछ कर ही नहीं पा रही इसका, है ना? ठीक है, चलो बहुत टाइम दे दिया इसके ऊपर, है ना? तो ट्रीटमेंट बताओ फटाफट, इसका क्या है? एनीबडी हु नो द ट्रीटमेंट? Ivermectin and permethrin we would give 5%. Okay, permethrin and oral ivermectin we would give. But over here what the catch is, ठीक है, आजकल जो है examiners know that, students know this, so the question has been made upon this part, right? What is this thing, कि भाई अगर if the patient is under 15 years, pregnancy or lactation, ठीक है, we would not give ivermectin, तो क्या देंगे हम? ठीक है, we would give topical sulfur application, right? So you see this patient, this baby, इसको we will not give ivermectin, है ना, इसको topical salicylic acid, yes, topical sulfur we would give, Ash, Ashrafen, yes. Okay, fine, topical sulfur and benzyl benzoate is a very economical option we would have. Okay, this is a very uh, in the government hospital we use this benzyl benzoate, it's a very economical thing. A family treatment, ठीक है, there is something called as umbrella treatment in this, ठीक है, umbrella treatment, ठीक है, that is important. क्यों? क्योंकि भाई अगर समझो एक पेशेंट आपके पास आया, फैमिली में एक मेंबर आपके पास आया, और आने के बाद जो है आपने उसको ट्रीटमेंट कर दिया, सारा हो गया, बट फिर वो घर चला जाता है और वो जो घर वाले हैं उसको अफेक्ट कर देते हैं, ठीक है, तो ज़रूरी क्या है कि हम सबका जो है ट्रीटमेंट करें, है ना? दैट इज कॉल्ड एज एन अम्ब्रेला ट्रीटमेंट. ओके, सो एवरी फैमिली मेंबर नीड टू बी ट्रीटेड, ठीक है, एंड व्हाट इज इम्पोर्टेंट इज द लिंट्स, every beddings, the pillows, all the lint that has to be uh, cleaned with hot water. Okay, hot laundry should be done. अगर कुछ भी नहीं है भाई, कुछ भी नहीं है, if somebody cannot do anything, just take everything, put it in a plastic bag and keep it for 42 72 hours, right? And we just put it in a plastic bag and it should be done. But this is better, definitely it is better. Okay, ठीक है, तो हमारे स्केबीज हो गया कंप्लीट यहाँ पर. Now we just come with the parasitic infection, right? Two more: cutaneous larva migrans, dog and cat tapeworm. The images are very important. You just remember these images, they are like the easy go for you guys. Okay, cutaneous larva migrans. What do we have over here is pediculosis, that is lice. Okay, let me just give you key points regarding this. Pediculosis humanus capitis. Yes, this is corporis, and this is thyris pubis. Okay, over here you see this is how a lice looks like. Okay, and over here in the hair we can see the eggs are what's called as nits. Eggs are what is called as nits. Okay, okay, and it will be very itchy. And this photo you see, right, this photo is taken by me. Yes, a patient come to OPD, right. I was with my dad, and the reason she came to us was about hair thinning. Yes, that is the reason she came up for, and we were giving like a proper hair examination to her. And then while doing like an hair examination, we found this on our view box. So what happened is, like, dad told me, you see, Mohit, you can see a lice in this patient. Okay, and then that is where I took this photo. Okay, देखो ये जनाब यहाँ बैठे हैं, और ये जो है इमेज इसकी दिख रही है, कितने like very very crystal clear thing. Okay, all right, fine. And then we had to treat the patient for the hair thinning, but also we had to give 1% permethylene shampoo as well. Okay, that is one thing. Antihistamine to देना ही पड़ेगा because it is so itchy, right? So we have to control the systemic manifestation as well. Okay, pediculosis humanis. Two, three important words I would just say about it. This is called as a Vega-Bond's disease, right? This is a Vega-Bond disease. It is not Vega-Punk from One Piece. It is Vega-Bond. Okay, all right. Why this is? Because I'll just tell you the whole thing just by this image. That the theory is that the infection is in the clothing part, not on the body. Okay, and the itching is because of the saliva of the parasite. Okay, that explains the two things. Okay, that is all I have written about. Over here we have is Thyris pubis. Yes, it infects the hair, right? It is a type of an sexually transmitted infection. Okay, it does not happen on scalp, it happens only on the groin area. And the reason you see these, blue dots is because of the extravasation of blood. Okay, that is one thing you need to know about all these three things. Okay, so over here we're done with the parasitic infections. So now let us go on to the next one, that is leishmaniasis. 100% one question will come from this topic, that is leishmaniasis. Okay, ठीक है, एक क्वेश्चन तो आने ही वाला है इसके अंदर से, लीशमैनियासिस, ठीक है। इसमें जो है देखो, क्यूटिनियस लीशमैनियासिस है, म्यूकोक्यूटिनियस है, और विसरल है। एक एक करके पढ़ते हैं, है ना, ठीक है। और क्यूटिनियस में जो है देयर इज ओल्ड वर्ल्ड एंड न्यू वर्ल्ड, दो तरह का है, ओल्ड वर्ल्ड एंड न्यू वर्ल्ड। ओल्ड वर्ल्ड अगर है, ठीक है, अब आओ कि क्यों होता है ये, इस वजह से होता है ना। दिस पर्सन यू सी, दिस फ्लाई यू सी, दिस कॉल्ड एज व्हाट, यस सैंड फ्लाई, दिस सैंड फ्लाई। ओके, दिस सैंड फ्लाई फ्लेबोटोमस बोलते हैं, ठीक है। बट व्हाट इज कॉजिंग दिस बॉइल्स, वेरी पेक्युलर नेम, राइट, बगदाद बॉयल, ओरिएंटल सोल, राइट, these are the boils, yes, also called as Delhi boil. Okay, sandfly, yes, that pearly girl and Ahmad Qurshi, you're very correct. Yes, it is because of sandfly. Okay, and the crust, right, uh, which happens on the cutaneous, on the skin, right, when it is removed, this sign is very important. It is the volcano sign. Volcano sign. Okay, the sign is very important. Okay, but what is important is there are no systemic manifestation. It's only on the skin. Okay, investigation. Yes, yes, we would do a biopsy. We would do biopsy and we would find what bodies we would find. Tell me, LD bodies, right? LD bodies you would find. Somebody was telling, yes, LD bodies. That is the answer. दिस इज अबाउट द न्यू वर्ल्ड लिशमेनियासिस। न्यू वर्ल्ड लिशमेनियासिस में आपको खाली ये भी याद रखनी है, दिल्ली बगदाद वगैरह कुछ नहीं है, खाली ईयर लोब के ऊपर जो है क्रस्ट जम रहा है, ठीक है। ऑल्सो कॉल्ड एज शिकागो अल्सर, राइट, और गम ट्री। ओके, ईयर कार्टिलेज जो है उसके ऊपर जो है वी हैव दिस सॉर्ट ऑफ फाइंडिंग, इट इज न्यू वर्ल्ड लिशमेनियासिस, नॉट द ओल्ड वन। ओके, दैट इज वन थिंग। हाउ अबाउट द म्यूकोक्यूटेनियस वेरिएंट? म्यूकोक्यूटेनियस वेरिएंट, व्हाट इज इट? यस, ओवर हियर you see the destruction of the nasopharynx. Yes, destruction of the nasopharynx. This sign is called as what? This is the I mexicana. It is espanda, right? Okay, destruction of the nasopharynx. Okay, it's caused by Leishmania brasiliensis. Okay, all right, we're done with that. How about we just finish off with this and we go with the investigation part and the complication part. Complication part is the most important thing in this topic. Okay, the post kala azar, dermal leishmaniasis, everything I would cover in after this one. In visceral leishmaniasis, two three things are very important, that is this splenomegaly which is there. Okay, we need to just see this one, that is splenomegaly which is there, and on the site of bite there would be nodules, right? Yes, these are the cutaneous nodules which are there. Kala azar, yes, and there would be blackening on that spot as well. Okay, simple as that. Two, three things in visceral leishmaniasis. If you pick up this, cutaneous word and the splenomegaly, you are all good. Okay, all right, fine. Now we start with the treatment. But before that, right, I want to go with this one, post काला आजार dermal leishmaniasis. Okay, so इतना इतना इंटरेस्टिंग है ये कि भाई किसी को leishmaniasis हो गया, बट 2 साल बाद जाके जो है ये हो रहा है, ठीक है, 2 साल बाद जाके हो रहा है, ठीक है। इसमें क्या होता है कि there is hyperpigment patch. Okay, there is hypopigmented patch in the on the upper limb, usually in the upper limb. Okay, तो इसमें क्या हो रहा है, we have to eliminate the leprosy. Amphotericin B we will give, yes, we would give that. Okay, we would give that. And how about the treatment aspect is, we just speed up a bit about the cutaneous manifestation, right? Cutaneous leishmaniasis, we would give what? Oral miltefosine, right? Oral miltefosine we would give. Okay, and in the visceral one we would give what Ahmed Kushi is saying. Yes, yes, amphotericin B, right? There are two variants, right? There is one lipo L amphotericin B and the normal variant. Okay, the liposomal amphotericin B. What we need to know is, I just added these things. I'll just cover this up in one sentence, right? So this is a very hepatotoxic one. Yes, this is nephrotoxic. This is a lot nephrotoxic. Yes. So what do? Is we just put the drug in the vesicle. We have the vesicle, right? And we just incorporated drug in that, and because of that, right, what happens is it becomes less nephrotoxic. That is the reason this liposomal amphotericin B, which is there, right, it is encapsulated inside the vesicle. Yes, inside the lip vesicle, it is less nephrotoxic. But if we give the conventional one, this is nephrotoxic. Okay, so what we in this one we can give, like, higher, no, we can administer higher doses, but in this we cannot administer that much higher doses. Why? Is because, you see, the reason being, right, it is already nephrotoxic. We don't want to give more problems to the patient, right? That is one thing. Okay, all right. That is all about the leishmaniasis. We covered everything. How to differentiate a hypopigmented patch? Tell me. I have three cases over here. That is prolonged fever. Three things, right? Anybody who can answer these questions, I would just go up with this very quick. We have prolonged fever. Person come from the endemic area. Scratch sign is positive. Sensations are normal. Sensations are normal. Anybody? The answer would be PKLD, right? PKLD, post kala azar dermal leishmaniasis. Okay. If there are reduced sensation, yes, reduced sensation. So there is only two, three things that should come in your mind. One of the thing is it could be Hansen's disease, that is leprosy. Okay. If I say that a patient is central clearing, the scratch sign is positive, it is asymptomatic because only the uh, area, the superficial area is the one which is getting involved, right? This is versicolor, right? Versicolor would be the answer. Okay. Yes, yes, yes. That pearly girl, you're right. Okay, so we come up with the sexually transmitted diseases. Okay, this one table, if you know this one table, you are all well enough with the whole thing. All right. Okay, STDs. I'll just go with this table very quickly. Okay, fine. Ulcers which are formed, right? The nature and the pain, that has to be very important in this. Over here, you see there is HSV, there herpes simplex virus. We have chancroid, syphilis, donovanosis, and LGV. Donovanosis and LGV. Okay, over here you see there are these two, three things we need to know about the causative organisms. HSV, Haemophilus ducrei is the one who's causing it. In syphilis, right, Treponema pallidum is the one who's causing it. Okay, Donovanosis, it is Klebsiella granulomatis, and LGV, it is chlamydia. Okay, pain part is very extremely important. Pain part. Okay, tell me, there would be pain in which one? In HSV and chancroid, there would be pain. Okay, there would be pain in HSV and chancroid. Okay, but in these things, right, there will be no pain. Okay, all right, fine, painless. In the edge, yes, chancroid, yes, yes, yes. The edges, no comments about the edges here. Over here, there are these undermined edges, you see. Okay, these edges are undermined. Okay, over here, you see this is about the syphilis. Yes, only one ulcer we usually see in primary syphilis. Okay, And in Donovanosis, you see there is this beefy ulcer you see over here. And in LGV, you see there are these dimpling sign which are positive in LGV, dimpling sign which is there. Okay, fine. So that is all about the STDs, right? Okay, we go on to the next one. That is this table I have taken from first aid book. Okay, you guys can go through this when you have the notes, right? You guys can go over this table as well. Okay, it has almost all of the STDs and the manifestation and the pathogen as well. Okay, definitely worth the read. We come up with the disorder of appendages, right? The skin, hair, and the glands. Okay, we do this quickly. Yes, over here we have this alopecia, right? We have two three things over here, right? In alopecia, uh, it could be scarring or non-scarring one. Yes, it could be cicatricial alopecia, it could be non-cicatricial alopecia. Okay, so we would do the non-cicatricial alopecia first. Okay, कि भाई इसकी वजह से जो है स्कार जो है नहीं आ रहा है ना, नो स्कारिंग इज देयर, सो देयर कुड बी पैटर्न्स, there could be a pattern alopecia, patch alopecia, and there could be diffuse. ठीक है, all right, there could be three reasons for that. Okay, in pattern alopecia, that is androgenic alopecia. Okay, over here you see in androgenic alopecia इसमें देखिए आप क्या है कि मेनली जो है ना, जेनेटिक कॉज इसका जेनेटिक प्रीडिस्पोजिशन है. ओके, द रीजन ऑल्सो आई विल बी टेलिंग कि भाई एग्जैक्टली जो है क्या वजह से हो रहा है ये. ठीक है, एंड्रोजेनिक एलोपेशिया जो है it is happening at in the frontal and temporal area. Rashid Bhati sandfly, yes. uh, in the temporal area, right? The androgen receptors which are there, they are very sensitive in this area. Okay, so frontal and the vertex area, they are present. In the temporal and occipital area, they are absent. That is the reason you see men never lose hair from the back side. They always lose hair from this and this side. Okay, all right, fine. We have over here is the reason, right, all the mayhem that is happening is because of testosterone that is converted into DHT by 5 alpha reductase, and yes, that is one thing. Miniaturization of hair is also seen. Yes, two things in male and female, the balding pattern that is important, right? So what classification do we use in the male is Norwood Hamilton classification. नाम ही लग रहा है ऐसा कि भाई जो है आदमी का नाम है ना. And in this one, in females we have Ludwig's and Olsen pattern, right? Olsen pattern we have the a Christmas tree pattern which is there. Okay, all right, so we're done with the pattern one. Patch में आ जाते हैं. ठीक है, पैच में आ जाते हैं. Cicatricial alopecia. First up we have this alopecia areata. इसमें क्या हो रहा है? What is interesting is there are these anti the in the hair follicle, right? We have this melanin pigment that acts as an antigen. Okay, melanin pigment acts as an antigen, right? Okay, one question up for you guys is definitely coming up. Okay, if I say that if the pigment is against the melanin, so tell me, in this patient, do you think that the white hairs, right, which don't have melanin, okay, they would be affected or not? They would not be affected. Tell me. You see, if you know the concept, you will definitely know the reason that why the black hairs are not present and why the white hairs are spared, because the antigen is against the melanin pigment. Okay, over here you see as well. Okay, you guys got it? You guys got the concept? And over here we have something called as exclamation sign, right? Exclamation sign would be there. Okay. All right. We have this. Next up, we have the histopathology, right? Of this. What are the histopathology of this is, you see, this is the hair, right? And the melanin pigment is under attack. So what is actually happening is the body is trying to like kill it. Yes. And the lymphocytes which are there, they come around the hair follicle, and we have this swarm of bee appearance is there. Okay, that is one thing that is very important to be known. Okay, all right, so we go on to the next one, that is trichotillomania. It is a psychiatric topic. Trichotillomania, right? Yes, it is an OCD. Yes, so person, like, it just pulls out the hair. Tell me the reason why there is, variable length, irregular length क्यों है? क्योंकि the answer being कि भाई जब बाल खींच रहे थे, the patient, when the patient was pulling his or her hair, what was actually happening is that there was difference in the pulling strength. That is the reason, कोई बाल कैसे टूटा, कोई बाल कैसे जोड़ा, हर बाल जो है सेम नहीं है इस वजह से. ठीक है, difference in the pulling force. Okay, incomplete hair loss, unlike what? Unlike alopecia areata. ठीक है, unlike alopecia areata. Histopathology जो है, there would be peritubular inflammation, but also, right, there would be bleeding, there would be bleeding seen. Okay, bleeding दिख रही है, क्यों दिख रही है? क्योंकि आप देखिए इसमें, यहाँ पर देखिए, है ना, ठीक है, there are these peritubular hemorrhages. फाइन, ट्रीटमेंट क्या देंगे हम लोग इसको, कि भाई वी डेफिनेटली वी नीड टू कंट्रोल द पेशेंट, राइट, वी हैव टू गिव SSRI to the patient and behavior therapy, and definitely refer it to a psychiatrist. Okay, all right. Secondary syphilis में जो है, what are we seeing, what appearance do we see over here? Tell me, anybody know this? This is a moth-eaten appearance, this is the moth-eaten appearance, right? And the we have this moth-eaten appearance. Okay, all right, and this is a screenshot from my main notes. Okay, फाइन, नाउ वी कम इन द डिफ्यूज पैटर्न. डिफ्यूज पैटर्न में क्या क्या हम लोग को दिख रहा है? ठीक है, वी हैव दिस एनाजन एफ्लुवियम एंड टीलोजन एफ्लुवियम. ठीक है, डिफ्यूज पैटर्न ऑफ हेयर लॉस. ठीक है, कि भाई अचानक से बाल चले गए, है ना, क्यों होता है? इट कुड बी आइदर बिकॉज ऑफ therapy, right, certain therapy, it could be there. Yes, in anagen effluvium. And next up it could be telogen effluvium, right? What is actually happening is because of sudden stress, right? Moth eaten appearance in syphilis, or yes, yes. Okay, and over here you see, in telogen effluvium, what is happening is, because of sudden stress, usually what the normal hair, what it is, right? In normal hair is lost, like 100 hair per day are normal, no problem. Okay, but in this you see, because the stress is so much, maybe क्या बंदे एग्जाम था, उस वजह से जो है ये दिक्कत हो गई कि भाई, he is losing his hair. It could be because of any given reason, acute presentation, there could be childbirth, severe psychological stress, or dramatic hair fall. This explains, right, why we doctors, right, we usually lose our hair, right? Okay, because we are in so much psychological stress every single time. Okay, all right, that is one thing. All done and dusted over here. Now we go on to the nail findings, right? Nail findings, we do it up very quickly over here. uh, Disorders of nail. Okay, I'll just start up with right here. Disorders of nail, we in dermatophytes we did it, right? We were giving the patient what? Amrolfin, nail lacquers we were giving. Okay, so this part is like a sort of revision. I'll go very quickly. Nail lacquers we were giving, and we were giving Amrolfin to the patient. Okay, and what are the nail findings we see? Different nail findings we see. These words are very important, and nothing is new. We have already completely covered everything, right? In psoriasis, I said, like, there is irregular pitting which we see in psoriasis. Okay, in the polish mnemonic we saw this. Okay, in alopecia areata we have the geometrical pattern which is there. Okay, in alopecia areata the pits are geometrical. Okay, next up we have this in eczema, it is completely destroyed. You see, this irregular, the nail is completely destroyed in eczema. All right, in trichonychia, this one word you need to know, that is, this is a 20 nail dystrophy. It is a 20 nail dystrophy. Okay, that is trichonychia. Pterygium, tell me pterygium, nothing new for you. Pterygium is a very classical finding in nail lichen planus. Okay, nothing new for you. You see Bu's lines are the horizontal lines, right? They are the horizontal lines we see. Yes, okay. Dr. Vish, thank you so much, Dr. Vish, thank you so much. In leukonychia, what do we see is, like, what do we see is the white color which is there, it does not disappear on pressure. That is one thing. It does not pressure. Okay, and one thing, I need to add over here as well, like the Lindsay nail which is there. Okay, what does it tell me? Lindsay nail is half and half. Okay, half and half which is there, 50-50%, like 50% it would be white and 50% would be normal. Okay, leukonychia totalis, over here there would be systemic manifestation. Because of systemic manifestation we see there are these white nails, absolute white nails. Yes, so systemic manifestation illness, like there could be severe liver disease, there could be hypoalbuminemia. This is the most common cause. Hereditary, and the entire nails are white. Okay, all right, that is one thing which is very important. Okay, all right, so we're done with the nail part. Yes, so we come up with the Hansen's disease. We do this up very quickly. Like Hansen's disease, extremely important topic. Okay, so how I'll be doing this, right? Okay, fine, we just do it. We just start with the classification part, right? We start with the classification part, right? Over here, can anybody tell me, what classification do we use it? We use the Ridley-Jopley classification. right? Ridley Joplin classification, right? But what is important over here is to know the nature of the Microbacterium leprae. If you know the nature, right, so everything we have written over here, right, all the manifestation become very easy. Okay, so this is where the intro comes in. Microbacterium leprae, it prefers to stay in cold locations. That is the reason you see it prefers cold locations. Yes, that is the reason the ear lobes are involved. Ear lobes are involved. You see, I'll show you right in the most worst variety, right? The ear lobes are involved. Okay, because if we know the nature of the organism, we can elicit the findings in the patient and make our life easy. Okay, fine. And the nose are involved as well, right? So there are no deep systemic manifestations of this. Okay, fine. Staining, we would use a Zedin stain, yes, and 9-banded amyloid fat pad is been used because it is very difficult to culture. Okay, Ridley Joplin classification, we have the best type to the worst type. Yes, in this patient has the best immunity, has the worst immunity. Okay, in this classification, right, what is not given, right, what is not clear is there are certain limitations to this, that is the indeterminate type is not included. Indeterminate type is the first one that we would take up. What is it? Tell me. It is the cell mediated immunity that the body, right, the body has not yet decided like what to do about this. Okay. So all these ones the body has decided कि भाई हाँ करना क्या है इनके साथ में, ठीक है, जो अपने को मैनिफेस्टेशन आ रही है सारी जितनी भी जो the insult is happening, body has decided what has to be done, but in this one that the body has not decided yet. Okay, yes, that is the indeterminate type, so yet not decided what to do. Okay, दिखेगा कैसे, there would be hypopigmented patches. Okay, that is one thing. Sensations are normal. Yes, scaling is absent. There would be pruritus. There would be pruritus. Okay, so and nerves are not enlarged. The body has not decided what to do. कि करना क्या है इसका. Okay, now we come up to the classification, that is Riley Joplin classification over here, right? Okay, fine. Before that, you have to know the overview. If you know the overview, definitely your life will be very easy. You would be definitely, uh, easily you will understand the nature of this disease. Okay, T cell immunity and B cell immunity. Okay, two things that I will tell you. The in TT variant, this is the best immunity of the in the patient, right? So the body will confine itself very easily. That is that is it about TT. Okay, and yes, tubercular variety. Yes, TT is a tubercular variety. And if the body is able to confine it very easily, what would happen? Tell me. बहुत सारे रहेंगे कि बहुत कम होंगे, है ना? बहुत कम होंगे, है ना? ठीक है, it would be paucibacillary. Yes, it would be paucibacillary one because the body is doing its job, है ना? The body is doing its job very well. That will become paucibacillary. Pauci means less bacilli, less bacilli. Okay, and in the worst variant, that is the LL type. In the LL type, right over here, L type, that is the Lepromatous leprae type, right? Over here, what is happening is, you see, yes, it's gonna be multibacillary one. Sorry, multivascular one. Okay, fine. इतनी बात समझ गए आपको? All right. Over here you see two terms I would introduce to you guys. First is a granuloma, yes, and second are the foam cells. First is granuloma and second are the foam cells. Okay, right up. Granuloma बन रहा है तब कब, जब बॉडी उस पे एक्ट कर रही है, ठीक है, एंड जितने भी जो मैनिफेस्टेशन है, ठीक है, वो ग्रेनुलोमा की वजह से ही होने वाले हैं, ठीक है. ऑल द नर्व मैनिफेस्टेशन विच आर देयर, everything which is there which is happening is because of the granuloma, because it is compressing the nerve, it is compressing the nerve. Okay, now you come to the foam cells. Now you go up again. Foam cells which are there, okay, they are they are absent, right? They are formed by the B cell immunity. They are formed by the B cell immunity, right? Okay, are the B cell competent enough to kill this? The answer is no. The answer is no, right? B cell are not competent enough. But what they would do is they would the macrophages would come and they would eat up this, right? Yes, but the thing is they are not competent enough. So what's going to happen is, right, they would just end up swelling up and we would have manifestation like foam cells would be there. Okay, ठीक है. तो एक जगह ग्रेनुलोमा है, एक जगह फोम सेल्स है, ठीक है। यहाँ पर जो है फोम सेल्स इज बिकॉज ऑफ बी सेल्स, यस, और जो ये वाली बात है इट इज बिकॉज ऑफ टी सेल्स। ओके, फाइन, सिंपल। नाउ आई वांट टू इंट्रोड्यूस अबाउट द लेप्रा रिएक्शंस, ठीक है, लेप्रा रिएक्शंस, ठीक है। लेप्रा रिएक्शंस क्या है? दिस इज व्हाट बॉडी इज एक्टिंग ऑन द माइक्रोबैक्टीरियम लेप्रे, ओके, ठीक है। तो इसमें अगर टी सेल इम्यूनिटी अगर एक्ट कर रही है, ठीक है, टी सेल इम्यूनिटी, एंड इट हैपेंस इन बीटी एंड बीबी टाइप, it would be type 1 lepra, okay, and B cell immunity, right, it happens in type 2. All right, this is the body which is doing some actions against that lepra reaction type 1 and 2. That is all about it. Okay, now we go on to the types. Lepra reaction, yeah, there is a very detailed table, yes, we will do that as well. Okay, in tubercular type, okay, tubercular type, we would go about individual type of Ridley Joplin classification हम लोग करने वाले हैं यहाँ पर, ठीक है। इसमें क्या हो रहा है कि I told you that this is the best type of immunity, yes, so you guys can answer me that there is granuloma formation, है ना, granuloma formation है यहाँ पे, ठीक है। That is the reason there is nerve compression, and this nerve compression, because of that there is loss of sensation, ठीक है, and there are hypopigmented patches as well, okay, and then the ash leaf sign, yes, okay, all right, and over here you see patches would be how much? Less patches, less number of patches, right, because the immunity is the best, immunity is the best, okay. Annular plug with central clearing which is there, and the right way up saucer appearance, you know, this diagram which is there, that drawn up, right, the right way up saucer appearance which is there, that is a very classical thing over here, okay. We are reading about TT variant, okay. In BT1, right, BT1, what is important are the satellite lesions are important. This word is very important, that is satellite lesions, okay, fine, yes, and the lesions are about 3 to 10. Borderline, yes, mid borderline one, right, what is important over here is the inverted saucer shape appearance, that is one thing, yes, and it is geographical map like you see in this patient, yes, over here you see there is, in this one you see, right, very clearly elicited, yes, in this, okay. But now tell me, yes, because it is the borderline, right, over here, right, if you see there is the borderline variant, because of this, tell me the immunity of the patient, is it good or bad? For 50-50, 50-50, right, the immunity is not that good, not that bad, okay. But the thing is like the granuloma are decreasing but the foam cells are increasing, yes. If the granuloma are decreasing, is because the body is, you know, is fighting against this, but it is not really competent enough to do it, right. But the B cells are coming in, the foam cells are increasing, but it is not competent enough, okay. Next up we have the borderline lepromatous type. Borderline lepromatous type, it is almost asymmetrical, yes. The sensations are what? Tell me. I just want to ask one question over here, that is sensations are normal or not? Tell me, anybody could answer me this about the sensation? Yeah, the sensations would be normal. It is very surprising, right? You see in borderline, in BT variant, I was telling that sensations are gone. Not, yes. I was telling that sensations are gone. Yes. But you see, as the disease is worsening, I'm telling that the sensations are normal. Yes. Because why? What is the exact reason is that the patient immunity is becoming worse and worse and worse. Granuloma formation is decreasing and the foam cells are increasing. ठीक है, कंसेप्ट समझिए, आपको बात है ना, ठीक है, कंसेप्ट समझे, okay. The sensation they return to normal, okay. Did you get the concept or not regarding the granuloma and uh, the foam cells, okay. That is what all about it. The lepromatous type, right, this type is most important because of the clinical findings, okay. We have the foam cell would be there, yes, and we have symmetrical involvement in it. If there are foam cell, it is Th2 type, and Th1 type, it is granuloma. This I have already discussed. Exclusive feature, right, sensations and sweating, tell me what happens to this? Not, yes, very correct, yes, they are normal, they are normal, right, why? Because the body, less granuloma, okay. All right, if you think in that, yes, if you think in that manner, definitely, you know, you will not go wrong. Sensations are normal. Over here we have very particular type, normal, yes, very particular type of, anesthesia, right? In glove and stocking, appearance would be there. Glove and stocking anesthesia would be there, and peripheral neuropathy we would see. Okay. Faces, tell me, different type of faces would be there, right? Yes, and this is a very classical thing that we need to know about. Yes, so this is what we see, this leonine like faces, right? This one, they are the leonine like faces. Yes. Okay. And the next up we have right here. Yes, and right here we see there are loss of hairs and the eyebrows, right? No eyelashes, no nothing. This is called as medrosis. Yes, medrosis. Okay. And they see this ear, right? I have not mentioned this point, but this is Buddha ear. This is like a Buddha ear. Okay. All right. Fine. So that is all about that. Now we can just discuss about lepra reactions. Yes, and they would be all about that. Okay. And sir, if sensation is normal, why anesthesia? Uh, Over here, right? The thing, Abdullah Sheikh, good bit confusion. Yeah, good question, right? Good question, very good question. Over here you see, right, there is extensive involvement of the nerve. All right, over here you see the peripheral nerve. Yes, there is not the nerve, they have terminal endings. Yes, that is the reason there is anesthesia in just the periphery, not in the borderline part. Okay, good question. Good question, right? You see this image that I have seen, this circular pattern, right? This is where the nerves have been affected. Okay, all right. So I hope I answered that question. Next up we have is the lepra reactions. Lepra reaction, right? So these are the reactions which the bodies are doing against the infection. Okay, there is type 1 lepra, there is type 2 lepra. Okay, okay, you're welcome, you're welcome. Okay, fine. So we have, this is a TH1, this is TH2, simple. We are nothing new with this one. But what is new for us is these are type of hypersensitivity reaction, right? These are hypersensitivity reaction. But over here, what is important here is we should know which type of hypersensitivity it is. You see, this is type 4 hypersensitivity, and over here this is type 3. Over here we are using something called as rule of 5, that 4 plus 1 would be 5. Simple. And 3 plus 2 would be 5. Cool. All right, definitely we cannot go wrong with this. Okay, and fine. Over here you see there are memory T cells that are being formed. Because of this, there are inflammatory there is this interleukins that are being formed, right? This is the reason for the tissue destruction. Body is acting against its own cell. Okay, that is the whole point about it, because the bodies are acting against it. This is a HSN reaction, that is the hypersensitivity reaction. Okay, all right. The most severe variant is BT, BB, and BBL. Okay, all right, that is the thing. Yes, BT, BB, and BL variant. Okay, and over here, what are the types? These are the other types, right? That is the TD and LL variant would be here. Okay, fine. Upgradation and downgradation reaction, right? Over here, this concept right here, what we see, it is just what we discussed right now, that if the person's, right, if the person immunity is good, it would be TT variant, right? If it would be TT variant. If the person immunity is bad, it would just go up to the LL variant. Okay, all right. Over here you see, yes, so upgradation reaction and downgradation reaction. तो upgradation होगा तो भाई यही होगा, है ना, TT पे चला जाएगा. डाउनग्रेड हो जाएगा तो भाई LL पे चला जाएगा वो, है ना. ठीक है, इसमें देखिए आप, इम्यून कॉम्प्लेक्स डिपोजिशन इसमें हो रहा है इसमें. All right, fine, that is one thing. And now we come to the treatment part of it. ठीक है, treatment part of it will come, and definitely this is very important. Okay, if we have understood the possibacillary and multibacillary point, then it becomes very easy for me to teach you guys. Okay, क्यों? Because these are the guidelines that we need to follow. Okay, these guidelines we need to follow very well. Okay, right over here you see this is possibacillary and multibacillary TB. But how to differentiate कि भाई कौन से क्या है? Because the whole treatment is based on that. Okay, fine. Possibacillary means what? This is less number of bacilli. Less number of bacilli. ठीक है, we just discussed about this. Less number of bacilli. Okay, possibacillary, and this is multibacillary. Skin lesions, right? 1 to 5 possi, more than 5 multi. Okay, पेशेंट आएगा तो पहले हमको यही देखना पड़ेगा भाई कौन सा है ये. दिस इज द लेस इनकी पॉसिबैसिलरी वेरिएंट है या मल्टीबैसिलरी वेरिएंट है, हमको वो देखना पड़ेगा. ठीक है. नर्व थिकनिंग जो है, इट कुड बी आइदर नन और इट कुड बी आइदर वन. नन और वन. मल्टीबैसिलरी, दिस इज मोर देन वन वेरिएंट. इन दिस इज एस 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 एस, दैट इज slit skin smear examination, right? It is negative in this one, okay, and it is positive in this one, right? Where we have the granulomas, we would just slit it up and we would put it on the slide and check what it is, okay. How about the duration, right? Duration of treatment in possibacillary it would be 6 months, and multibacillary it would be 12 months, and this is the update, right? This is the update, okay, fine. अभी जो किट है ना भाई, बहुत ज़रूरी है ना, हमारे लिए बहुत ज़रूरी है किट, ठीक है। क्यों ज़रूरी है ये? क्योंकि हमको जो है वो सीधा सीधा पूछ लेते हैं इमेज देखे कि भाई ये क्या है बताओ, ये कौन सी दवाई है बताओ, ठीक है। ओके, ये शौर्य त्रिवेदी 6 months and 12 months, you're correct. Okay, possibacillary and multibacillary variant. Okay, what do you see here? There are 4 different strips, but I have only taken one. Okay, in this is multibacillary one. Okay, in adult doses. So multibacillary, possibacillary, है ना, अडल्ट एंड चिल्ड्रन, 4 स्ट्रिप आते हैं, बट मैंने एक ही के यहाँ फोटो ली है, ठीक है। इसमें देखिए आप जो पहले के जो यहाँ पर आप देखिए, है ना, ठीक है, ये जो डोज है ना ऊपर जो आ रहे हैं वो आपके सामने है, राइट? दे आर सुपरवाइज्ड डोजेस, दे आर द सुपरवाइज्ड डोजेस, ओके। बट व्हाट आर वी गिविंग, व्हाट आर वी गिविंग, राइट? वी यूज rifampicin, dapsone and clofazamine, rifampicin, dapsone and clofazamine, right? Okay, so ये हम लोग दे रहे हैं डे 1 पे, ठीक है। डैप्सोन वी आर गिविंग, डैप्सोन इज डेली, डैप्सोन इज डेली, D4D, डैप्सोन इज डेली। क्लोफाजामिन first time we would give 300 mg, and followed by we would just give 50 mg OD, okay, all right. And over here you see, yes, if I zoom it in, at the very bottom it is seen there is dapsone, and there are two drugs, right? There are two drugs for rifampicin, you see, 300 के दो देते हैं हम लोग, 300 के दो देते हैं हम लोग, ठीक है। इट इज नॉट, आई एम नॉट एबल टू जूम इन मोर, बट आई होप यू कैन सी दैट देयर आर 3 क्लोफाजामिन, 100 के 3 है, ठीक है। तो कोई पूछ ले कि भाई ये कौन सा है, तो अगर 3 दिख रहे हैं तो वो क्लोफाजामिन है, क्योंकि इसकी डोज जो है वो 300 है, ठीक है। जो एक हमको दिख रहा है, एक हमको दिख रहा है वो डैप्सोन है, ठीक है, ओके। दैट वी शुड नो अबाउट, एंड एवरीथिंग कम्स अंडर नेशनल leprosy eradication program, NELP, okay, fine. So we're done with the whole uh, Hansen's disease, that is leprosy, okay, all right. Thank you so much, Ajay, thank you so much. Next up we have the blistering disorders, okay. So this is the main crux of derma, blistering disorder. इसमें जो है हमको अगर split समझ जाए ना, split की कहाँ split हो रही है, then life becomes more easy, okay. Blistering disorders straight up we have over here, right? So I'll just start with this कि भाई एक्चुअल में जो लेवल है ना स्प्लिट कहाँ हो रहा है, अगर आपको ये बात समझ गई ना, ठीक है, तो आपके लिए बहुत ज़्यादा आसान है ये पूरा टॉपिक को समझना, ठीक है। ब्लिस्टरिंग लेवल, एट व्हाट लेवल इट इज हैपनिंग, ठीक है। तो बिग स्ट्रॉन्ग गाइस लव कॉफी, तो उतना तो आपको समझ गया था बात, उतनी बात तो आपको समझ गई थी, है ना, हमने पहले डिस्कस किया है। इसमें देखिए आप, सब कॉर्नियल, सब कॉर्नियल है ना, ठीक है, स्ट्रेटम कॉर्नियम के जस्ट नीचे सब कॉर्नियल, स्पाइनस, है ना, बिग स्ट्रॉन्ग गाइस लव कॉफी, है ना, ठीक है। स्ट्रॉन्ग जो था स्पाइनस था, वहां पे अगर हो रहा है तो इट इज एक्जिमा। सुप्रा बेसल स्प्लिट, स्ट्रेटम बेसल के ऊपर अगर स्प्लिट हो रहा है तो इट इज इन ऑल दीज कंडीशंस, ओके। अगर बेसल में खुद भी हो रहा है तो ई बी एस ई बी जे ई बी डी, ठीक है, 3 वेरिएंट इसके अंदर आते हैं, ठीक है, ऑलराइट। एंड दैट इज ऑल अबाउट इट। ये रहा, अगर आपको रिवाइज करना है तो यू कैन रिवाइज विद दिस इमेज राइट ओवर हियर, राइट, फाइन। सो नाउ आई विल जस्ट स्टार्ट अप विद this part, that is these acquired blisters, ठीक है, acquired blister, will start with this one, ठीक है। Pemphigus is the one, okay. Antibodies are against what, tell me? Antibodies are against the desmosomes, desmosomes, ठीक है, हमने पढ़ी ये बात, ये सारी बात हमने पढ़ रखी है। The blisters are very flaccid, there is mucus there is mucosal involvement, the blisters are very flaccid, there is mucosal involvement, that is first, okay। इसके अंदर भी जो है the signs are very important, yes, the Nikolsky sign and the Bullous spread sign, which are very important, right, okay। And over here you see these are the blisters, right? In this diagram you can see these are the blisters, and if you just push it right from one side, yes, and the pattern it creates right after the where the bulla ends, this is, it can help us diagnose very easily, okay। We can have a clinical diagnosis for this condition if it is a crescent shape, ये दिख रहा है ना आपको ऐसा, अगर crescent shape है तो ये जो है ये पेम्फिगॉइड वल्गैरिस है, ठीक है, okay। And if it is angular variant, it is the bullous variant, okay। We will read about here pp, okay, all right, fine। So we just got done with that, now we just see about the diagnosis about this, right, कि भाई split कहाँ हो रहा है, ठीक है। अगर आपको split कहाँ हो रहा है ये समझ की बात नहीं है, ठीक है. सो दिस बिकम्स वेरी इजी. ओके, वेरी इजी. सो what I told you, right, it is the split is supra basal, right. So because of this कि भाई ऊपर का जो है वो it is all gone, but you see at the very bottom, at a certain basal, right, you see this thing, right. Because of this appearance is called as what? It is called as tombstone appearance. Yes, row of tombstone appearance, है ना. ऐसे दिख रहा है ये, है ना. Okay, over here you see we have this. How can we find this pattern? We can find this in direct immunofluorescence, and we can have a fishnet pattern in this. Okay, all right. And in the initial period, right, in the basics of derma, I had one slide regarding this as well. Okay, how about the treatment में क्या करेंगे हम लोग बताइए. We would definitely use prednisolone, right. Prednisolone would be the mainstay. Mycophenolate, mofentil we would give, and cyclophosphamide, right. Methotrexate too, we just be the, we want to decrease the immunity of the patient. Yes, because it is कि antibodies बना रहे हैं ना, तो हम लोग उसकी patient की जो immunity हम कम करना चाहेंगे. ठीक है. Okay, ये बात हो गई. But rituximab, right, rituximab which is there, yes, what it does is it helps, right, it helps the patient who are not responding to steroids. Okay, fine. All right, that is one thing we need to know about. Okay, so we just done with the acquired blisters, right. Over here, right up, you see the fishnet pattern. This is the fishnet pattern. Okay, ठीक है. We'll come back to this slide again. Yes, this is the fishnet pattern we see in PV. All right. All right, we go on with the next up we have is Pemphigus vegetans. We take up this and we keep the most interesting one for the last one. Okay, Pemphigus vegetans we have over here. That is, this is like a cauliflower mass which is there, and over here, right here, vegetating mass is in the flexular areas. Yes, Pemphigus vegetans. Okay, fine. Pemphigus foliaceus, you see the mucosa, the mucosa is not involved in this. That is one classical thing that we need to remember. The mucosa is not involved. Okay. The antibodies are against the desmoglein 1. Antibodies are against desmoglein 1. Okay. Histopathology, subcorneal split. ठीक है. Okay, and we would use topical steroids. Pemphigoid gestationalis. Pemphigoid gestationalis is another one. But यहाँ पर जो है आपको कंफ्यूज नहीं होना है. किसके साथ में? आपको कंफ्यूज नहीं होना है इम्पेटिको हर्पेटिफॉर्मिस के सामने, जो हमने पढ़ा था सोरियासिस के अंदर, है ना. ठीक है, इसको मैंने बोला था कि भाई आपको जो है स्टेरॉइड देना है. इवन दो इट वाज कॉन्ट्राइंडिकेटेड इन दिस कंडीशन, वी गिव स्टेरॉइड टू द पेशेंट्स. ठीक है. ओके, अगर स्टेरॉइड कॉन्ट्राइंडिकेटेड थी तो हम लोग दे रहे थे साइक्लोस्पोरिन. ओके, सो डू नॉट गेट कंफ्यूज विद दैट. वी आर टॉकिंग अबाउट पेम्फिगोइड gestationalis. Okay, all right, and you see this image. Cicatricial pemphigoid, this is scarring alopecia we see over here, right. And over here you see in IgA bullous dermatosis, what is actually happening is we have this string of pearl appearance, you see. Okay, all right, that is very classical in this. Okay, in bullous pemphigoid, yes, the presentations are very important, and the blisters are very itchy blisters, right. So whenever the patient comes to us, usually what happens is, like the blisters are already ruptured. Okay, it is a very classic blister which are already ruptured, and the antigen are against BP1 and BP2. Okay, if you remember my diagram initially when we did it, yes, this is BP1 and BP2. ठीक है, the inside the hemidesmosome was BP1, है ना, और हेमिडेस्मोसोम के बाहर जो था it was BP2, है ना. ठीक है, अगर आपको बात याद होगी तो. ओके, BP1 जो था it was 230 and BP2 it was 180. ठीक है, that is one thing. Over here you see the Nikolsky sign is positive, is negative, and Bullous spread sign is positive. ठीक है, we just discuss about this as well. Okay, all right, so we will do dermatitis herpetitis formis now. Okay, this is the most interesting one. Okay, the reason being that the patient comes in with severe itching, extreme itching, which it is there. Okay, all right, yes, and the thing is that it is a misnomer. Yes, that it is nothing related to herpes. Okay, but the thing over here is the association. Yes, it is associated with what? Tell me, it is associated with celiac disease. Okay, अब इसमें हो क्या रहा है ना, सारी जो स्टोरी है हम इससे समझेंगे. ओके, या इसे हम समझेंगे कि भाई सीलैक डिजीज हो गई थी पेशेंट को, उस वजह से. यस यस यस, रितु कुमार, यू वेरी राइट. यस, सीलैक डिजीज इज द आंसर. इससे हो क्या रहा था कि भाई इन सीलैक डिजीज देयर वाज दिस एंटी टीटीजी एंटीबॉडीज बन रही थी अगेंस्ट द ग्लूटामिनेज. ठीक है, अगेंस्ट द thing. But what was happening is these same antibodies are going and दे आर डैमेजिंग द एपिडर्मिस, ठीक है। एंटीबॉडी जो है सारी यहाँ पहुंच गई, ठीक है। एंड what did the body do is right, it sends neutrophils, these multinucleate cells, right, these are neutrophils, and they send these right in the epidermis, okay. And what it does is over here they eat up this thing, okay. that is the reason that is the reason, right. Over here we see something like this, you see पेपिलरी डिपोजिशन भी सी, ठीक है ना। इसी को ही हम जो डायरेक्ट इम्यूनोफ्लोरेसेंस में जो है हम लोग देख रहे हैं, ठीक है। ओके, सिंपल बात इतनी हो गई है ना हमारी। ओके, ऑल राइट, दैट इज ऑल अबाउट द dermatitis herpetiformis। ओके, ऑल राइट, यस, okay. So we just got done with the blistering disorders which are required, and we will start about the inherited ones, okay. Very easy very easy, you know, and very interesting topic as well. These are the blistering disorders which are inherited, okay. The Halle disease and the diarrheal disease, right, over here we'll read about those, yes. So defect is in calcium pump in what, एक जो है, like we can do this also, you know, in a very comparative manner as well. So one we have in Golgi apparatus, and one we have defect in the endoplasmic reticulum, ठीक है। We'll do it in a very comparative manner, this thing, okay. And in this you see, in the diarrheal disease, right, what is actually happening is the gene defect which is there, yes, it is a calcium ATPase ATP2A gene, right, which is being affected, okay. And in this it is ATP1A 1AC, okay, ATP2AC which is affected, okay, all right, that is something. And see, the desmosomes are involved over here, and there are blisters being formed in the flexural areas, okay, in the Halle disease, okay. That is all about it in the flexular areas, okay. And the split is suprabasal split, ठीक है, simple. The one histopathological word that I want to give you guys is dilapidated brick wall appearance, the broken wall appearance which is there. That is what I want you to know, that the brick wall appearance is seen in Halle disease, okay. All right, that is all about the Halle. And now we come with the diarrheal disease, right, you know, actinic keratosis, when I was talking about before, that is what I was mentioned you guys, yes. Actinic keratosis, this was the answer that I was expecting, okay. Diarrheal disease, okay. It is an autosomal dominant thing, it defect in calcium pump, and it in the calcium pump there is problem in the endoplasmic reticulum, okay. And over here you see ATP2A 2A2, because of acantholysis it triggers what, it triggers the dyskeratosis, okay. Dyskeratosis, you see over here, yes. डिसकैरेटोसिस हमने क्या पढ़ा था बताइए, है ना। पैराकैरेटोसिस डिसकैरेटोसिस हमने पढ़ा था ना पहले, है ना, ठीक है ना। अगर स्ट्रैटम कॉर्नियम में जो है, ठीक है, अगर स्ट्रैटम कॉर्नियम में जो है, अगर एबनॉर्मल प्रेजेंस ऑफ न्यूक्लियाई अगर है, ठीक है ना, दैट वाज इट, है ना। तो इस बीमारी में हो रहा है ना, दिस एंड व्हाट वाज द एग्जैक्ट थिंग वाज इन डिसकैरेटोसिस, देयर वाज केराटिनाइजेशन, राइट एट द वेरी बेस, है ना। एट द स्ट्रेटम बेसिल में केराटिनाइजेशन हो जा रहा था, ओके। स्ट्रेटम कॉर्नियम में, स्ट्रेटम बेसिल में केराटिनाइजेशन हो जा रहा था, ठीक है, जबकि वहाँ पे चाहिए नहीं तो भी हो जा रहा था, तभी देखिए इनको ऐसा हो गया, ठीक है। सिंपल सी बात है, ओके। So this is all about it. This is what I'd explain you guys, that this is premature keratinization in the epidermis, okay. All right, ठीक है। Very interesting finding, right. Over here I just want you to focus on these two words, right, that is cop round and cop grains. These are two structures that we see in the histopathological slides in paracarotis and nucleus in right side. Yes. In dyskeratosis you see, okay, what is these two words, right, the cop grains and cop rounds, the two structures which are very important, okay. So rounds are these, you know, spherical structures, cop grains are these, you know, horizontal structures which are there, okay. All right, in histopathology we would see dyskeratotic keratinization, okay. Dys no, it is not the same. Parakeratosis, it means that there is, we see, you know, the nuclei is there in the stratum corneum, right. In dyskeratosis what is happening is, yes, there is premature keratinization, है ना, ठीक है। Ritu Kumar, it is premature keratinization which is there, you see, okay. Normally जो है, जो keratinization है, जो हमने पहले डिस्कस किया था, ये जो वो एपिडर्मिस में हो गया था, ठीक है। बट इन इन दिस डिजीज व्हाट इज हैपनिंग इज कि भाई नीचे ही हो जा रही है, ठीक है, जो स्ट्रैटम बेसिल है उसी में हो जा रही है, ठीक है, जबकि हमको चाहिए नहीं। कैरेटिनाइजेशन का मतलब क्या था कि कैरेटिनाइजेशन में एक्चुअल में क्या हो रहा था, वी वर एडिंग स्ट्रेंथ। तो स्ट्रैटम बेसिल में तो हमको स्ट्रेंथ इतनी नहीं चाहिए ना, हमको स्ट्रैटम कॉर्नियम में स्ट्रेंथ चाहिए, क्योंकि बिकॉज दैट इज द वन विच इज विच इज वी यूज फॉर द मैकेनिकल स्ट्रेंथ, है ना, ठीक है। स्ट्रैटम कॉर्नियम में चाहिए, स्ट्रैटम बेसिल में इतनी नहीं चाहिए हमको, ठीक है, इस वजह से जो है आई होप आई आंसर योर क्वेश्चन। और ऑलराइट, यस, so that is the difference between parakeratosis and dyskeratosis. Okay, fine. We have over here, and over here, this is epidermal, congenital epidermal bullosa. Okay, fine. In this topic, okay, fine. All right. In this, right, one thing that is very important is what is important is that blisters at trauma areas. ठीक है, बच्चों में अक्सर होता है ये blisters at the trauma areas. Okay, trauma induced areas is one point to remember. You can really go ahead with the whole thing. Yes, so fine. We just got done with the blistering disorders which are inherited one. So acquired one भी हो गए, blistering one भी हो गए, ठीक है. Okay, now we come with the disorders of pigmentation. Okay, fine. All right, disorder of pigmentation. There are two things over here. Yes, so hyperpigmented and hypopigmented. ठीक है, so we do the hyperpigmented first. Okay, hyperpigmented first हम करेंगे. अगर आपको ये बात समझ गए ना इतनी, तो आपको जो है ना बहुत ही इजी हो जाएगा कि क्लिनिकल मैनिफेस्टेशन जो है वो समझने में, ठीक है. That is how it is. All right, so you see in the epidermis, right, if there is hyperpigmentation in the epidermis, okay, we would have black color or brown color. At the junction, if there is problem, right, we would have purple color, right. If it affects the lower dermis, right, it would be blue or gray color, blue or gray color. Okay, fine. We take up the first one, that is melasma. You see there are brown pigments, है ना, brown pigments, अब brown इसमें है, ठीक है. Okay, you see the epidermis is, sorry, the epidermis is involved. Okay, epidermis is involved. Simple. You see now if you know this one table, it is very easy for us to correlate. Okay, epidermis is involved, yes. And if it is epidermal, it is better prognosis, and in the dermal it is poor prognosis. Okay, so with the color we can see, yes, brown. Yes, you're very correct, very correct. Ritu Kumar, you're very correct. Riti Kumar, I'm sorry, I was pronouncing your name wrong. Okay, wood's lamp, yes, it is, yes, you can see, yes, and in this one you cannot see. In the epidermal you can see wood's lamp, in the dermal you cannot see. Histopathology, right, histopathology is what, because it is abnormal large number of melanocyte, right, in that area, it increases in the function, that is the reason it has it. What could be the reasons, what could be the reasons of it, tell me. It could be sun, yes, sun and hormones, yes. So what can we do is we can apply, Kligman regime, hydroquinone, and we would give patient sunscreen to do it, right. And we can also tyrosinase inhibitor, that is the kojic acid, can also be given to the patient. Okay, that is about the hyperpigmentation, ठीक है. अब इसमें आ जाइए, अब एक एक जो पूरी जो लिस्ट है इसके अंदर, ठीक है, अगर आपको एक एक चीज़ पता है इसके अंदर से, तो यू विल बी एबल टू गेट ऑल दिस इन वन गो. नेबस ऑफ ओटा, आंख के पास है, ओ ऑप्थेल्मिक, ठीक है, नेबस ऑफ ओटा, ठीक है, इट विल बी नियर द आइज, नॉट इन द आइज बट नियर द आइज, एंड इन द आइज एज वेल. ओके, ब्लू स्क्लेरा is a thing, right, blue sclera is a thing. Okay, all right, we have over here histopathology is in the upper and mid epidermis. You would see it. Upper and mid epidermis. You would see it. What can we do for the patient is we can give laser and we can give Q switch. Okay, but the other thing is that nevus of Ito. It is similar to Ota, but it is on the shoulder and scalp. Okay, but do not confuse this with Becker's nevus. Becker's nevus. What is Becker's nevus? These are the birthmarks. Yes, in this, what is actually happening is, you see, there are increased number of hairs and there is increased acne. You see, increase hair and increase acne, है ना, ठीक है. तो बैकर्स न्यूवर्स और जो है न्यूवर्स ऑफ आइटो में कंफ्यूज नहीं करना है आपने, है ना, ठीक है. तो ये जो दो पॉइंट है इसके अलग है, उसमें नहीं है ये पॉइंट, ठीक है. ओके, नाउ वी कम अप विद द hyperpigmentation part, right. Okay, these are the other things we would see in the miscellaneous topic as well. Okay, this is congenital melanocytic nevus. Okay, right over here you see, and this is the cerebriform variant. It's Hello sir, hello. Okay, We have the Mongolian spot. Yes, we have the Mongolian spot. In see, in this, what is happening is you need to know why it is actually happening. In Mongolian spot, we need to know why it is actually happening. It is the arrest of melanocytes. Great job, sir. Thank you so much. Thank you so much, Ishad. Thank you so much. Yes, over here you see, there is arrest and migration. That is the reason the whole mayhem is happening. Okay, arrest and migration, and you see over here, and it resolves. There is spontaneous resolution of it. There is spontaneous resolution of it. Okay, all right. So that is all about the hyperpigmentation part. We go on with the hypopigmentation part, right? Okay, hypopigmentation we'll be doing. Fine. Now, I think now by now you may have already known the way I teach, right? So first up, I have this thing, the table which is there, right, and it explains everything. It comes down the way. Okay. Over here you see, yes, the pathology, yes, hypopigmented patch which are there, right? It could be, see, everything is related to melanocyte over here. That is the reason the whole mayhem is happening. That is one thought you should have. ठीक है, तो हो सकता है कि melanocyte या तो absent या तो कम है, ये उनकी conditions हो गई. ठीक है, अगर नॉर्मल है हो सकता है कि भाई मेलानिन ही कम बन रहा हो. All right, tables are quick and short. Yes sir, thank you so much, thank you so much. So if you just follow this chain of thought, right, I know this is like a very not normal way to teach, right? But if you just follow this, your life is easy. Yes, because you can remember so many things at just one page. Yes, so, and you can also connect everything. Okay, you can also connect everything very easily. Okay, that is one thing. All right, so let us continue this session. Yes, so all right, the Apple Pencil battery is low, so I just put it on charge. Fine. So we have, so for some time, just bear with me. Onset could be what? Tell me. Yes, it could be because of onset. बचपन से भी हो सकता है ये, है ना? Congenital भी हो सकता है in P-baldism, right? In P-baldism, we will discuss about that as well, right? And in Pityriasis versicolor, you see, in Pityriasis versicolor, what is happening is these are the hypopigmented patch that we saw. इसकी तो पूरी स्टोरी तुमको पता है ना? PKLD की पता है, Pityriasis की पता है, हैंसन डिजीज की पता है, हमने सारे जो है हमने देख रखे हैं, है ना? ठीक है? Okay, fine. So now let's just start with the congenital variant. Yes, for lock in paludism. Yes, Riti Kumar, you are very right, very right. Okay, in you see what is happening in albinism. What is happening? Tell me. It is an autosomal recessive variant. Okay. Yes. Over here, you see there is the problem is in the mutation in the tyrosinase. Mutation in the tyrosinase. Okay. That is the reason you see there is absolutely no color in the body. Even the iris, the hair, right? Everywhere, right? Uh, there is no pigmented in the body. The depigment, everything is depigmented. Okay. In these images, you can see. Okay. Next up, we have P-baldism. That is what Riti Kumar is saying, right? Defect in the tyrosinase. Yes, yes. You're very correct regarding this. Yes. Okay. One more thing is that there is arrest in the migration of melanocyte. That is about the P-baldism. ठीक है? Melanocyte है जो जा नहीं रहे. The same thing in the Mongolian spot, right? There was arrest in migration. There was arrest in migration. Okay. That is all about the P-baldism thing. Okay. Some areas are normal. And next up we have this nevus depigmentosis. ठीक है, मैंने ये टॉपिक क्यों ऐड किया है यहाँ पे, क्यों ऐड किया है कि आप जो है वो कंफ्यूज नहीं हो जाओ ये देख के कि भाई ये है हमारा हैंसेन्स डिजीज है ना? ठीक है, इसकी सेंसेशन जो है नॉर्मल होगी. ठीक है, सेंसेशन जो है इसकी नॉर्मल होगी, है ना? ठीक है, तो आपको जो है कंफ्यूज नहीं करना है इसके अंदर. ठीक है, हेराल्ड पैच मत मार्क कर देना, कुछ और चीज मत मार्क कर देना. दिस इज व्हाट द एग्जामिनर विल ट्रिक अस. ठीक है, दिस नॉट अ वेरी लाइक फैंसी टॉपिक बट द एग्जामिनर कैन यूज दिस एंड दे कैन ट्रिक अस. ओके, फाइन. Okay, so now we have vitiligo. This is autoimmune destruction of the melanocyte. Okay, all right, that is one thing. Depigmented patches which are there, right, in the skin and hair. अब इसमें देखिए ना, the most important thing I'm telling you, right, about the treatment aspect. ठीक है, in the hair, right, the areas, Hansen is anesthesia region, right? Yes, yes, yes. In the LL type we saw, right? LL type we saw there was peripheral anesthesia which was seeing it. In glove and stocking anesthesia we saw. Okay, fine. Over here you see, yes, in this vitiligo, the treatment part I just want to focus on. Everything is written. In treatment part, in the area where hair follicles are not present, the treatment is poor. Why? Because the stem cell which are there in hair bulge, that is what we use to stimulate the color of the skin. ठीक है, इतनी बात आपको समझ गई? If you just keep this one sentence, I know it is like, uh, I should be taking a lot of time, but I want you to know this one point. Yes, about the treatment of vitiligo. Is because all these things are, very common. Definitely, you might have read it, and we will read this as well. Okay, depigmented patches, right, in skin and hair, right? It would be poor prognosis. Okay, melanocyte, yes, in precursor for skin repigmentation. Okay, so we need this. Okay, ठीक है, टाइप्स बताइए, है ना? टाइप्स क्या है? फोकल, either it could be localized or either it could be generalized. ठीक है, there could be two variants in it, localized or either it could be generalized variant. ठीक है, in localized variant, right, so this is focal means at just one spot. Segmental, it means one side of the body. Segmental means one side of the body. ठीक है, acrofacial at face, palms, right, and vulgaris is the common form. Okay, and universalis, it's everywhere. Okay, ठीक है, over here we have this thing that is trichrome vitiligo. Three color vitiligo is there. You see, this is normal skin, this is like 50-50%, and then this is absolutely depigmented skin. Okay, okay, over here we have this is Koebner phenomena is positive, and pseudo Koebner phenomena बताइए किसमें था? pseudo Koebner phenomena था molluscum contagiosum में, है ना, हमने पढ़ा था. ठीक है, तो the other day I saw like one video, like some patient regarding who he or she he had vitiligo. Yes, what the patient was doing is they went to the tattoo shop. Yes, and they were getting tattoo. They were getting tattoo, like the color of their body. They were getting tattoo, right? And it is something which is very wrong. Vitiligo may Koebner phenomena. It is positive, right? It is true Koebner. Yes. So tattoo करा रहा है कोई अगर, है ना, तो क्या होगा भाई? और ज्यादा आएगा, है ना? ठीक है, और ज़्यादा डिपिगमेंटेशन होगा आपको. सो इट इज़ so stupid, right? People, go ahead and they follow all these things. So definitely we should recommend somebody who is certified, right? Not to go to the quacks or these tattoo parlors, right? For the depigmentation color. Yes, mollusk, warts and mollusk. Yes. Okay, we would use topical steroids, and okay, that would be the mainstay of the treatment, and we can also give MTB. Yes, okay. Now over here, what is important is, you see, अगर किसी को जो है यूनिवर्सैलिस हो गया है, सब जगह ही अगर हो गया है, ठीक है ना, तो द पेशेंट वांट्स दैट कि भाई डॉक्टर साहब, यहाँ यहाँ जो है मुझे पैचेस जो है नहीं आए हैं, लाइक द होल बॉडी इज अफेक्टेड, ओनली सम पार्ट इज रिमेनिंग. ओके, what we would do is we would depigment the skin. Yes, we would depigment the skin. ठीक है, MTB भी हम लोग यूज करेंगे. वो depigment the skin, that is monobenzyl ether of hydroquinone we would use, and the it would depigment the skin. Fine. Okay, we could also give phototherapy as well. Okay, fine. Okay, contact leukoderma, we would do contact leukoderma. Yes, over here you see this is also called as bindi leukoderma or chemical leukoderma. You see, this patient, she was using bindi for a long time. It had PTPB. Yes, para tertiary butyl phenol, PTPB. यस, दैट इज द रीजन द डीपिग में स्किन का कलर ही चला गया, है ना? ठीक है, और इसमें देखिए इन मैडम ने जो है चप्पल में जो है इनके, ठीक है, जो था, इट हैड द सैंडल, राइट, इट हैड MTB, दैट इज मोनोबेंजाइल ईथर हाइड्रोक्विनोन. ठीक है, ये था, इस वजह से you see this thing happened. So you should know these two chemicals. Okay, contact leukoderma. Fine, that is all about the hypopigmentation part. So we just remaining with the connective tissue. Yes, so I know I told you guys, right, that I will be finishing this session at in 4 hours, so please bear with me a little more, and we'll be done with it. Okay, I'll be doing the connective tissue disorders. I don't want to leave this in halfway, so please allow me to continue the session. We just have miscellaneous topics and the connective tissue disorders, and we'll be all good then, right? The whole derma would be covered. Yes, so more or less maybe 20 minutes, 25 minutes, we should be done. Okay, connective tissue disorders. Right here we have the dermatomyositis. Okay, इसमें क्या जो है ना, सबसे ज़रूरी बात क्या है ना, इसके अंदर जो है कि साइंस आर वेरी इंपॉर्टेंट. ठीक है, साइंस आर वेरी इंपॉर्टेंट इन दिस. ठीक है, इसमें you see this thing over here, right here you see, what do you see here, this is the heliotrope rash, है ना? Yes, we see the heliotrope rash. Okay, fine, the signs are very important over here. Yes, over here you see there is, this is, in this we have shawl sign is positive. Yes, just 2 slides to go. Yes, there's only 2 slides to go. I'll just finish them up and the whole thing would be done. Okay, this is the Shawl sign which is positive in this patient in dermatomyositis. Anybody who can tell me what is this? Yes, these are the Gorton papules which are there. Okay, yes, and how about this one? Gorton papules, and if it is larger, it is Gorton macules. Okay, leave it. This is what? Yes, this is Gorton Riti Kumar, you are right. Okay, this is calcinosis cutis. The last one which is there is calcinosis cutis. Okay, okay, right here we see this is calcinosis cutis. Okay, all the findings are very important in this. Okay, in this slide and the next slide as well, the findings are very important. Okay, okay, all right. स्क्लेरोडर्मा हमने जो है मेडिसिन में बहुत बहुत पढ़ते हैं ना, राइट, इसके बारे में बहुत बहुत पढ़ते हैं मेडिसिन में हम लोग, ठीक है। तो इन स्क्लेरोडर्मा व्हाट यू सी over here, you see this is the thickenings which are there, right? Yes, the no phenomena is also there. So scleroderma में क्या है, अगर वो limited हो या systemic हो, ठीक है, या diffuse हो, ये भाई there is fibrosis everywhere, fibrosis everywhere, ठीक है, that is that one thought you should have in our mind, ठीक है। Over here you see in Raynaud phenomena, it shows Raynaud phenomena, right, is one of the point of crest syndrome का एक point है ये। So in this what is actually happening is, you see, because of vascular malformation, yes, because of vascular malformation, we have this feature that is Raynaud phenomena. Okay, scleroderma only in skin, that is morphia, linear morphia. Okay, आओ इसको पढ़ते हैं ना, ये क्या चीज़ है, ये linear morphia क्या होता है, ठीक है। Over here you see, right, in the patient, this is just like a sword appearing, like भाई तलवार जो ली है और सीधा ऐसे मार दिया है ना, ठीक है, तलवार लेके सीधा मार दिया जैसे, वैसे ही लग रहा है ये, है ना, linear pattern which is seen in this patient, right, you see over here in this one as well, this is linear morphia. जरूरी नहीं है कि ये सिर्फ आपके जो है ना ये फोरहेड पे ही हो, ठीक है, बॉडी में कहीं भी हो सकता है, ठीक है। द नेम इज स्कोप दे साबरे, इट इज लाइक अ स्वॉर्ड। ओके, find this has the crest syndrome. These are the features of crest syndrome as well. Okay, I will not be going into this detail. Diffuse systemic sclerosis which is there, okay, diffuse systemic sclerosis which is there, इसमें क्या क्या चीज है बताइए, है ना। Over here you see mask like faces are there, okay, है ना, pulmonary fibrosis are there, mask like faces is there, and this is anti-topa isomerase 1. So this antibody, this thing is very important in this one. Okay, microstomia we would see, mask like faces we would see. Okay, these two things are very important in this. Over here, this, yes, and over here in this, like reactive skin disease, the one question is very common in all the exams. I've solved all the questions regarding FMGE, INI-CAT and NEET PG. In all this one question is very common. Fixed drug eruption. Okay, we'll be doing that. Erythema multiforme. We have target lesions, right? Okay, we discussed about this already. Fixed drug eruption में क्या है कि भाई आदमी जो है, कोई भी है जो दवाई खा रहा है, ठीक है, और उसको एक ही की जगह पे जो है हाइपर पिगमेंटेशन आती जा रही है, ठीक है। ओके, आफ्टर द ड्रग देयर इज हाइपर पिगमेंटेशन, दवाई लेने के बाद में हो रहा है ऐसा, ठीक है, दैट इज फिक्स्ड ड्रग इरप्शन, देयर इज हाइपर पिगमेंटेशन विद ईच एक्सपोजर ऑफ द मेडिकेशन, ठीक है। ड्रेस सिंड्रोम, देयर इज रैश, ड्रग रैश विच इज देयर, बट देयर इज ईओसिनोफिलिया, ईओसिनोफिल जो है बढ़ जाता है, ठीक है। अगर आपको एक पॉइंट नहीं पता है ना, द एग्जामिनर कैन रियली ट्रिक यू, द एग्जामिनर कैन रियली ट्रिक यू। यस, एरिथेमा नोडोसम हमने पढ़ा था, ठीक है, सेप्टेट है ना, सेप्टेट पेनिकुलाइटिस हमने पढ़ा था, है ना, ठीक है, एरिथेमा नोडोसम अगर आपको याद होगा, दिस टॉपिक वाज अंडर हाइपो हाइपोडर्मिस, राइट, वी रेड द क्लासिफिकेशन जो था हमने पढ़ा थी बात ये, ठीक है। This is a self-resolving condition. Okay, so we are done with the connective tissue disorders. Now we just go on with the miscellaneous topics. Okay, so I'm very happy, that we could complete this, because earlier I was thinking, that how would I be able to complete this whole thing that I made, all these mind maps and everything that I did, because usually what happens is, the derma has been taught in a very, you know very crisp manner, right? Yes, this is the last slide. Yes, this is the last slide, and all right, so we just start with it. That is the neurofibromatosis. ठीक है, neurofibromatosis start करेंगे. Yes, Ravi. Yes, thank you so much. Thank you so much. All right, so neurofibromatosis में एक्चुअली क्या हो रहा है ना, इसके अंदर आपको दो तीन चीजें जो है याद रखनी है एज फार एज डर्मा इज कंसर्न, ठीक है। इसमें जो अगर आपको ये 5 इमेज याद हो गई ना, ठीक है, तो लाइक ऑल गुड, यस ऑल गुड। इसमें आप देखिए, this autosomal dominant condition there are two types, there is NF1 and NF2, ठीक है, NF1 and NF2 है, ठीक है, ओके। फाइंडिंग जो है मैं सीधे सीधे बोल रहा हूँ आपको, जो है आपको याद, आपको पता होनी चाहिए। नोड्यूल्स विच आर देयर, राइट, नोड्यूल्स विच आर देयर, राइट, इट कुड बी व्हाट, elevations which are there. Yes, we read about these elevations. Yes, these are the buttonhole sign. Just buttonhole signs which are there. Okay, fine. Buttonhole sign, ठीक है ना, ऐसे दिख रहा है ना? ओके, बटन जैसा है ना, ठीक है, बटन होल साइन विच आर देयर। ओके, द नेक्स्ट अप वी हैव इज कैफे ऑले स्पॉट्स। कैफे ऑले स्पॉट्स, यस, उसमें क्या है एक्चुअली, व्हाट इट इज, यू नो, दिस इज द कैफे ऑले स्पॉट राइट हियर। यस, right here on top of the latte, right, we see this photo. Yes, it's been taken by me. Definitely, if you anytime you go to Beijing, right, and in China you go to Beijing, you go to this cafe. It's a Cabo cafe, right? It is very I love this cafe. I used to go here a lot of times. Yes, so this is something which, you know, uh, we can use as a correlation over here as well. Okay, fine, this is the cafe all spot. And how about here, what is this? This is the iris nodule. This is the iris nodule, right, in the eyes we see. This is these things you see. This is an image based question. This is an image based question, right? Okay, fine. Right over here, what do you see over here? This is axillary freckling. Axillary, this is an axilla. Yeah, this is an axillary freckling you see, right? Okay, fine. In this, what it is, it is an NF1, axillary freckling. Okay, in NF2 you see no, there is no skin manifestation, no skin manifestation. Crow sign, yes, crow sign, Riti Kumar, you are very correct. Crow sign which is there. Okay, all right. Next up we have melanoma. Yes, melanoma may two three things are very important. Yes, so if you know these two three things, then you know, the examiner cannot fool you. One of the thing is how will you diagnose, and what is the most important factor, right? Yes, which is used for the prognosis. Okay, fine. Melanoma में first चीज क्या है भाई? It is fair skin tanning beds, right, है ना, quantity of nevi in the body, क्योंकि अक्सर क्या होता है ना, कई लोगों की बॉडी पे बहुत सारे देर आर दिस नेवाइज, यस, ओके, जो मस्त होते हैं, काफी सारे होते हैं ना, ठीक है, तो इट इज ऑल्सो प्रीडिस्पोजिंग फैक्टर। ओके, most common presentation, yes, over here is ulceration. Yes, ulceration would be there, and change in the color and size. Yes, and new moles are being developed, that could be predisposing for that. Okay, fine. What is very important over here is this classification. Yes, this classification is very important. Okay, A B C D classification जो हम बोलते हैं इसको, ठीक है। A goes for asymmetry, borderline irregularity, color variation, diameter, and evolution of the skin. Okay, that is something which is very important. But the most important factor is, like, you know, the depth. The depth, ठीक है। आप लोगों को लगता होगा कि भाई कितना कितना फैला हुआ है वो उसका आंसर होगा, but the answer is the depth of invasion of this, right? That is one thing which is very important. Okay, depth of invasion. Okay, that is here during the physical examination, right? This one point I wanted to include over here. Yes, so on the physical examination, what is important is, yeah, the whole body should be examined properly, right? क्योंकि जो मोल्स है वो कहीं भी हो सकते हैं, है ना, मोल जो है वो कहीं भी हो सकते हैं, ठीक है, इस वजह से द होल बॉडी नीड्स टू एग्जामिन प्रॉपर्ली। गोल्ड स्टैंडर्ड क्या होगा बताइए? डेप्थ इज द डिग्री ऑफ प्रोग्रेशन। यस, 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 ओके, ऑलराइट, फाइन, okay. Over here, the gold standard thing, what we need to do is we need to take a biopsy. Yes, we need to take a biopsy of it. Okay, excision biopsy, and then we can do it. Fine. Okay, so fine, 8 minutes down, we will discuss about this one, that is a tubular sclerosis. Okay, tubular sclerosis, that is the epiloia. Epiloia is one word that we need to remember, in epiloia, ठीक है, इसमें ये रहा वर्ड, ठीक है, एपिलोया हम लोग करके याद करेंगे इसको। ट्यूबरस स्क्लेरोसिस, दैट इज द बॉर्न विल डिजीज विच इज देयर। ओके, व्हाट इज हैपनिंग इज एपिलेप्सी, एपिलेप्सी, ईपी, लो आईक्यू, राइट, एंड एडिनोमा सिबेशियम। थ्री थिंग्स, ओके, थ्री थिंग्स विच आर देयर, लाइफ इज सेट। ओके, ट्यूबुलर वेरी इंपॉर्टेंट थिंग है ना, ठीक है, आपको डेफिनेटली एग्जाम में जो है याद करके ही जाना है ये बात, ठीक है। इट इज एन ऑटोसोमल डोमिनेंट डिजीज, यस, एंड वेरियस हमाटोमास आर फॉर्म, ठीक है। दो कॉन्सेप्ट यहाँ पे होते हैं, एक तो होता है हमाटोमा, एक होता है कोरिस्टोमा। एक होता है हमाटोमा, एक होता है कोरिस्टोमा, ठीक है ना। हमाटोमा क्या होता है बताइए, कोरिस्टोमा, डू यू गाइस नो द डिफरेंस बिटवीन दीज टू? यस, कोरिस्टोमा इज नॉर्मल टिश्यू एट एन एबनॉर्मल साइट, है ना, ठीक है, नॉर्मल टिश्यू एट एन एबनॉर्मल साइट। Okay, hematoma is a normal tissue, it is an abnormal tissue at a normal site. ठीक है, ये दो, it is like a patho concept, you need to know this. Okay, that is what it is, that is hematomas are there, हर जगह hematoma है बीमारी में, ठीक है. It could be in the renal area, it could be in the retina, it could be in the cardiac area. That is a rhabdomyoma. Yes, yes. Okay, fine. Right over here we have these ash leaf macules. Yes, ash leaf macules which were there. Okay, somebody in the chat, right, who he wrote ash leaf macules when we were reading about psoriasis. Right, we have the, what are these? This is the ash leaf, right? Ash leaf macules which are there, right? So it almost resembles the leaf, right? That is how it is. Fine. These are the hypopigmented macules which are there. Okay, that is one thing. So okay, but the thing is, it is only significant when there are more than three. More than three, if it is there, only then it is significant. Other than that, it is no worries. What you see over here, it is adenoma sebaceum. Adenoma sebaceum. Okay, ये जो हम पढ़ रहे थे यहाँ पे, ए जो था इसका, ये ए जो था इसका, ठीक है, यही है, ठीक है, ये जो था इसका यही है, दिस इज एडेनोमा सीबेशियम. ओके, ट्यूबरस स्क्लेरोसिस का जो कैरेक्टरिस्टिक फीचर है, जो एपिलोया का जो हमने पढ़ा था, वो है ये, ठीक है ना, epilepsy, low IQ and adenoma sebaceum. Okay, this is what it is. All right. So these are the findings of it, right? And over here we have this patch, right? This patch, right? This is what it is called as. Tell me, shagreen patch, shagreen patch, right? This is the shagreen patch we see. Okay, it is very rough, leathery like skin. Okay, and over here can anybody tell me the name of the tumor? Tell me, can anybody tell me the name of the tumor? Yes, shagreen patch is this one. Okay, shagreen patch is this one, the one in the middle. Okay, yeah, and this tumor, what is this tumor? These are the, tell me what is it? Kokenberg tumors, right? Yes. Okay, very odd location of the tumors. Okay, see where it is happening. Yes, this image is like a straight up pointer, right? So in the miscellaneous topic and in the cutaneous disease as well, right? So you should know all the images regarding this. Okay, that is one thing we should be very careful about. So vascular regions. Okay, this is infantile hemangioma. Yes, we see infantile hemangioma, and when we press it, yes, it blanches, like the color, it fades, the color fades away. Okay, when we press on this, yes, because there are these capillaries in it, right? Okay, when you press it, it fades away and then it regains back the color. Okay, that is all about that. Okay, vascular malformation, you see, this is the port wine stain. This, you see, it is a port wine stain, it does not blanch, it does not blanch. Okay, it in Sturge-Weber syndrome, this is something which is very important in Sturge-Weber syndrome, right? Okay, and it involves the trigeminal nerve, and in it the ophthalmic division is involved. Okay, all right, that is one thing. Okay, so that was the last slide about. Yes, so, and if you guys have any questions or something, we can definitely take up. And if you guys want me to explain any other thing, right, so that is also fine. No worries on my side. I guess if you guys want me to explain uh, Hansen's disease, once again I can do that, and the session is over. Like the whole, we have completed all the topics, right, in very great detail. And whoever is listening to this session, right, these are my pioneer students, because this was my first session, right, that I took online. So I just want to thank you guys, right, for just being there with, for listening this whole session. I'm very delighted, right, to share my time and knowledge with you guys. Yes, so uh, that is all for today. In case you guys don't want me to explain anything else, you don't want me to repeat any topics, we can conclude this session. What was that tumor on the foot? Yes, this was a you see right here, Abdullah Sheikh, you're most welcome, you're most welcome, right? Yes, Shaurya Trivedi, you're most welcome. Okay, right here you see, यहाँ पे ना पेरिअंगुलर ट्यूमर्स हमने देखा था, है ना, ये रहा कोनियन ट्यूमर्स, राइट? ओके, thank you so much, thank you so much. Yes, everybody, thank you so much. Okay, fine. So we will conclude this session. Thank you so much for bearing with me. Yes. So in case I did some mistakes and stuff, so I'm sorry for that. Do reach out to me. Yes. And definitely these are my handles. Yes, my social media handles which are there, right? You can definitely, this PDF will be shared. It's already been shared, right? Uh, you guys can reach out to me, and if there is anything, I could definitely help you with it. So that is all about Dermatology Express rapid revision. I hope I did justice. uh, सर वो टेबल वाला ट्राइकोफाइटन करेक्शन, ठीक है चलो कर लेते हैं ना, वो करेक्शन कर ही लेते हैं अभी। ठीक है चलो, फंगल में देखा था हमने। ठीक है, अब इसमें देखो है ना क्या हुआ था कि जो ई है, एपिडर्मोफाइटोन है, आई विल जस्ट इरेज ऑल। ठीक है, फाइन। ओवर हियर यू सी, यस, सो Abdullah Sheikh, yes, okay, fine. We would go through this table once again, right? Over here, the mnemonic was that E will not affect the H. E will not affect the H. Okay, E was epidermophyton, okay, and H was hair. E will not affect the hair, okay, and M will not affect the N. Okay, so the microsporum will not affect the nail. Okay, so the microsporum will not affect the nail. Okay, that is one thing which is there, and skin is been affected by all of it. Okay, trichophyton, microsporum and epidermophyton, right, these three are there, they would definitely affect the skin. Hair जो है वो epidermophyton नहीं कर रहा, epidermophyton नहीं कर रहा, ठीक है, और नेल जो है ना, ठीक है, माइक्रोस्पोरम नहीं कर रहा, ठीक है। तो अगर हमको इतनी सी बात हमको याद है ना कि ABCD अगर हम लोग को आता है सही से, ठीक है, तो क्या होगा, वी विल नेवर गो रॉन्ग ओवर हियर। ओके, and I'm sorry, like, when I was discussing about it, I wrote this table incorrect, so now I'm correcting it. Thank you, Abdullah Sheikh, for pointing this out, and now the things are very clear. Okay, all right, yes, Riti Kumar, thank you so much, thank you so much. Okay, so that is all for this session, right, guys. Thank you so much for giving me your time. Okay, done, sir. You're most welcome, you're most welcome. Abdullah Sheikh, you're most welcome. Yes, so everybody who has given all the right answers, I hope we can, life is set. Yes, definitely life is set. Definitely life is set. Okay, all good, all good, it's all good. Yes, ठीक है फिर, fine, we will end the stream right here. Okay, thank you so much for bearing with me. Okay, thank you so much. Bye bye, good night.